She has a diverse Thank you, Amy. Okay. She has a diverse background in caring for captive wildlife. She began her career in 1989 as a docent, a volunteer, a zookeeper, and ultimately a veterinarian at the Oakland Zoo. Her lifelong passion for elephants was deepened during her time as an elephant keeper when she played a key role in hand-raising an African elephant calf. A 2001 graduate of UC Davis School of Veterinary Medicine, Dr. Guy has since dedicated her career to caring for wildlife in a variety of settings. Currently, Dr. Guy serves as the Director for Veterinary Services for the Performing Animal Welfare Society, where she oversees the care of rescued and retired animals, including elephants, large carnivores, and bears at PAW's 2,300-acre sanctuary in the Sierra foothills of Northern California. She was the head veterinarian for the Mickey Grove Zoo from 2002 to 2009 and has provided expert care through her mobile practice for a wide range of species, including small exotic cats, reptiles, birds, and camels. She has also provided relief services for facilities housing marine mammals, elasmobronchs, I hope I'm saying that right, and fish. A strong advocate for community service, Dr. Guy has served on several advisory committees to improve animal welfare, including the California Department of Fish and Game Directors Advisory Committee on the Humane Care and Treatment of Animals. She is a member of 2 veterinary disaster response teams, volunteering to help animals affected by oil spills and wildfires. Dr. Guy has been actively involved in rehabilitation and release of California native wildlife, including raptors, seabirds, and small mammals. A firm believer in the power of mentorship, Dr. Guy is passionate about paying forward the guidance she received throughout her career. She enjoys working with veterinary students, fostering empathy and commitment to the well-being of wild animals in captive environments. Our greatest fulfillment comes from caring for the special medical needs of elderly animals. Thank you. Go ahead, Dr. Guy.
Oh, thank you so much. Can you hear me? Can you hear me?
Yes, we can hear you. Sorry, the mic takes a while to come back on.
Okay, cool. Thank you for that introduction. I wasn't expecting all of that. So before I start with this talk, I just want to apologize for not being there. It was really important to me to be there with you guys. I love meeting students and speaking in person. I do a whole lot better in person, so bear with me with this Zoom thing. I will try to do my best with slides, but I really enjoy being there, and I'm there with you in spirit. As you said, I have helped out in a lot of disasters, and I really feel for you guys, all the people, all the animals, the pets, the wild animals, first responders, all of that. It's very much on my mind and all of your minds, and my heart goes out to you. So I just wanted to acknowledge that before we go on. Thank you for the invitation to speak. So with that, we'll get started. So everybody likes to hear an origin story of how vets get into the jobs that they get into. So I'm going to tell you a little bit about that, what my background is. It's a little bit unusual. I did not do an internship or a residency, and I'll explain that as we go. I'll tell you a little bit about PAWS and what we are and what sanctuary represents. I'll do a brief comparison of sanctuaries and zoos and talk about my favorite topic, which is elephants, and touch on some animal welfare issues in captivity. And finally, if we have time, just a brief mention of your welfare as a zoo veterinarian or a wildlife veterinarian, how to thrive in zoo practice. So it's a lot. That's a lot. So this will be an overview, but hopefully you'll have some key points that you can take away, things that will be helpful to you. So I was born and raised in Honolulu, Hawaii, and that's me. That's baby me back in the 60s at the Honolulu or Waikiki Aquarium. Actually, that was a big tank with, I don't know, 15 or 20 sea turtles in it. And I was fascinated with zoos and aquaria as far back as I can remember. And the picture on the right there was taken at the Honolulu Zoo. So those of you that know Hawaii, that's diamond head in the background. I took that picture myself when I was about 6 years old. So I've had a lifelong fascination with wild animals, exotic animals, and was an only child. So my mom would drop me off at the zoo in the morning and pick me up in the evening. That's how obsessed I was with the zoo world. So it goes way back. It's in my blood. My first actual working experience in a zoo was at the Oakland Zoo. I started out there in 1989 as a volunteer. I was actually their first animal care volunteer. They didn't allow people to come in and help work with the animals or clean up after the animals. It was, not something that they did. They only had 2 volunteers at the time and they picked weeds, basically. So I talked my way in there. Now I understand they have hundreds of volunteers and it's a thriving program there at the Oakland Zoo. So after my volunteering, I moved into becoming a docent where I did some of the wildlife theater shows and helped train birds of prey. For that, I became a hospital keeper, then was hired as a zookeeper, and then jumping way forward after my graduation from Davis, ended up as a part-time associate vet. So I have a long history there, and I'm grateful to the Oakland Zoo for all of the experience and knowledge that I gained. If you notice the theme here, there's a lot of picking up food involved in taking care of animals, and that kind of hands-on experience is really, in my experience, the best way to learn about them. Not to diminish my education as a veterinarian, but I think that my experience as a zookeeper and being, really, really intimately involved in the day-to-day husbandry of animals really taught me the most practical experience. And that's a big part of my practice, is just understanding, that end of things. Throughout my volunteer and veterinary experience, I've worked with a variety of facilities, not just sanctuaries, not just Oakland Zoo, but I've done a fair bit of wildlife rehabilitation, both as just a rehabilitator and also as a veterinarian. I've worked for theme parks. I've through my mobile practice, I've worked with a lot of private exotic pets and other facilities that do educational programs. My special interests are in the care of elderly animals. That's just a subject that's near and dear to my heart. And working in a sanctuary like Paws, we see a lot of animals that have been through really horrible early life experiences. And so I really enjoy seeing them come to our place and getting to know them and helping them heal from those past experiences of abuse and neglect. I'm also interested in just overall the topic of animal welfare and some of the ethics of captivity, and I enjoy having those kinds of discussions with people in all walks of life. I have 35 years, I believe, of experience working with elephants. As I said, it started at Oakland Zoo. I was a elephant keeper. I completed a month-long externship at the Oregon Zoo during my veterinary curriculum and focused on elephants. And I've both worked at Marine World and Six Flags, and I've also done externships there. So I have a long history helping them out throughout the years and learning from them. They no longer have elephants, but at one time they did. And of course, I've been with Paws since 2001, where I've been caring for a total of 19 elephants at Paws. So speaking of Paws, this is a picture taken from the top of a hill. It's an overview of our sanctuary. It's 2,300 acres. It's in the California Sierra foothills. The fence that you see in the front view is elephant fence. And the elephants have anywhere from 100 acres to several hundred acres, depending on which enclosure they're in. It's a beautiful setting. It's quiet. It's not open to the public, although we do have periodic educational tours. So what is a sanctuary? A sanctuary is, there's no official definition, but in my mind, it's a peaceful, permanent home for a variety of animals that have been retired from zoos, from circuses, confiscated illegal pets, rescued, as I said, from abuse and neglect. We receive a lot of animals through law enforcement, California Department of Fish and Wildlife and USDA confiscations, and a few animals that are non-releasable problem wildlife. So bears and other animals that either are wildlife rehabilitation failures or who have, approached people or inappropriately for attention. So I just like to say that I serve the residents of a fabulous retirement community. PAWS was established in 1984. We just celebrated our 40th anniversary. These two folks started this entire organization and sanctuary from scratch. That's Ed Stewart, who's still our chairman of the board, and Pat Derby, who passed away from cancer about 10 years ago. But these were my original mentors in learning about the issues around some of the dark underbelly of captivity and what can happen to wild animals in bad situations. So I'm grateful for them. This is a picture of Pat Derby with the very first elephant resident. Her name was 71. And I'm going to try and keep on time here because I could tell you a whole story about her, about this elephant, but we'll move on. So this is a picture of myself and one of our longtime associate vets, Dr. Jennifer Glavis. And on the left there, that's our RVT, Lynn Dowling, who's been with us for many years. Both of these ladies have been with us for 12 years. And we also have a group of about 5 highly qualified veterinarians that provide on-call services as well as on-site work. We have a brand new, well, it's not brand new anymore, it's about 6 years old, but a clinic, a fully functional clinic with all of the bells and whistles that you would want in a zoo hospital. Just about the only thing we can't do is a CT. So what's cool about this new clinic is that we can get veterinarians from Davis to come up and help us with big procedures, and other specialists come in to do surgeries and ophthalmology and things like that. So we no longer have to carry or take the animals down to Davis in a trailer. So it is improved animal welfare for the residents of the sanctuary. So occasionally we have to take the clinic to the animal. And this is a picture of an anesthetized procedure, a dental procedure that we performed on an African elephant. This picture just shows a subset of the people that were involved in that procedure. It was over 35 specialists from all over the world that came to help Maggie the elephant. So all of our equipment is mobile, portable, most of it's battery powered, so we're very flexible in how we provide veterinary care. So currently, we've had a whole lot more in the past, but currently we have 8 tigers, 2 bears. We have a bobcat. We have 2 capuchin monkeys, a muntjac, if anyone knows what that is, a little tiny cervid species. We've got 3 Asian elephants that we care for, 2 bull elephants, 1 female, and then we also have 3 African elephants, all female, and 6 emu. So it's quite an interesting collection of animals, all of them have come from various captivity situations. It's too much for me to go into right now, all their different stories, but if you ever get to come on a tour, we introduce you to the animals and explain, where they came from. We have natural lakes that they enjoy swimming in, as well as, I have a picture here. Yep, we have an indoor pool in our African barn. And so in the past, we've had elephants with arthritis that really enjoy floating and splashing in those pools. I just want to put a shout out to my favorite elephant here. This is, well, we don't have favorites, right? But this is my favorite, so don't tell anyone. This is Prince, and Prince is 37 years old. He's a castrated Asian bull that was born at the Oregon Zoo, and was sold to the circus. So this was back in the day when that was a common practice. And he traveled with the Ringling Brothers Circus for a bit until they realized that he wasn't going to perform for them. And so he was basically retired to a small facility that they have. And we took him in about 12 years ago, and he's become a favorite of mine. We've taken in animals from circuses. As I said, this was an actual picture of how lions in the Bolivian circus were transported around. And we took in four lions from this circus. It was, I believe, about 12 years ago that Bolivian citizens voted to just ban circuses in the country of Bolivia. So all circuses had to get rid of their animals. So one group came in and took all the lions. We received 4 of them. And I have to tell you that I actually have a paper in the process of being published, because 3 of those lions died of mesothelioma within a few years of coming to us. So interesting, but probably a result of the way that they were kept. But again, that's a story for another day. This is just a picture of Ben. He's a captive-born, man-made hybrid between a grizzly and a black bear. He was completely declawed by his owners in North Carolina. The picture in the upper right is the enclosure that he lived in for many years. Never had grass under his feet. And at our place, he's really enjoying a large enclosure with oak trees. What's interesting to me is that even though he was captive born, he knows how to go up to an oak tree and shake it and shake down the acorns to eat them. So it just goes to show that their wild DNA and their wild instincts persist. I just want to put a shout out to this incredible rescue that we did. It's been many years, but I never want anyone to forget it. There was a facility in Fulton, California. You guys know where that is, close to you. Fulton, Rialto. It was called Tiger Rescue. That's a picture on the left from the facility. There were 90 dead tigers on the property when the Department of Fish and Wildlife shut it down and placed all of the animals. Paws took 39 tigers. That was my job, to bring them all up to Northern California to our sanctuary. And it's an experience that really opened my eyes to the problems, and I learned a lot from it. And there's actually a short documentary that I encourage you to watch called 39 Tigers. Quite something to see. Most of our tigers come from facilities that do cub petting. So it's a thing. It's a thing mostly in other states. It's become illegal in California to do this sort of activity, free contact with tigers. And most of you have seen Joe Exotic's show, Tiger King, and you're more aware of this kind of thing, but it's still going on in some facilities, and it's a real tragic kind of a puppy mill for tigers. So a lot of our tigers are rescued from those kinds of situations. So the similarities, at least as a veterinarian, we're not going to talk about the differences otherwise, but from my perspective as a veterinarian, there are more similarities between what we do in a sanctuary and what a zoo veterinarian does. So we maintain the health of all the residents in our collection. We are the experts that advise keepers on husbandry, diet, and care. Of course, medicine and surgery are the same wherever you're practicing, as is preventative care. Some of the differences, and the lines are becoming more blurred, so this is not a black and white statement at all. But sanctuaries are generally focused more on animals as individuals and providing a permanent lifetime home from cradle to grave, if you will, for individuals. Whereas in the zoo, the focus tends to be towards that individual's value to its group or its species. So its conservation value and those animals in zoos that are managed by SSPs or species survival plans, decisions are made about them based on what the SSP needs or what conservation requires. So it's a different focus, and this is not to say that zoos don't care about animals as individuals. I want to make that clear. And that focus, so the way that you view an animal in your facility influences decisions about whether or not to intervene medically in certain things, and timing of euthanasia, the reason for euthanasia. So in this picture, we are giving, this is one of the Bolivian lions, and we were doing a vasectomy because we were hoping to put the female of the group in with them, but it never did work out because they all came down with mesothelioma. So. Again, this is just going to be an overview. We're not going to be able to delve into any of these topics in depth, but I wanted to highlight some of the current topics that are discussed in zoo animal welfare. First of all, not all zoos are created equal. I would say, and I don't know where I received this percentage, but less than 10% of all the facilities that call themselves zoos are actually accredited by the Association of Zoos and Aquariums. The AZA has very high standards as to every aspect of animal care, and thus an AZA accredited zoo is among the top, the top types of zoos. So anything that's not AZA accredited doesn't have to comply with those high standards. So what kinds of zoos are not accredited? Well, they're known as roadside zoos. There are still a few of them in California. There are many, many, many roadside zoos in other states. Every state that I can think of that I visited has a lot of these facilities. So other topics that are discussed are space requirements for different animals. There are tons of studies out there about the space requirements for elephants. We'll get into that a little bit. Appropriate climate for different species. Training and handling techniques are a big topic of discussion. For example, two different methods for handling elephants in captivity are protected contact and free contact. We don't have time to go into the differences, but at PAWS we practice protected contact, and here I'm collecting a blood sample from an elephant's ear. Other topics are how do you provide for social needs in gregarious species, measuring, characterizing, and improving animal welfare. This is a shout out to the American College of Animal Welfare, which is a new, well, not new anymore, but it was new 5 or 6 years ago. It's a new board specialty that veterinarians can acquire. I've thought about it. I've been to many of the board prep classes. It's really good information. And I encourage you to look into that if you're interested in animal welfare. And of course, a big topic in welfare is how to assess pain, how to measure pain, how to provide safe and appropriate analgesia for different species. So supporting expression of natural instincts and behavioral needs is a huge, huge focus of animal welfare in captivity. We can address those needs through the use of enrichment, through the way that we design an enclosure, and through different husbandry techniques that can enhance the quality of an animal's life. Just quickly, this is a picture of a like a piñata. So it's completely edible, supposedly, and it was covered with camel hair that was groomed off of the camels at the Oakland Zoo. And of course, the tigers would charge out of their dens and attack this thing, and we didn't have any hair obstructions that I can recall, but it was a big hit. Other topics include captive breeding, when and when not to breed, why to breed, what to do with surplus animals, the pros and cons of contracepting animals, individual animals as ambassadors for their wild counterparts, which is central to a zoo's mission, and the whole topic of frozen zoos saving species from extinction when wild habitats are rapidly disappearing and we may not have a place to put those animals. I think we could talk on any of those topics, honestly, for a couple of hours, but I'll keep moving on. So captivity influences longevity in two different ways. It can actually extend the lifespan of animals that would otherwise have to really be in top form to function in the wild, such as a lion. In captivity, it's very common for big cats to live into their late teens and even into their 20s with poor eyesight, chronic kidney disease, arthritis, and all the things, dental disease, the things that you see in your domestic cats, we also see in the big cat. On the flip side, captivity can also shorten lifespan. Most notably in elephants, there are other species too, but we definitely see the early development of old age conditions like arthritis in elephants that aren't necessarily seen as much in their wild counterpart, at least to the degree that we see that in captivity. Other problems seen in captivity include declawing of large felids. Now, during the course of my career, I've seen this less and less. There are still people that perform this or attempt to perform this procedure illegally. It's been made illegal by federally by the USDA, but it still occurs. And there are still animals alive now in captivity who were brutally declawed, and they're suffering the consequences of that. Inadequate early nutrition can lead to things like metabolic bone disease, which can predispose to arthritis later in life. This is a picture, an X-ray of radiograph, of Denny, the lion, who not only had a botched declaw, but when we finally did get radiographs, which we're doing here, he was target trained, put his paws under the fence. We discovered that he had a genetic a deformity called syndactyly or lobster claw. So he was part of a breeding mill in Michigan where they were breeding a lot of lions that had this genetic tendency. So he was always limping and arthritic and crippled throughout his life because of this. So this slide reminds me that it's time to talk about elephants. Their potential lifespan is really long, but the most common cause of death in captivity is euthanasia due to arthritis, foot infections, and musculoskeletal disease in general. Arthritis in elephants is multifactorial. Arthritis and foot problems are seen together. They often have poor conformation, pigeon-toed, carpal valgus, stereotypic rocking and swaying, causes abnormal weight bearing and pressure on their toenails, and lack of exercise and small boring enclosures is a big deal. On enclosure size, I wanted to say it's not all about size, it's about complexity with elephant habitats. You can have a habitat that's enormous, but if it's flat and there's nothing to do and they can see from one end to the other, they're not typically going to use it or exercise in it. They enjoy exploring and having, what's over that hill, what's behind that tree, things like that. So complexity of exhibits is just as important as size. This is a radiograph on the right of a typical, this is not unusual, of the degree of arthritis that can be seen in a very elderly elephant. This is a CT, 3D reconstructed CT scan of the arthritis that some of these animals are suffering from. They're very stoic. What I like to do is take radiographs of the joints and look for things like this periarticular lipping. I don't know if you can see my cursor, but what we're showing here is some attempts at bridging the gap here. This is arthritis. And when we see that, we can assume that there's arthritis elsewhere in the body and be proactive about treating that. Foot infections are common. They stand in their own waste if they're not moving around. People may or may not be doing adequate foot and nail care. They stop lying down, which affects their circulation. Circulation is very important in foot function. So this picture is a happy elephant that's asleep. She's not collapsed, but sometimes elephants will just collapse. There are various reasons that I've listed here. One of which is the fear of lying down. So there's collapse, but there's also refusing to lie down, and that's a common thing that happens in older elephants. It could be that they're in pain or that they have arthritis, but also social conflict in a group. They might be afraid to get down and be attacked by another elephant. And stress is an important thing to be concerned with, as it in any living creature can lower your immune function. And the three big diseases seen in elephants are tuberculosis, herpes virus, and salmonella. So another thing that we're learning more about is dental disease in elephants. This is a photo of the upper molars of a bull that we have at paws. The tooth that's on the right here is extremely abnormal. That's not a normal molar. The thought is, this is not my theory, it's the veterinary dentists that deal with elephants, is that as a calf, they had poor nutrition. A lot of them were pulled from their mothers. They were culled from their mothers and didn't have adequate nutrition when they were kids. And so all of the germinal buds of all of their future teeth were deformed before they erupted. So by the time they erupt, they're already deformed. And we've seen that in a couple of our elephants. And again, this is Maggie, the elephant that we've done 2 procedures on to try to extract some very deformed molars. Another issue that I've been intimately involved with is maternal rejection and aggression towards babies. This is an aberrant behavior that's not seen in the wild, where calves are, we've all seen those documentaries and know that mothers and aunts and grannies, it's a maternal or a matriarchal society in the elephant world, and they treasure every little baby is protected. And unfortunately, that's not always the case in the captive environment. And so this is a picture of Lisa, who gave birth to Kijana, and we tried multiple times to introduce them, and she wanted to kill him. So he was hand raised and ended up passing away from the herpes virus at the age of 11 months. First African elephant to die of that disease. Here are some of the other reproductive complications that can happen in a captive environment. I'm keeping an eye on my clock, so I'm kind of moving a little bit fast here. But training is critically important to all captive wildlife, but particularly elephants, and veterinarians should absolutely be involved. Here we're taking radiographs of the carpus of an elephant. Training is, of course, great for us to allow examination, observation, but also develops a relationship of trust between the vet and the animal. And it's good for them. It's physical therapy to do different things, and it's also engaging their mind in a form of enrichment in and of itself. So all of our elephants are trained for blood collection, radiographs, dental checks, all of that. And here we are doing target training for this elephant to present her foot. And blood collection from our bull. And this signals a subject change. So just wanted to briefly touch on end of life considerations. There are quality of life assessment tools that are being developed and used in captive environments. And every facility should have an assessment tool that's developed specifically for their collection with their team that works for all of the folks that work there. One of the factors that you need to pay attention to is animal pain being addressed? How can we tell if they're in pain? There are objective grading criteria that help you know day to day if it's getting worse, better. And I believe, and I know for a fact, that animals can have a good quality of life into old age with the proper attention to their needs. One of the biggest things that I've learned as a zoo vet is to really encourage open dialogue with caregivers. They need to trust us and feel safe sharing observations. I've worked in situations where keepers were afraid to tell the vets about an observation because they felt that the vets were not listening to them and would make decisions without taking their feelings and their opinions into consideration. That's a very bad situation for morale, and it's bad for animal care. So you need to develop a trusting relationship with your staff. So what can we do as veterinarians to improve animal welfare? Well, at the animal level, obviously educate caregivers about improving the conditions for the animals under their care, speak within your organization, advocate for the animals based on your knowledge and your education. At the organizational level or facility level, as I said, communicate, collaborate, and be part of the animal care team. Working towards elevation of care. When you know better, do better. And at a societal level, what we need to do is join professional organizations, publish, speak, and write, express yourself, and share your expertise. I've been lucky to have incredible mentors throughout my career. This is Dr. Murray Fowler, who I got to learn from at UC Davis. It's very easy to become isolated in any veterinary profession, whether you're in small animal, large animal, or zoo work. So you need to actively be involved, connect, and maintain those relationships. I want to mention moral distress. It's an issue in our profession, as we all know, that we have a mental health crisis, and moral distress occurs when you feel that you know the right thing to do, but for whatever reason, you're not able to pursue your desired course of action. So there's a lot of research looking into this. There is no answer yet other than connecting with others, speaking, and not isolating. A big thing that I like to pass on to students is to find your own inner moral compass. Pay attention to situations that make you uncomfortable. You're not going to know what your triggers are as you haven't experienced them yet. The the zoo world is exciting. You don't know, what it's like until you get there. There's a lot of politics. There's a lot of external politics from the public, internal within your facility. There's a lot of things that go on, and there's a lot of ethical decisions and moral decisions that have to be made. And so if something makes you uncomfortable, pay attention to it and um, try to connect with what it is that is important to you, because that will help you define over time, your own values, and will avoid that sort of moral distress where you don't know what's going on, but you know something is wrong. Well, anyway, this is my email address. Any of you are welcome to email me. I feel like we did a whirlwind tour of all these topics. But it's been a pleasure speaking to you and an honor to be invited to be part of this symposium. If you have any questions, let me know.
Thank you, Dr. Guy. That was a great presentation. Does anyone have questions for Dr. Guy? Either in person or on Zoom?
What does the training process look like when the animal's already presenting to you in pain? So you don't already have that like buildup of trust. Like the thought that I have is that lion that had the botched declaw surgery. Like I can't imagine how painful he would be when you're trying to teach him to allow that touch. And how do you deal with that in such a big species?
Wow, that's a good question. It's really dependent on the individual and on the species. Elephants are a whole different category. That particular lion um, I wouldn't call him docile or friendly or sweet or anything like that. So his personality, just to begin with, was rather aggressive. So training, that's actually something that you can use to shape that behavior towards sticking his paw under the fence. He wanted to get us, he wanted to grab something. So training in and of itself is a whole different specialty. And it involves, I'm not a trainer, but I've worked with some incredible trainers. It involves looking at, what is that animal's motivation? And so he wanted to get us, and so he would come over and lie down and put his foot out. So it's in that case, that was that lion. He was certainly under treatment with joint supplements, pain medications that were being hidden in his food. So we were treating his pain as best that we could. So I don't know if that answers your question, because it's really dependent on the individual very much. So we train each animal differently depending on their tendencies and their personalities.
Thank you very much.
Thank you.
Hello. Hi, I'm Amy. I also had a question about that same lion. I was kind of just wondering what the end result of that would be if he has a genetic deformity on top of the botched declaw. At the sanctuary, is it, I guess, realistic to do chronic pain management and get him to a place of good welfare and husbandry, or is it kind of more alleviating the suffering to euthanize instead?
That's a really fair question. That's something that we grapple with all of the animals. Going back to that lion, I do believe that we were treating his pain adequately. We did measure, his day-to-day progress. Um, we did a lot to ameliorate that pain, and we had ways of measuring his well-being. And he was euthanized when his situation got to the point where we could tell his quality of life was not good. So it's definitely something that we focus on every day, all as a group, is how is this individual doing with this chronic condition? Is it fair to say that, yeah, he could have been euthanized just based on knowing those chronic conditions and what they would lead to? It's a fair decision. I wouldn't criticize anyone for making that decision, but at that time, that lion was still playful and interacting with his brothers. There were two others in the enclosure, and those measures of quality of life are very important that I mentioned towards the end. I kind of glossed over it, but there were measures of, what is his daily life like? And so as long as his quality of life was good, a net good, and that we felt we were treating his pain, that's what we are here for. We absolutely euthanize animals, including elephants, when quality of life is no longer good, when their bad days outweigh the good days or outnumber the good days. That is something that we do. We are not putting animals through hospice. That's not what we do. We are very much focused on each individual and their chronic conditions and keeping them comfortable, happy, that's a horrible word, comfortable and experiencing a good quality of life as long as we possibly can.
Thank you.
You're welcome. It's a great question, though. If I can say one more thing, especially going back to elephants, elephants develop arthritis in the captive environment very young. And, you could look at a 35-year-old elephant with significant arthritis and say, well, we know where this is going. This elephant has arthritis. Should we euthanize it now? Or might this elephant have another 15 years of good life, a good quality of life with, medications, supplements, physical therapy, water, pools, laser therapy, all of the things that we do to support an elderly animal. Looking at humans, we do the same for humans. We don't say, well, at this point, we can tell where this is going, So this is a topic I really enjoy talking about and exploring. And believe me, we have these discussions quite a bit at the sanctuary, but I can see it from all perspectives. And I stay true to my commitment to each individual as a doctor to look at it that way. So I take in everybody's opinion and observations, but I'm the expert on medications, pain, those sorts of things. And so I'm going to speak up if I feel that, we're not adequately helping an animal anymore. If that makes sense.
Hi, good morning. My name's Raghav. Speaking of arthritis in elephants, I had a question regarding, because you mentioned that in captivity, rates of arthritis are significantly higher than in captivity. Have you noticed that in, for example, AZA accredited zoos versus roadside zoos, like you mentioned, or generally the larger the enclosure, that rates of arthritis tend to decrease?
Those studies haven't been done yet at all that I'm aware of. There have been a couple of papers talking about arthritis in elephants, but there's been no correlation between, larger enclosures and, less severe arthritis. It's to me, what I've seen, it doesn't matter the size of the enclosure, that they all develop it at a certain point, and it's earlier than they would in the wild. But yeah, it's something we need to definitely pay more attention to because they are so stoic. And those radiographs that I showed you, where I was looking at the carpus and the tarsus of the elephant, that's why I do those. So even if an elephant isn't limping, doesn't have a leg swelling, isn't favoring a leg, if we see those changes in the joints, I know that there's arthritis present in the body, and we're going to start treating before they show signs of pain. I've fortunately or unfortunately been part of probably 20 elephant necropsies by now, not just pause elephants, but multiple facilities through UC Davis. I've gotten to help with those, and I've seen tremendous arthritis in the neck, in the vertebrae of the neck, the back, the hips, the knees, all of the things, the shoulders especially, things that we can't easily radiograph. So there's a lot hidden inside those bodies that we're not seeing.
That makes sense. Thanks so much.
Sure.
Thank you, Dr. Guy. For the sake of time, we are going to have to move on to our next speaker, but anyone
Thank
else who
you.
has questions, you want to send her an email if that's all right.
Yes, absolutely. I love that.
Thank you so much, but we're really happy over Zoom. Dr. Jason Waters is an adjunct associate professor in the Department of Science at UC Davis. He has developed research programs at 2 large zoos and is executive director emeritus of the journal Zoo Biology. Dr. Waters co-authored the WAZA Animal Welfare Strategy, the AZA Wellbeing Strategy, and is an author of the forthcoming book, A Guide to Managing Zoo Animal Welfare, a Behavioral Approach. So thank you, Dr. Waters.
Hi, thank you. Thanks for inviting me, and I'm sorry I couldn't be there as well. I also prefer to be present and interact with people and learn from you guys when I have the opportunity to. I think I have set my talk up so that I can see the next slide in my notes, but you can only see the first slide. Can somebody acknowledge that that's correct? All right, thank you. So as was mentioned, I've worked in zoos for many years. I'm currently not working in a zoo. I left my position a couple of years ago and have been focusing on writing this book that was just mentioned, and sort of still performing adjunct duties at UC Davis. So I want to tell you about the 3 needs model of animal welfare. If I can advance my slides, I'll be able to do that. So what I'm going to tell you about is all in the book that is coming out, due out probably within the next few weeks, A Guide to Managing Zoo Animal Welfare that I wrote with my colleague and collaborator, longtime collaborator, Dr. Bethany Krebs. There are essentially sort of 3 sort of primary definitions, if you will, of animal welfare. They define welfare in different ways, and as a result, they suggest different reasons for intervening on animal welfare problems. There's a physical health and function definition, the natural state definition, and the affective state definition of welfare. Physical health and function is probably one of the earliest definitions of animal welfare, and it says that animals whose bodies are healthy and functioning normally are experiencing good welfare. The very first animal welfare professor, if you will, at a university was a veterinarian, a guy named Don Broom, and it makes sense that physical health and function is a sort of an early definition of animal welfare. Natural state definitions actually probably in a sense predate even the physical health and function. And that states that animals who can express the same behaviors as their wild counterparts do are experiencing good welfare. This is a view that often is used in the zoo world, and also the public seems to hold this view kind of, for some reason, this feels right to the public a lot of times. Affective state definitions are sort of maybe what might be considered more modern definitions of animal welfare, and those state that animals who experience positive psychological feelings are experiencing good welfare. These basically are definitions of welfare based on the emotional state of animals. When do these definitions suggest an intervention ought to come into play? Interventions are applied under the physical health and function definition when animals show signs of disease or changes to physical function appear. This makes perfect sense, right? This is this is something that adds up. With the natural state definition, we apply interventions when animals' behaviors deviate from the patterns of wild counterparts. And under the affective state definitions of animal welfare, we apply interventions when animals are experiencing negative psychological feelings. This can be a challenge to figure out sometimes, right? In the book, we make the case that the natural state definition of animal welfare is founded on sort of faulty logic. It's founded on what might be called a logical fallacy called the appeal to nature, which states that because something is natural, it must be better. Today, probably the main focus of animal welfare definitions is a sort of a combination, if you will, of physical health and function and affective state. Physical health and function often sort of drives an individual's emotional experience. And the probably the most commonly applied model of animal welfare now throughout sort of the accredited zoo world, if you will, is a model called the 5 domains model by a person named Mellor out of New Zealand, a professor in New Zealand, and his colleagues. And they describe these 5 domains: nutrition, environment, health, behavior, and mental and emotional state. The first 4 domains, nutrition, environment, health, and behavior, they don't necessarily say these are welfare. They say that these are the traditional measurable things, right? We can measure what's going into an animal nutrition-wise. We can measure the environment that it's in. We can measure the health experience the animal is having, et cetera. And the emotional experience of those things are what we expect to influence welfare. The 5th domain is welfare. That's the mental, emotional state of the individual, the psychological state of the individual. All right. This is usually inferred, as I said, through assessing the first 4 domains. And it has sort of often been described as unmeasurable. The 3 needs model that I've developed, along with my colleague, Dr. Krebs, we feel that we can measure this 5th domain through the behavior of the animals. Back in July of 2012, I got to move the pictures of everybody so I can read my notes. Back in July of 2012, a prominent international group of cognitive neuroscientists, neuropharmacologists, neurophysiologists, neuroanatomists, computational neuroscientists, et cetera, gathered at the University of Cambridge to take a look at the data, if you will, the evidence for consciousness in animals. And they settled on the idea that emotional feelings arise from a set of subcortical brain regions that are similar across species, and there are particular behaviors associated with them. They say that intrinsic self-assessment of positive and negative feelings is evolutionarily old. Individual animals essentially sort of take a look inside, if you will, reflect on how they're doing, and that sort of drives what their next move is, so to speak. The declaration specifically refers to birds and mammals, and also then skips over reptiles and amphibians and fish and talks about cephalopods and insects. Presumably, the skipped ones would have been included if there were ample evidence at that time. And it does look like there is now becoming more and more evidence that that suggests that the rest of the species should be in the mix too. So I'm sorry, I messed up my screen here. I'm not sure where I'm at. Anyway, oops. Give me just 1 second to find my slideshow. I'm going to stop the share for a second and restart. I apologize. All right, next slide. So there's this sort of emotional substrate, if you will, that is shared across species. And this is something that we work with in our development of our general concept of welfare. This concept of welfare, this three needs concept that I'm talking about, is what I would call a kingdom level individual property. It occurs across phyla and is not a species level property. And again, there's reasonable amount of evidence that supports the notion that the three motivational needs that I'm going to tell you about are shared across species and that they are of fundamental importance at the level of the kingdom, Animalia, not just certain species. I sort of years ago started looking for a general approach to animal welfare because when I was working at Brookfield Zoo in Chicago, I realized I have to think about how to support the welfare of many, 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 many species. And so trying to become an expert in every single species was impossible. And to learn the specific welfare needs of every individual species was unachievable in my lifetime. So I thought, is there a general concept that we can take and apply across species? And I think this three needs approach is one such thing. When I'm going to talk to you about welfare, I'm going to talk about what I'm going to refer to as a sort of a mood-like state. And this is the cumulative state of individuals' emotional experiences, individual emotional outcomes. It's the aggregate assessment of the internal outcomes associated with events that the individual experiences. Again, it's built on the cumulative emotional experience. It's observable repeatedly over relatively short time frames. It can be persistent, often is, but the key element here is that it's subject to change. You can tweak an individual's mood. It's hard to tweak their personality. It's associated with consistent behavioral responses and specific types of decision-making, as are personalities. So it can actually be confused with personality if you're not careful. When we came to look for these needs, we started sort of trying to triangulate in using multiple different fields of expertise to find out what minds need, right? What does a mind need? We drew on research in several fields, and these were affective neuroscience, motivation psychology, animal behavior. Affective neuroscience, these researchers are able to sort of look inside animals' brains physically and understand what happens when they stimulate certain areas. Motivation psychologists are able to sit people down and talk to them and say, you know, when you're feeling this way, how do you tend to act? And animal behaviorists observe animal behavior. Every one of these fields of expertise relies heavily on the measure of behavior. And in putting all this together, we sort of started to look where there's overlap between these fields and thought of, and sought to find areas that suggest that all these fields have indicated these are needs that individuals have. And what we've come to sort of land on is that when these needs are met, individuals have positive emotional experiences, and these support positive mood-like states. These needs, like some of the things that we talked about in the Declaration of Consciousness, are evolutionarily old needs. And these are the three needs that individual animals have to be able to do, have to be able to meet to achieve essentially positive emotional state. They have to be able to investigate. Their environment has to invite them to check it out, right? So investigation is a key evolutionarily old need. I'm going to tell you why in a minute. They also have to be able to acquire rewards to gain resources. Animals also have to be able to exert control. They have to be able to manage their own processes. These are evolutionarily old and conserved across the animal kingdom. They're more basic, in my opinion, than species-specific behaviors. They're a starting point for a general approach to managing animal welfare. They're in everybody's specific behaviors, essentially. So those of you who've taken animal behavior courses have probably learned a little bit about a guy named Nico Tinbergen, who came up with 4 questions to ask about every animal behavior problem. And we're going to sort of focus on 2 of them here, function and mechanism. Tinbergen's other 2 were how does a behavior evolve and how does it develop within the lifespan of an individual? We're focusing on function and mechanism. What is the function of this behavior, and how does it happen? Because these are the ones that are going to help us understand what's going on sort of in the moment, if you will. So why investigate? Well, change is a fundamental property of natural systems, right? It makes sense that you have to just be ready to check things out. How does it happen? There's a subcortical seeking system that drives animals to explore. It provides the motivation to do this. Jaak Panksepp, who is a sort of a inspiration of a lot of this work, discovered this seeking system, and this is a subcortical thing, so it's down in the brain, right? It's old stuff. There's also a psychological construct called truth effectiveness. People really want to find out what's going on, right? We want to know, and there's overlap between all of these things. Expectations and outcomes drive individuals' affective state, right? So this is a sort of a graphic pulled from one of our papers. And if we take a look at a known world, a world where no investigation is necessary, this is a sort of a simple world, right? And we have different types of cues. We have a cue for different things, a reliable cue, in fact, for a positive event or a negative event. The individual knows if that's a positive event that was cued, that their proper response is to anticipate what is coming and take advantage of that opportunity and have a net gain in affect and emotional, a sort of a push towards a positive mood-like state. In a situation where there is a negative event cued, the individual is going to respond with negative affect and attempt to avoid that. So it's going to feel emotionally bad if you're being told something bad is about to happen. And then the event can either be avoided or not, right? In which case, the net affect gains are either neutral or some loss. In a world that is not completely known, you either investigate or you don't, right? So now we're going to apply an equivocal cue. This is not a scary cue. It's just one that sort of the individual doesn't quite know what it means. It's similar to something that it thinks could be a positive cue, and it's also similar to something that it thinks could be a negative cue. And if we take a look at the state that the individual is in initially, if we're in an optimistic state, sort of a positive mood-like state to begin with, an individual in that situation might view this equivocal cue as a positive opportunity and express positive affect in response to it, that opportunity in turn might be rewarding, neutral, or negative. And there's all of these possible outcomes emotionally for that experience. An individual that's on the other side of the spectrum, one that is in sort of a negative mood-like state, one that we might call a pessimist, might view that as a negative cue, respond to that negatively, have a negative emotional response at the beginning, not experience it, and ultimately have a loss in a further decrement in their mood-like state. One of the key things for people working in zoos to sort of really wrap their heads around and always remember is that fearfulness just wrecks investigation. Animals that are afraid of things aren't going to investigate stuff. If you're living in fear, you're just going to live in fear. You're not going to be open to exploration. You're not going to be engaged in this positive emotional thing that you're really craving to be engaged in. One of the areas where fear has been studied a fair amount in zoos is in looking at the visitor effect. And there's a guy named Jeff Hosey in England who sort of wrote kind of the textbook definitions, if you will, of the visitor effect. And his visitor effect, he says, basically, there's three kinds of things that could happen with animals and visitors. Animals could be afraid of visitors, right? So they could have a negative effect on the animals. They could have a neutral effect on the animals, where animals essentially don't seem to even notice them. Or they could have a positive effect on the animals. So in this case, we have a fear situation. Animals probably decrease their investigation as a result of their fear of visitors. In this case, nothing happens. Animals are either investigatory or not, depending on sort of what their standing state was before visitors came. And in the third case, positive effect, then animals probably investigate more as a result of visitors. They might investigate the visitors themselves. There's another idea that sort of we proposed a few years ago based on this concept of dither. And I'll tell you a little story about dither. There was a professor at UC Berkeley named George Barlow, who was a sort of a classic ethologist. Actually, I think he did a postdoc with Nico Tinbergen way back. But Barlow was a fish biologist, and he studied lots of different species of fish. But at one point, he was studying some small cichlids in his lab in Berkeley, and he would sneak into the lab and creep over to the tank and watch these fish sit there for hours, trying not to move, trying to observe the fish, and the fish wouldn't do anything. They were afraid of him. So the fear of these fish just shut down anything, and Barlow never got to observe them until one day he had another tank in there next to this tank filled with sort of mindless swimming fish that just were busy, that didn't care what was going on. They just kept swimming around like crazy. And now he recognized that these other fish that he'd been trying to watch for some time were starting to come out and do stuff and sort of investigate their environment and act, socially with each other and so on and so forth. And he referred to these mindless swimming fish as dither fish. And actually that trick has been used by fish keepers for generations now to get shy fish to become less shy, if you will, by putting dither fish into the same system with them so that they feel more comfortable. So a few years ago, we sort of suggested that there might be a dither type visitor effect out there too. So we've added into this Hosey idea the possibility that all of Hosey's effects could be going on at the same time, if you will, depending on the number of people that are visiting the zoo. And we actually found pretty good support for there being a dither type visitor effect. So fearfulness, Rex investigation, it's a mystery in some ways as to what exactly animals are fearful of in zoo situations. But sometimes they're afraid of people, and sometimes they're less afraid of people, depending on the situation. It's kind of interesting stuff. Acquiring rewards is the second of the needs. Why do this? This is a simple one, right? You got to keep the lights on. You got to pay the bills. Homeostasis, growth, reproduction, etc. All of these things require resources. How does this happen? You get a reward, you experience a physiological change, then there's positive emotional response associated with that. Selection shapes motivation for resources for survival and reproduction. In zoos, in good zoos, acquiring rewards is a relatively easy thing for animals to do, at least for the most basic of rewards, that being food, right? One of the things we often aren't that particularly great at, though, is supporting these chains of behavior. Sometimes captive animals don't necessarily get to complete the chains of behavior. So you might imagine in this situation where there's some cranes sort of mateship rituals, they might start off meeting each other, sort of getting to know each other, if you will, and then later they have the opportunity to have kids, or a hunting sequence might occur for animals. And oftentimes in zoos that doesn't pan out like that. So the reward, we will often just jump to the reward without the opportunity to really go through the process of the normal steps of acquiring it. Reward sensitivity is a thing that that many captive animals experience. And this is a situation where we can become reward sensitive if we aren't really getting what we need emotionally, so to speak. So we have done a lot of work around this concept of anticipatory behavior, which is a measure of reward sensitivity. And we've done many studies on anticipatory behavior, and the basic concept goes like this. On the x-axis here, this is essentially your mood-like state. This is your welfare. This is the balance between the frequency of positive and negative experiences, okay? This dotted line is the frequency of bouts of anticipatory behavior, and the solid line is the intensity of anticipatory behavior. Anticipatory behavior, I should say, are the behaviors. There's lots of different anticipatory behaviors, but in general, it's the behavior that occurs when an individual experiences a cue that says something positive is about to become available. So you might imagine that anticipatory, you could drive anticipatory behavior in your pet dog, for example, by telling it it's time for dinner and watching what your dog does. So anticipatory behavior are those behaviors that an animal expresses prior to the acquisition of a reward when they believe that the reward is imminent. Whoops. Animals that are in a good state of welfare have lots of opportunities to acquire rewards, generally speaking. So they might have a large number of bouts of anticipatory behavior, but because they're not particularly reward sensitive, because they're in a good state of welfare, none of those bouts are particularly outrageous. They're just pretty low intensity. As we shift the animal towards a worse state of welfare, we see that their intensity of anticipatory behavior goes up, though there are far fewer bouts of anticipatory behavior, because there are far fewer opportunities for the animal to acquire rewards. We've used anticipatory behavior as a relatively quick assessment of animal welfare. Exerting control is the third of the three needs. And this is probably the trickiest one in a sense. This is the ability to manage one's own processes, right? To sort of make decisions, to decide how you go about doing things. Being proactive in behavioral responses supports survival and reproduction, more so than being simply reactive, right? Being able to exert control also allows one to develop behavioral competence, and it is an ability, it supports the ability of developing behavioral phenotypes, which means that different individuals in the same population can solve the same problem in different ways. How does this come to happen? Animals expect behavior to influence results, but there is no strict roadmap for which behaviors to do when, right? I expect that when I act, something's going to happen, but I don't necessarily know what it's going to be, right? So it leaves animals to perform behaviors that work best for them. Again, here we have another sort of a subcortical system at work here. Action-driven agency is a subcortical response to an event, and competence building agency, also another subcortical thing in the basal ganglia, that allows an individual to sort of put things together and develop an approach that's right for them to build competence in developing agency, in exerting control. And then there's control effectiveness, which is another psychological construct from Franks and Higgins. Franks and Higgins say, and this is actually pretty interesting, that we prefer the illusion of control to not being in control, right? I would like to believe that my behavior matters, right? Whether it does or not. If I feel that my behavior doesn't matter, it basically makes me depressed. Whereas if I feel that my behavior does matter, I feel better about myself. This is an important thing to think about for zoos, because sometimes we have to sort of figure out ways to make our animals believe that their behavior matters, right? It might not be possible to provide zoo animals the ability to direct every aspect of their lives, right? It's important to help them, though, to build the sense of being managers of their daily lives. They might not be able to determine outcomes, but perhaps means to acquire them, right? So we might want that animal to move from space A to space B so that we can clean space A. And rather than just saying, go over there, we might say, well, you get over there some way. You can go to space C first if you want to, and then into space B. And to allow that sort of thing that gets what we want as animal managers, but also allows the animal to manage their own processes to some extent. Functional control, which is the ability to manage all aspects of one's life unequivocally, is probably not a particularly good idea for anybody. More predictability equals more control. This is a pretty straightforward graph. Here we have environmental predictability, sense of control. The more predictable an environment is, the stronger our sense of control is, right? But as I just said, that's getting closer and closer to this functional control idea, which we probably do not want to get to, because going back to the idea of investigating, environments are dynamic, right? If animals want to obtain certainty, that's their goal, right? They want to know what's going on in their world. They want to know how their behavior is going to be able to help them respond to changes in their environment. But the environment pushes against that animal goal all the time by just being the environment and changing and being dynamic. So the result is that there's strong selection on animals all the time to pay attention to their environment, to look for changes, to actually expect them, and to be ready to react to them. As a result of that, I would say there are a few species that are pre-adapted to operate without misfire in certain environments, right? Total certainty leads to, I would say, animals that are not doing well. There's evolutionary inertia to assume the presence of options or change and to look for them. So this idea of exerting control intertwines with the idea of investigation in a sort of a interesting sort of push and pull kind of way. Balance. So when we go out and start to measure how animals are doing to assess their welfare, we're looking for balance. What do I mean by that? Balance is a sort of a term we use that we think sort of helps to support psychological resilience. We look at we want to try and make sure that the frequency of meeting a need is at least as high as not meeting it. That's balance, right? This is different from striving to ensure that animals never experience adverse moments. That's impossible to achieve. It's a lofty goal, and arguably, an animal that never experiences adverse moments is one that is in a really positive welfare state, but it's unachievable. So we try to place each behavior that an animal performs alongside one of the needs and describe whether it indicates that the need has gone met or unmet for the moment of the observation of the behavior. Essentially, we tally the moments where the animal's behavior tells us they've met a need and when they haven't. Why do we look for balance? Again, it's unrealistic to expect no negative moments. Just think about the state of being hungry, right? That is an emotionally negative state, right? You're not going to go find that great dinner if you're not hungry, right? Overcoming challenge is essential to building behavioral competence. So some negative stuff happens as you're working through developing your behavioral skills, right? You're experiencing these sort of negative moments that you're trying to get around. And balanced individuals are resilient. This is a sort of a simple resilience model that we put in the book. This is welfare state here. Again, sort of frequency of positive events over frequency of negative events. This is an individual that's negatively unbalanced. This is one that is balanced. And this is one that is arguably unbalanced, but in a positive fashion. Has more positive moments than negative ones in its day. We can see here that if we shift an individual here, X degrees to the left, we're going to push it down even further and be in an even worse state of welfare. Whereas these ones, we have a little bit more room. So we have more resilience opportunities here. We call this the zone of resilience. So we try to keep animals up in this range somewhere whenever we can. We want it to be balanced or positively unbalanced because we feel like they can handle negative outcomes better that way and return back to an acceptable state of welfare. So where do we start our assessments? For good accredited zoos, we're pretty good at providing inputs that support nutrition, environment, health, and behavior. So we actually go out first and start by asking the animals, how are you feeling? Right? That's our first step, because we have the faith that in the circumstances that we're working in good accredited zoos, the animal care staff knows what they're doing. The veterinary staff knows what they're doing. The curatorial staff knows what they're doing, and they've all put the conditions together that support nutrition, environment, health, and behavior in a reasonable way. And we go out there and we start asking the animals, how are you doing? How is all of this package working for you? And in doing so, we ask, what does it look like when the needs are met or unmet for whichever species that we're working with? Each behavior reflects a momentary expression of emotion, and these combined build this mood-like state. Right? And there are general behavioral profiles that I'll show you in a minute that reflect varied mood-like states. Let's talk about individual behaviors first. We can take an individual behavior and ask, what is the valence of that behavior? Ask, meaning, is it positively valenced? Is it a positive emotional experience? Or is it negatively valenced? Is it a negative emotional experience? So for example, being satiated is a positive emotional experience. Being bored is a negative emotional experience. And then each behavior can also have a different degree of arousal. So being afraid is a stronger negative emotional experience than being bored. I hope that makes sense. We tend to start by just looking at the valence of these of behaviors, asking, is this a positive or a negative, and build our assessments from there. And we can go in if we feel we need to and adjust the value of certain behaviors by considering the arousal of those behaviors. But most of the time, we really just bin behaviors into whether they're positive or negative. In terms of mood-like states, an animal that is in a balanced mood-like state acts in a fashion that is optimistic, open, curious. They have low concentrations of anticipatory behavior. They're engaged in their environment, confident, outgoing, interested in stuff. They express diverse time budgets, behavioral diversity, and they're resilient to changes in their environment, to new things, to things that scare them. A negatively unbalanced animal acts pessimistically. It's closed up, it's fearful. They tend to have high concentrations of anticipatory behavior. They might be disengaged, unconfident. Well, I said fearful twice. Disinterested. They perform few behaviors, and they're slow to recover from perturbance. When we're doing behavior and using it to sort of look into the minds of animals, if you will, one thing to really keep in mind, and this is important for you guys, I'm sure, in everything you do, but when we're doing behavior and using it to look into the minds of the animals, we really want to try and make sure that what we're saying the behavior means is correct, as correct as we can be. So we want to diagnose things accurately. Observed behaviors are used massively in assessing animal welfare. And if we correctly diagnose what this behavior means, then we can make a proper management response and have a positive welfare change. If we incorrectly diagnose it, then we might make an improper management response and have negative or no welfare change, or even worse, just an incidental positive welfare change that we ascribe to being related to this change that we made, even though there may be no relation. So when we're building our observation protocols for assessing animal welfare, this is where we now start to look at individual species. We start to say, okay, for this species, what behaviors reflect the needs being met and not met, right? So for example, we might sit around and go, hey, what's it look like when a male gorilla has an opportunity to investigate or not investigate, or acquire rewards or not acquire rewards, and so on and so forth. And then we'll take our sort of expert knowledge, we'll go through the literature, all these kinds of things, and put together an ethogram that we'll use to go out and gather observations that we will basically make a behavioral time budget with, from which we will then go back and calculate the individual's mood-like state, if you will. So we start by sitting around and doing this, and then we go out and get a time budget. So we do a lot of animal watching to understand how animals are doing. And we'll create a traditional time budget plot. In this case, we have this many behaviors, 7 or 8 behaviors: forage, manipulate, inactive, groom, eat, pace, hide, social, play, and anxious and vigilant. From there, we'll then say, okay, which of these behaviors, because we've gone before and said, I want a behavior from each of the 3 needs, one that it has indicated that it has been met and one that has indicated that has not been met. And I can create a sheet that will tell me if we're balanced in that need. So in this case, for example, these 3, forage, manipulate, and inactive, all reflect whether or not an individual has an opportunity to investigate, right? And in this case, we take these and we create these balance sheets. And in this case, this animal is out of balance for the opportunity to investigate. You can see that it's inactive a whole lot more than it does any of these other things. It's very simple. Has pretty well balanced in acquiring rewards, and again, out of balance in exerting control. And this is often the case for zoo animals. They get a lot of rewards. They don't have a lot of opportunities to investigate, and they don't often have a lot of opportunities to exert control, especially ones that are not in dynamic social groups. And we can make these plots for days, weeks, months, whatever duration of time we want to. We tend to probably the ones that are sort of longer duration or more reflective of mood-like states, and a little bit more useful in sort of annual welfare assessments. To get started, you have to decide on an observation protocol. So you got to ask these questions, right? Do you have a trained observer available? Trained observer being a key sort of word, right? If the answer is yes, is that observer available at various times, and can they watch the animal throughout the day? If the answer is yes, okay, observe and develop a balance sheet like I just showed you. If the answer is no, can the observer observe animal on multiple occasions? If yes, okay, then use one of these indicator behaviors like anticipatory behavior. I'm not going to show you how to do anticipatory behavior stuff because I think I'm running out of time. But that's in the book. If you don't have a trained observer available, then we also provide a way to sort of develop an interview, if you will, with the caretakers and develop a balance sheet from that. Once you have a balance sheet and you can see where animals are out of balance or not out of balance, now you can start to adjust their welfare and adjust their mood-like state by providing opportunities in the areas where they're out of balance. So rather than just giving enrichment, you can now say, okay, I'm going to give this animal opportunities to investigate or to exert control, and give them sort of a tailored enrichment program, right? Or opportunities to complete chains of behavior. And frankly, providing dynamic environments, if possible, is always just the best way to go, right? If the environment itself asks the animal to do things and engages them outside of the time when their caretakers are able to do that, you're going to go a long way to supporting the basic needs. There are, of course, exceptional cases, and I'm going to finish just like Dr. Guy did, I think. These are geriatric, chronically and acutely ill, injured animals where you're going to change your protocol in a sense. the individual's relationship with the physical domains now is rapidly changing, and these should be assessed again more frequently. What used to work may not be working anymore. You might need to start to tweak the environment. You might need to start to tweak the social situation, these kinds of things. And here, these daily balance sheets may be more helpful than they ever have been. There's another exceptional case, and that's mental illness. So everything we've talked about so far has just been about basic behavior and adjusting it by providing opportunities and so on and so forth. Sometimes that doesn't work, and you might have a situation where you actually have an animal with a mental illness. And there's not a lot of great resources on animal mental illness. And here, diagnosis is very important, right? You got to try and understand what you're dealing with, right? And when you're going to apply drugs to do that, that's especially important because some drugs work on certain things and some drugs work on other things, and some things look similar. So really digging in to try and understand what you're working with is key. You always want to have a vigilant observation protocol and couple your medication with a behavior modification plan, right? In this case, teamwork is really, really vital. It's going to be key to work with everybody who knows the animals, who knows the behavior of the animals and that sort of thing, and hopefully get the animal into a situation where you can get them into a position where their quality of life is what you're looking for. Thanks for your time. Thank you for listening to me, and sorry about the little glitch in the middle there.
Thank you very much. Do we have any questions for Dr. Waters? I'll go with mine. I have a question about how do you think stereotypies are related to these needs? I normally think of them as boredom, but how do you address that using your model, like pacing?
I think, well, okay, pacing is a very, pacing can be a number of different things. Anticipatory behavior is often pacing, but it's not a stereotypic behavior. Stereotypies, I would say, are probably more along the lines of a category of a mental illness. They are often probably performed by animals that are in some way broken, right? Whereas a lot of these other things, so somewhere along the line, I would say maybe these needs weren't getting met. Stereotypic behavior is something that probably happens as a result of bad developmental situations. And we've seen stereotypy is often considered to be uncurable, and I think that's just awful to think about, that there's something that can't be cured. But I'm not sure if I've answered that question, but I think probably stereotypy develops out of needs being unmet, just as sort of metabolic bone disease might develop out of poor diets in young animals.
Thank you. I think we have a question in the chat.
Yeah, that's me. Hi, I'm Lauren.
Hi.
I'm on Zoom. So I have a background in animal training and in zoos. And in terms of frequency of anticipatory behavior, I've seen species and often like individual differences in exhibiting like more or less anticipatory behavior. So we kind of always looked at these as like an excitement, but they don't necessarily, that animal doesn't necessarily fit into the categories of like the negative behavior. So like an example I was thinking of is we had a group of coati, and one of them would get like super excited and jump up and down and up and down on our station after she heard her bridge, but she was always highly engaged in training and interacting with trainers and conspecifics. And so I'm wondering if we were looking at these anticipatory behaviors in the wrong way, or if I'm not necessarily we were inaccurately categorizing that as an anticipatory behavior?
I think anticipatory behavior is a little bit complicated because it's a combination of things, right? It is a reflection on how an individual feels they need this thing that's coming, right? So they're telling you, I really like this thing and I really, really want it, which could be saying that they're not getting a lot of opportunities outside of the time of getting this thing, right? So that's one thing. The other thing is that it actually feels good when it's happening. So it's in the moment, it is a positive affective experience, right? But it's reflective of the cumulative positive affective experiences that the individual gets. So what I would do in a situation where if I saw that, I would start to ask, okay, this animal is so tuned into this situation. What's happening outside of this situation? Are they getting opportunities? Are they low man on the totem pole in the social group? Are they where do they lie? And how's the rest of their day looking? Because they're showing me I really, really want this. Does that make sense?
Yeah, absolutely. So essentially, they are missing something outside of that situation. And maybe I can pass this on to my former coworkers of like, hey,
That would
look
be
at
my
the,
first question to ask in that situation. And if that didn't pan out, it doesn't pan out. But I would start by asking, is the rest of this animal's day okay?
Mhm. Cool. Thank you so much.
Any other questions? All right, well, thank you so much, Dr. Waters. We really appreciate your time. And if anyone wants Dr. Waters' email, if you're all right, if they have any questions later, we can go ahead and share that.
Sure, please do. And thank you again for having me. And again, I hope you guys are all safe and not too smoky.
All right, thank you so much. We have a little bit of a break, you guys, and then we'll have our next speaker.
Bye.
After grad, she completed 2 small animal rotating internships, one in San Diego and another in Tucson, before completing a zoo specialty internship at Wildlife Safari in Oregon. Upon the completion of her internship, she was offered a permanent position and stayed on as the associate veterinarian for 2 years. After 3 years in the rainy, cold weather, she decided to pursue warmer and drier pastures and took a job at the Living Desert Zoo and Gardens, where she is currently the associate veterinarian. Dr. Analisa has always had an interest in animal welfare and working as a zoo veterinarian. She has seen the importance of providing animals in her care a life worth living. She is currently pursuing board specialization with the American College of Animal Welfare via the independent resident training pathway with Dr. Peralta as her mentor.
Thank you. Hi, everybody. I'm just going to get this out the way. I am incredibly nervous. I think y'all sent me, or your leadership board sent me an email saying, we're excited to have you because of your esteemed expertise. I am neither esteemed nor am I an expert. I belong in the seats with you. It wasn't that long ago that I was there, but I do have a passion for animal welfare and zoo medicine, and a lot of that interest started right here. You guys are incredibly lucky. You've got Dr. Ang to be a wonderful mentor, and you guys have already taken this step in your desire to talk about and think about animal welfare, which is a huge passion point for me. And we've got Dr. Peralta and Dr. Reynolds here, and Dr. Peralta is actually the president-elect of the American College of Animal Welfare, if you guys were not aware. So he is an incredible resource when it comes to thinking about and addressing animal welfare across the spectrum, not just in zoo animal medicine. A little bit about me, my bio, obviously. I am a 2018 Western U grad. I have a first master's before coming to vet school in lab animal medicine, which is actually where my interest in animal welfare kind of started. Upon graduating, I did 2 rotating internships because I'm a glutton for punishment, and also getting into zoo animal medicine, really, really challenging. I will say I am not the smartest person. I graduated with a 3.2 GPA. So if any of y'all are sitting here thinking, my grades aren't going to be good enough to get me there, they can be. Dr. Eng can attest to it. I think one of my most endearing qualities is that I'm just incredibly stubborn and persistent. And so I think if anything, that definitely can help you out. So that's where I got here today. Where are buttons? So we're going to be talking about zoo animal welfare. We're going to be talking about intensive and extensive management with a little bit of focus on population management. And so we were lucky enough to have actual experts in this field talking about what animal welfare is. So we're going to quickly gloss over some of those definitions, the welfare basics, management strategies, and then we're going to try and go into more of the management philosophies. How many of you guys are second years? Holy cow, it's like all of you. So y'all have like seen me talk, right? Okay, well then this is going to be a little bit familiar. And how many of you guys want to be zoo vets? Raise them higher, be proud. You can do it. You just have to like commit to it. Like I said, just be stubborn. So exotics practice. Awesome, awesome. Well, this is still fun to talk about anyway. So these are the questions you guys have heard before, and we're going to make you answer them all again because my presentation is going to be incredibly short if you just want me to stand up here and talk. That's just not how this works. Do you think you understand why zoos exist? Who says yes? Come on, I know all of y'all are second years, which means we talked about this. Who says no? Okay, that's fair. I appreciate the honesty. Who says maybe you know why zoos exist? Okay, I accept that. Do you believe that zoos have a meaningful impact on wildlife conservation? Who says yes? Ooh, that's a good answer. Who says no? I like that. Who says I have no idea? Okay, perfect. Survey question number 3. Do you believe that zoos have a place in our modern day society? Should they exist? Who says yes? Who says no? Who says I really don't want an answer because you're a zoo vet and I don't want to feel silly? Also fair. Lastly, and a little bit newer question to this whole series, which do you think is better? A traditional zoo or a safari park? Who says a traditional zoo? Safari park? Please, no more questions. I don't want to do any more of this. No? Okay. Well, we're going to talk a little bit about the differences between those traditional zoos and safari parks, or the intensive versus extensive management. But first off, we need to think about what is animal welfare. We had both Dr. Waters and Dr. Guy a little bit address some of these previous definitions. So we're going to gloss over them relatively quickly. Donald Broom in 1986 said that animal welfare is the state of an animal in relation to its ability to cope with its environment. In 2021, this was taken a step further, where Dawkins said an animal with good welfare is one that is healthy and has what it wants. So pretty simplistic, right? I think I was actually just talking to Dr. Eng about this. When it comes to thinking about animal welfare and getting people to care about animal welfare, we have to make it accessible. We have to make it understandable. And that's a very simple way to think about what animal welfare is. We then move over to 2021, where our actual esteemed expert in animal welfare, Dr. Peralta, his definition is animal welfare should be understood from the perspective of the animal. And as such, it refers to the state of an animal as it benefits from positive experiences and overcomes adversities. Hang on, because I do work at a zoo. We have AZA, or the Association of Zoo and Aquariums definition, which is very, very wordy. But suffice to say, they do have a statement on what animal welfare is, which is incredibly important because it means that we are thinking about it in our zoo world, life, and times. Ultimately, an animal typically experiences good welfare when they're healthy, comfortable, well-nourished, safe, able to develop and express species-typical relationships, behaviors, cognitive abilities, and so on and so forth. Because physical, mental, and emotional states may be dependent on one another and can vary from day to day, it is important to consider these states in combination with one another over time to provide an assessment of an animal's overall welfare status. So we're thinking about those things. Dr. Waters definitely talked about that animal welfare exists on a continuum. In your normal day to day, you're not always happy. You wake up, might be in just like didn't sleep very well, you're a little tired, and you're like, crap, I have to go to class. I really don't want to be in PBL. My learning issue was so hard. How am I going to explain it to my classmates? It's not the most positive welfare state, right? But, you then go to lunch with your friends. Is Metro Station still down there? Does that exist? Yeah, sneak away for a little break, grab a beer with your buddies, come back for your afternoon classes, but you don't tell anybody that you did have that beer. But it makes your day a little bit better. So it swings over to the other side, and you begin to experience a more positive, effective state. When it comes to animal welfare, we definitely need to have a metric to discuss what it is. I think that is one of the wonderful things that I have gotten out of pursuing my master's in animal welfare is that's given me a vocabulary to talk about something that might be a little bit more subjective in an objective way to get people to care. And one of those things that we can utilize, or one of the past frameworks that has been utilized, because I think it's important to know where we came from, to then know where we are currently, was the 5 freedoms. Who is familiar with the 5 freedoms? And this is where we have another survey. What are the 5 freedoms? Come on, shout them out. Freedom from hunger and thirst. What else? Freedom from pain. What else? Normal behaviors. Yep. That's 3. We're up to 3. Not quite. Yeah, freedom from hunger and thirst. That's important. Aren't you grumpy if you're not eating? I am. I need food. I need food, snacks. I need my chai every morning. Those are very important to my positive, effective state. Thank you. My Starbucks people know it. I get love notes every day. I need that positive affirmation on my cup saying you're amazing, or happy to slay on a Tuesday morning. Like, I need those things, right? We've got 4. Does anybody know the last one? Freedom from hunger and thirst. Freedom from discomfort. Freedom from pain, injury, and disease. Freedom to express those normal behaviors. And freedom from fear and distress. When looking at these, this is one of our most basic understanding of animal welfare. Why do we consider this one of our most basic? Why? What are the limitations when we are thinking about the 5 freedoms? Yeah. I mean, that's part of the problem with animal welfare that I was talking about, right? It is rather subjective. And this is one of the ways, the early ways that we are trying to give a more objective language to what animal welfare is. Thinking about the individual animal when we are assessing these things, what is a limitation? how sad is it to just live with the freedom from hunger, right? Like if I am getting cornflakes every morning for breakfast, lunch, and dinner, yeah, sure, I might not be hungry, but that's also not my most favorite cereal. I'd much rather prefer some Lucky Charms. So it's just basic. It's very basic. It's just freedom from the most basic needs, freedom from discomfort. Like we hope that we're not uncomfortable. That's where that environment that you were talking about kind of comes into play. Being free of pain and injury. I think us as veterinarians would think that that is like the most basic thing we can provide. But this doesn't allow us to think about the positives or integrate the positives into animals' lives. So that comes to the 5 domains. Dr. Waters did a wonderful job talking about all of these things. Oh, hey, there's stuff in the way up there. There's stuff on the way over here. Okay. So when we're thinking about the 5 domains, quick overview once again, we kind of have this breakdown of the physiological domains and the behavioral domains. And this is Mailer's 2020 revision where he really broke it down in a way that I really appreciated, where we can very easily objectively assess your nutrition, your living environment, your health and fitness, which you can see all of these play into what those original freedoms from sort of existed. And it kind of shows you how the behavioral domain comes into play and that the interactions with the environment, the other animals, and with humans all play into our overall mental state. Just a bigger picture for y'all to see. So moving into like what I really wanted to kind of talk about today, what is the best way to manage ungulates in zoos for optimal care? I come from a safari park. So we had my bread and butter is hoofstock and carnivores. It's what I really care about. They're a lot of fun to work with. And it's been interesting making that switch from safari park zoo vet to more traditional zoo vet. And so it's given me a lot to kind of think about. So when we talk about these 2 different types of management systems, can anybody venture a guess as to what intensive management might look like or what the definition of that might be? So what might that look like? Sorry.
Instead, like for an example, just for like in a farm situation, you might have a population and you have one animal that comes in with, or a certain group of animals that comes in with a illness, and you, instead of curing the animal of that disease, you do a necropsy to determine what it is so you can prevent the disease from spreading to the rest of the population, versus in, for example, private practice where you focus in on the individual animal and cure the disease in the individual animal. That might also not be the right definition.
What is intense?
A lot of effort.
A lot of effort, right? A lot of effort into like one thing. So intensive management is going to be high human intervention, controlled environments, and a regulation in breeding. Extensive management, kind of the opposite. That is where we have minimal human intervention. We typically think of those large naturalistic enclosures, and we think of those more natural social structures. I think when it comes to considering these 2 different environments, they both have a lot to offer, and we're kind of go into a little bit about what each one of those might what you guys think each one of those might provide, because it's a lot easier for you guys to talk than it is for me to talk, because I actually hate public speaking. But this is kind of the difference between these two types of management styles. So we then have our intensive management, which would be zoo or safari park. And then our more extensive management, which would be safari park. Exactly. So beyond that, and some of the other verbiage that we might end up using is intrinsic characteristics versus extrinsic characteristics. When it comes to intrinsic characteristics, what do we think that might be? Talking about their enclosure, what their social structure might look like, and what human intervention might look like. Big or small enclosure? Oh. Beautiful. So in terms of intrinsic characteristics, we've got those large enclosures, those natural social structures, limited human intervention. The environment is providing those things for the animals. Excellent job. For extrinsic, this is where we have to provide them these things to our animals. We would have those controlled environments. We regulate breeding, and there is frequent human interaction. Just to put all of that into perspective into one easy slide, when we're talking about intensive management, it's that high human intervention, controlled environments, regular breeding, close monitoring, and limited spaces. And the reason why I'm focusing a lot on that is because I do really care about population management, and I think this is a new and emerging philosophy and when it comes to our management style. And then extensive management, which is then minimal human intervention, those large naturalistic enclosures, natural social structures, all of those good things.
Just, I guess for a little bit of feedback on the slides, I think the last slide had the definitions flipped potentially.
So where it gets a little bit confusing is intensive is extrinsic, extensive is intrinsic.
Oh, my bad.
Yeah, that's why we got to talk about it. I guess like while we're here, when we're thinking about these things, how would intensive management align with a different zoo mission or conservation and education philosophies if you're in an intensively managed situation, so our traditional zoo?
Maybe with the species that's near extinction and you're really worried about making sure you breed it and make sure every little thing is okay for it or something, like a really endangered animal you would want intensive?
Yeah, I mean, if you think about zoo philosophy as a whole, I guess what I'm really driving at is, do we think there is a big difference in the philosophy and end goal of a zoo or safari park? Do we think those philosophies are the same, or do we think they're different? Who thinks different? Who thinks same? Why do we think same?
I think they both have like animal welfare in mind, and they're both trying to do what they think is best for the animals within their enclosures. I think they just go about it in two different ways.
Yeah, do we think traditional zoos, we've got SSP programs, right? Everybody agrees with that? Do safari parks have an SSP program? I see a yes over there. The P horse. Yeah, right? Just because we've got AZA accredited safari parks, we've got AZA accredited traditional zoos, and ultimately, if you're under the banner of AZA, your mission and philosophy is all going to be pretty similar. It's just how you get there looks a little bit different. And because it looks a little bit different, we need to think about how we are managing those animals in those different populations, which is why I asked that question. So yes, philosophies are relatively the same. The mission is ultimately the same. The goal is the same. We want to be participating in conservation efforts and, saving species, right? That's like why I became a zoo vet. And, in doing that, it just depends on where you are and how you're able to accomplish those goals. Does that make sense? Cool. So looking at an intensively managed system, what are you guys noticing about this? What are you noticing about these photos? Tell me about their environment.
Hello? There we go. Concrete.
Right. Oh, geez. There is concrete. There's substrate. What are we noticing about the food options? Fairly limited. It's provided that clearly has like a feeding spot for them to have to go to. There's a watering hole for them to go to. We do have a mixed species environment, which is kind of fun. What might that provide for the animals? Yeah, sense of enrichment, right? So we were able to see some of that in our traditional zoo spaces. I don't have great pictures of it, but in these environments, when they are a little bit smaller, Dr. Waters was talking about creating those complex spaces. And it becomes a lot more important for us to intensively manage these situations so that they have things for mental stimulation so that we can create these more positive, effective states. Extensive management, what are we seeing?
A lot of land.
A lot of land. I think Dr. Guy was talking about, elephants, if it's just a flat space, they're not necessarily going to go walk over there, but this is actually a hill. It's hard to tell because, 2D. But large spaces, there's ways for these animals to walk over the hill, to be like, what's going on over there on that side, which gets them exercise. That being said, if we've got a large herd, these animals are exhibiting normal behaviors such as fighting, which might not be necessarily a good thing, right? Talking about some of these, we're going to go through these relatively quickly because I'd rather talk about population management, but it is important to think about intensively managed and extensively managed and what that looks like in the other domains. So for nutrition, we've got the first image, kind of what I was talking about. These animals that exist in these large safari parks, they're able to walk about, munch, graze, eat the grass. Yeah, sure, we definitely supplement it with hay, grain, just to make sure that they have a nice, well-balanced diet, because also there's issues with overgrazing, but I digress. Then we come into our more intensively managed situations where there's platters of food. This is one of my favorite creatures in my park. This is Juniper. It's her second birthday. And she had a very beautiful cake for her second birthday. But we don't necessarily do that so much, mostly because the fallow deer that you see in that first picture, they would run away if I were trying to give them a cake like that. Environment. We talked a little bit about the fact that we have to provide enrichment for them. So opportunities for them to use their brain, make their habitats more dynamic, because they don't have the opportunity to waltz over to the other side, cross the creek, all of those types of things in their environment. When it comes to health, right? We're all veterinarians or about to be. It looks a little bit different in terms of how we're able to do these exams, right? So Junie, the reason why she was in the small enclosure, it was because she was recovering from a surgery. She got beat up by a friend, but I was able to bring her to the hospital and, do a whole procedure. Dr. Levy came out and helped me with it because she avulsed her horn. However, in the field, it looks a little bit different, a little bit more challenging. You have to go out there and dart them. I think in that first picture, you can see it all foggy, which makes for challenging darting conditions, which is, fun, but not so fun. When it comes to behavior, and again, kind of switching back over to the population management side of things, I think it's really kind of cool existing in the safari park setting because we have this animal here that is the mother that has been able to grow up, find a mate, have a child, experience rearing a child, assuming that's what she wanted, right? And I don't know if all you guys want to have kids. Have a child, and then that baby has the opportunity to exist within the herd, have those experiences in the herd. If it's a male, learn what it might be like to spar with one of its fellow friends or frenemies, and grow up within that normal behavior, that normal habitat, that normal social structure. Whereas this animal over here, yes, she's alone in that image. However, she was contracepted, which means she's not experiencing that whole life cycle that this animal was able to have. So kind of bringing it back to like the 5 domains, I think there are pros and cons to each of those, right? We're thinking about intensive management, advantages. We get that close health monitoring. I can get my animal quick and easily and do my exam on any animal that I want. I think what is also kind of nice is that when we are doing our breeding, making our breeding protocols through the SSP, we're able to do it with genetic diversity in mind. And we're also able to control populations. If we don't have space for an animal in a traditional zoo setting, we can say, okay, let's separate these animals. Let's provide contraception to this animal so that these animals don't breed. We have a place for all the animals that we have in our population, and that can certainly be a good thing. Some challenges. Again, there's limited natural behaviors, and there's some debate as to whether or not we think that's good or bad. In thinking about that little baby fallow deer that was, or black buck that was in that image, is it great for that animal to spar with another male as he's getting older? Usually, like, those animals get kicked out the herd, right? That's a little sad. But it is an experience. It's a part of their life. They can then get moved into, a bachelor herd. They can experience stress and stereotypic behaviors in smaller spaces. And then, like we're talking about, there's controversy over like contraception if we are in these intensively managed populations. I think one really interesting topic is Marius the giraffe. You guys know Marius? What's the story of Marius?
Is it the one that was given fed to the lion after it was killed or euthanized?
Yeah, so Marius the giraffe, this is 11 years ago now at this point. Marius the giraffe was culled. His mom was allowed to breed. His mom was allowed to have a baby. And Marius the giraffe at around 2 years old, which is the age when a male giraffe would be kicked out the tower, they didn't have a place for him to go. So they euthanized him, they dispatched him, and they used that as an opportunity to educate the public. They did a live necropsy for the public to be able to see, a wonderful learning opportunity. And then that animal was fed out to their carnivores, which is providing enrichment in a different way to a whole different subset of species, which is kind of cool. But there's a lot of controversy over doing something like that. But it is a way to address some of those challenges in terms of allowing natural behaviors to occur, and again, managing the overpopulation if we were to go that route. In terms of extensive management, it promotes more of those natural behaviors, it maintains natural reproduction and social structures, it lowers daily human intervention, which can be a good thing because you don't need as many people to work the field, the habitat. Challenges, difficult individual health monitoring. If you're just allowing animals to breed, there's overpopulation risks, and then you end up in a situation where you might be forced to cull. That being said, there is a zoo in Germany that has cultivated a really ethical culling process where 30% of the food fed or the diet fed out to their carnivores is actually supplemented from their hoofstock population. It's relatively similar to what we had up at Wildlife Safari, where we had a very robust horse donation program where people would donate their horses that was their end of their life, and we would feed those animals out. However, if we were in a period of not having too many donations, we were then able to supplement it with some of our herds, herd animals. These were animals that are either aging out of the population that were no longer participating in the breeding, or might have some minor health issues that wouldn't have impacted being a part of a carnivore's diet. So as I'm kind of alluding to, there's some emerging philosophies when it comes to thinking about reproduction and productive management. Sorry, I'm talking too much.
Question.
Yeah.
When you're talking about feeding these, like the herd animals to like the, I don't know, like say a big cat or something, are you saying that you're gonna like euthanize them beforehand and then feed them off, or do you just like introduce them?
Ooh, if we're talking about welfare, right?
Yeah.
How ethical do you think it might be for us to throw a live animal into a habitat with a pack of the pride of lions?
Not great for the one that's the prey.
Yeah, and I will say, for as enriching as that might be for the carnivores, I think it's also our duty as stewards of animal care and welfare to think about the welfare of the animal that is ultimately going to be prey. So that animal would be dispatched before being fed out.
Follow-up question to that. I don't have a lot of personal experience in reptiles, but I've seen a fair bit of their husbandry and care. And, for example, some snakes, for example, won't really care for a food item unless it's like potentially either live or moving around or something like that. And otherwise they just will not eat. How do you deal with a situation like that, if at all?
I'm not gonna lie, I haven't actually run into that situation yet. I'm also pretty nascent in my zoo career, so maybe that will happen. But I mean, again, I think from my personal perspective, I think it's a little unethical to throw in a rat, mouse, or whatever into that environment when it comes to feeding. Additionally, there is increased risk to the snake if you're feeding live. So you have to consider the health of the snake that you're trying to feed. So it's a little bit of a trade-off. I haven't actually run into that. Dr. Ng, he's the big reptile man. He might be able to answer that question for you at the end. But talking about the philosophical insights, preventing natural reproduction might actually hinder welfare because we're not experiencing all of those naturalistic behaviors. And natural isn't always good, like we talked about. Ethical culling potentially aligns with those natural processes. But how do we get there? Ultimately, it comes down to policy recommendations and how we find a way to get support for natural behavior, allowing animals to exhibit natural behaviors, and balancing population control with these welfare priorities. Where all of this kind of came from is kind of where my heart, passion, interests lie. This is so new. This was just published in 2024 and was one of the bases of the talks at AAZV this year. I will tell you right off the bat and do like my little disclosure statement. I think European zoos have they have a very different philosophy on welfare and what welfare should look like. I think it is a little bit more progressive. I don't think you could get away with culling a giraffe here in the United States. It was actually when the United States got wind of it that things went awry. But I think they're a little bit more progressive. They do a better job talking about natural life cycles and conservation and what that means and what that looks like. So what we're looking at here is actually a little bit of a case study off of Marius the giraffe. And when we're looking at it, we have kind of what is going on right now in our traditional zoo settings. We do a really great job of contraception. We're trying to prevent overpopulation. But what ends up happening is we end up developing unsustainable populations. And so if you're looking at the second column, top one with the red X, are you guys familiar with that type of a graph, that type of a chart? So essentially what you're looking at there is the right side is going to be the male. The left side, sorry, I need my L. The left side is going to be our females, and at the bottom are going to be our babies. Up at the top is going to be our old creatures. And so up at the tippy top, we would expect there to be far fewer old creatures because they're dying off. At the bottom, we want there to be plenty of babies because things happen to babies. So we need extra babies in case something happens to them. And so when we are looking at this chart in the middle and that top one with the X, how do we think that population is going to survive over time?
Oh, either way. For lack of a better term, stock population of infants is small enough to the point where, like, the slope of the graph as it progresses through time is going to remain fixed. So if you have a smaller population of infants, the number of them that reach adulthood or even geriatric age is significantly less than a population with a much higher population of infants.
Yeah, if you lose half of the babies by the time they get to breeding age, you have half of that population to be able to create more babies, and then you lose half of that. So eventually you get population collapse. How does that fall in line with the missions of zoos and conservation efforts of zoos? Doesn't, right? We're missing out on a big factor here if we're not allowing our animals to breed. Additionally, while I definitely do appreciate my ability to provide, and I do care about geriatric care, what actual conservation purpose are some of these animals that are more senior? What conservation purpose are they actually providing to facilities, to zoos in terms of us perpetuating species?
Reproductively, none, but I would imagine that in some species, like for example, elephants, like there's matriarchs and they pass on like generational knowledge. So in some species, sure, but I wouldn't imagine reproductively they're not.
And they also take up space. And if you are in an intensively managed situation where space is an issue, that then becomes a little bit of a concern. So I'm not saying that taking care of a senior animal is wrong. I do it every day. I'm very proud of the fact that we just did an exam on a 22-year-old bobcat. He's got kidney disease. A cat is a cat is a cat is what I always say. He's got arthritis and he's, doing all the things. So yes, like it's great to know that we can take animals that far. We have the space for him. We have the space to provide him a good quality life. And for as long as he is enjoying a good quality of life, I'm happy to provide that for him. However, if I'm sitting here and thinking about what it is to be a steward of conservation, a steward of perpetuating species, what does that mean? What does that look like? And what are some of the sacrifices we might have to make? I think Dr. Guy talking about where your moral, ethical line lives is really important. And thinking about what your goals are and why it is that you want to step into a zoo career, or what it is and what it might look like if you are in small animal general practice, those types of things. Those distinctions matter. And setting those thoughts now and thinking about these things now is important because you can kind of set yourself up for success in the future, which is definitely key given, the state of veterinary medicine as a whole. So ultimately, some of the key takeaways, both of these strategies have very unique welfare implications. Aligning practices with natural behaviors benefits welfare and conservation, and I think if we're going to get to a place where we are able to promote good welfare and perpetuate species and be the conservation facilities that we claim to be, we need to have a call to action and promote informed discussions and policy changes and provide public education about what some of this might look like. Thank you. As you guys know, feel free to reach out. There's my email. You can reach out to me about zoo professional questions. If you want to schedule rotations, I do take 4th years, or match internship stuff. Happy to provide advice on that as well. What questions do you guys have?
This is kind of a question, just like anytime I'm at a zoo, I kind of wonder why it doesn't happen more, at least of the ones that I've just happened to go to. Why isn't it more popular in traditional zoos to try the like mixed species enclosures? If you can find ones that can possibly have a symbiotic or even just tolerant relationship, just like knock some walls down and make like a 4 size enclosure and just have a bunch roaming.
That costs money. If you are going to be doing an entire revamping of an area, that costs a significant amount of money. Not that it should be about money, but most zoos are profit. Most zoos don't have a lot. They have to raise funds for these big capital type campaigns where they have the ability to do these remodeling things. And in a lot of scenarios, if you're trying to, again, that's an issue with like the intensively managed spaces, you're having to work within the limitations of what you have. And so in a lot of those cases, older facilities, which I think there are many facilities that are doing a good job updating their habitats, their enclosures and things like that, but it's going to take time. They weren't originally designed with individual animal welfare in mind, and weren't designed with having these ideas of spaces for multiple animals. And so in a lot of cases, if you were to throw multiple species into the already pre-designed habitats, that would actually be dangerous for one or both of the various species that you might end up putting in there if there's not enough space for the animals to share.
That makes sense. Thank you.
Any questions on Zoom? All right. Thank you so much, Dr. Analisa. All right, and next up we have Dr. Quinn. If you are on the Zoom, can you please share your screen if you're able?
Oh, okay. Hi, so this is Dr. Quinn. She is from the University of California Cooperative Extension, the Human Wildlife Interactions Advisor. Her research and education focuses on everything from mice to mountain lions, but mostly focuses on rodents and coyotes, their management, and the pathways and effects of rodenticides on non-target wildlife. Let's welcome her.
Hi, folks. All right. Thank you so much for the invite from Dr. Ang, and I'm going to talk about some research that we've been doing on coyotes over the last few years. And if you can't hear me, let me know because the baby's about to go sleep next door. So not the greatest time in the world for me to be speaking. So hopefully you can hear me okay. All right. So today I'm going to talk about 3 different research projects that we're doing. One is looking at coyote diet and related conflicts when it comes to thinking about coyote diet. And some of you may have experienced directly the impact that coyote diet can have on humans and also on our domestic pets, because I'm going to be specifically talking about their relationship with cats. I'm also going to talk about some research that we also just had published looking at things like societal wealth and environmental predictors and how they can contribute to human wildlife conflict as well. And then the last thing I'm going to talk about is something that we just got published last year, talking about the patterns of exposure of anticoagulants in anticoagulant rodenticides in coyotes. So our question for our research was, do trap neuter return practices contribute to human coyote conflicts in Southern California? And I'd like to acknowledge my co-authors, Danielle Buckland, Jennifer Shedden, Bob Cummings, and then Dr. Paul Stapp from Cal State Fullerton. And this is part of master's research that was a kind of a combination of Danielle and Jennifer's work out of Cal State Fullerton, and that's published in the Journal of Human Wildlife Interactions. So I don't think it's a surprise to anyone that coyotes are thriving in urban communities. And one of the reasons being is that they're very much habitat generalists. Coyotes can exist everywhere. And there's kind of a joke that when the nuclear holocaust happens, all that will be left are cockroaches. And I'm pretty sure that coyotes could also be added to that list too. They have very broad geographic range because they are generalist. They're also generalist because they're able to adapt to human environment. And I would wonder, is there anybody in the audience that has never seen an urban coyote? Raise your hand. No. Okay, so everybody knows that coyotes are everywhere. And they have very flexible space requirements, which is kind of interesting. And their home ranges are anything from 1.7 kilometers squared to 108.2 kilometers squared. I mean, that's an insane difference. And one of the things that makes them so successful potentially is that they are these opportunistic predators and scavengers, and they will eat anything. And we have found everything, and other studies that have looked at coyote diet we've found everything from baseballs to upholstered furniture. As people have found condoms in coyote scats. I mean, they will literally eat anything. And there's a lot of attractants in urban areas, you could say, quote unquote attractants. I mean, they're just there anyway. Obviously, there's trash. Some places are maybe dirtier than others. There's things like fruit trees. And coyotes love things like avocados. I always kind of wonder how that works because I never feed my dog avocados. I don't want to give him pancreatitis, but then I wonder how the coyotes survive so well. Things like bird feeders, not just the feed itself, but the bird feeders often attract other wildlife as well. And then there's obviously small pets, because they could be a direct source or kind of indirectly, they could be a food source by the food and water that we provide to our domestic animals. And so there are negative impacts probably from cat feeding stations and free roaming cats, threat to native wildlife, nuisance to humans, especially here in Orange County where flea-borne typhus is endemic. Obviously, there's potential health effects on cats, and then the public health concerns, which goes back to the typhus. And then there are some papers published about how feral cat colonies are thought to attract other wildlife. And so we definitely don't want mixing of wildlife. We definitely don't want mixing of wildlife and our domestic animals. That's just a big no-no from a disease perspective. I just want to let you know a little bit about our results. A high proportion of urban coyotes in Southern California eat more cats than coyotes anywhere else. Coyotes that ate cats tended to be found in highly urbanized areas with high building densities and farther from natural areas. And so when we were looking for our coyotes, we actually received dead coyotes from all over LA and Orange County. We didn't get too much past the 110 because the traffic is horrendous everywhere, but it's even worse over here. So we didn't travel too far. And when we were looking into those things, what we did is we received our dead coyotes. We performed a quote unquote necropsies. We were more like butchers than actual people that did necropsies because we were more like into organ recovery than actual trying to look at cause of death, because most of the time we knew what the cause of death was. It was either the animal was nuisanced was nuisance and was euthanized, or the animal was roadkill and we recovered it too. And so Danielle here, that's performing the necropsy, she did hard part analysis where she would take the stomach contents and she would look at all the hard stuff that was left there. And so that included things like claws, teeth, even like that's like the hair of a rat, and different bones, things like cat food. And obviously it's not that hard to tell what things like this are that have been literally swallowed whole. And we would come across a lot of prey that was literally swallowed whole. I just can't even imagine how difficult it might be to poop out a red-eared slider, but luckily I'll never have to find out. And so when you look at the results of what the coyotes were eating in California, they eat a number of wild rodents, a number of rabbits, and they also eat lots of fruit, seeds, and plants materials. But if you look at the kind of I guess the anthropogenic food sources, you could call them, they eat quite a lot of commensal rodents, which are rats and mice that are not native to California. They eat a number of pets, and they also eat a number of human provided foods or human related foods. So, like I said, a high proportion of our urban coyotes are found to consume anthropogenic food items. Coyotes that ate native and wild mammals were associated with less developed areas, and they were in areas that had more like natural cover. So that kind of makes sense. And then the coyotes that eat anthropogenic food, so like the human derived food sources, so like we go back to the kind of the commensal rodents, the cats, the pets, they were in areas in general that were very intensively urban, high building density, and then low vegetation cover, and also further away from natural areas. So maybe the prey assemblages in general are differing in that area. And so if you look at the how we detected the animals, we did it two ways. We looked at the visual identification, and we also looked at DNA. So when Danielle was finished doing the hard part analysis, Jennifer would take what was left, she would blend it up, essentially make a molecular margarita, and then like throw it out and extract DNA. So we identified 27 cats from visual analysis, from PCR 50. The both methods was 9, and then the total combined was 86. So a very high frequency of occurrence for cats, and much higher than initially thought for coyotes in general, but also for coyotes in Southern California. Because if you look at in Southern California, what's the percentage of cats, you can see that it is significantly lower, and even in some studies it's 0. So it goes everything from 0 up to our study at 35%. And then if you look at studies from other areas in the United States, it's very, very low, except for this one here in Seattle. That's not me, that's another Quinn, randomly. But this one here is quite high in general, but also kind of on the lower end of the scale when you compare it to the rest of California. And so, like I said, a high proportion of our urban coyotes are eating cats, a very high proportion, I would say. Like I said, they tend to be in highly urbanized areas, and the locations of the cat-eating coyotes were similar to those where sterilized cats were regularly fed, which is very, very interesting. And so if you would like to read more about that research, you can in the paper in Human Wildlife Interactions. But I think it's an interesting welfare question for people that advocate for outdoor cats. And I do not advocate for outdoor cats or even free roaming cats. I think it's just a really bad idea in Southern California to let your cat out, knowing that there is such high consumption of cats from coyotes. And that's just coyotes. Obviously, there's a whole other heap of risks for free roaming domestic pets out there. So I think there is you know, a big argument among feral cat advocates that it's not humane to keep cats inside. And my argument would be it's not humane to let cats outside with this type of risk that I think is very highly correlated with areas that are dense. And we all know that there are urban coyotes everywhere essentially, but it seems like in areas where people are feeding cats that we were at least more likely to find coyotes with cats in their stomach. We can't tell the difference between coyotes that eat cats and coyotes that don't eat cats, unfortunately, because we just have a very small stamp in time. But at least from our sample size, which was quite large, we can tell that in these areas which are known to have feral cat colonies, we have an increased chance of finding a cat in a coyote's stomach. I want to move on, and I want to talk a little bit about increasing urbanization and its impact on wildlife. And I want to thank my co-authors. This is just accepted to Ecology Letters. My colleague Christine Wilkinson did a lot of work and Chris Shell to do the movement analysis for this paper. And you might recognize this guy in the middle here. I'm just going to blow a bit of smoke up his butt for 5 minutes because Dr. Eng is, I don't know if you know this, but he is one of the greatest practical instructors that I have ever had in my whole entire life. Is he sitting in the audience? Is he? Oh, I see you. Yeah, I saw your big head back there getting bigger. Yeah. And so Dr. Eng was a random find for me. I reached out to the university asking for help because I had never collared any wildlife before, and I was pretty naive. And Dr. Eng got up in the middle of the night over and over and over again to help teach me how to wrestle coyotes. We had a lot of fun. We also managed to wrangle a few students in when we did it. And I became a very good blood drawer and guesser of coyote weight. And yeah, mainly he just sat there and watched me and then told me afterwards what I did wrong. But he is, you guys are so lucky, any of you that have him as an instructor, and I was so lucky to have him help me. And maybe in the future we shall be doing other things. So watch this space. So we'll see. But yeah, it was so great to work with Dr. Eng. So you know, urbanization is not probably a new phrase that you guys have heard. It's definitely happening. And it's funny because I think it's actually not happening as big a rate in places like Los Angeles as it is in other areas, because we're kind of running out of room in LA. But it's causing humans and wildlife to overlap spaces, and this leads to conflict over resources. Some people love to see wildlife in their spaces, some people do not. Some people want wildlife only where they think wildlife should be, and some people don't think that they should be able to build their homes in the middle of where wildlife is, and that wildlife should not enter their backyard. Obviously, there's threats to biodiversity from urbanization, trying to find places to put people, and often it's in natural areas. And then that can be obviously quite stressful for wildlife populations. Climate change, climate change, climate change. I feel like we're really experiencing the effects of climate change right now, but these pressures that are on wildlife are potentially exacerbated by climate change, which can intensify habitat loss and alters animal behavior. And I don't know if you guys have seen the videos of the mountain lions and the cubs and stuff running away from the wildfires, but you know, it can have wildfire, it can obviously have drastic effects on wildlife, especially in areas where they are already threatened. So, you know, Santa Monica Mountains is already a really, really small place to keep mountain lions. Well, not keep mountain lions, but they're kind of tied in there anyway. And so, you know, climate change can have very serious consequences on populations, especially things that are already under quite a lot of pressure. Everybody likes to say the coyotes are a model species. I find them a pain in the backside, but they are great if you're trying to study urban wildlife. They demonstrate resilience despite the fact that we throw so much crap at them. But because they're so resilient in these kind of human-dominated landscapes, that can lead to friction, particularly in dense areas, right? So if you think about the last thing we talked about, like in very dense areas, there's going to be a lot of friction between the cat people and the coyote people. And then human wildlife conflict obviously can increase in because of urbanization, because you get more people. And when you have a very cosmopolitan species like the coyote, you're going to get more of them. And so it's not like just the physical encounters that can cause issues. There's disease risk. There's also pollution exposure to wildlife. And then there can be psychological stress. There can be physiological stress too, but psychological stress experienced by wildlife and humans. And obviously, one very good example of that is if when I talked to one of our master gardeners the other day, and she told me that her dog had passed, and I was like, oh no, and she's like, oh, he was kind of a crazy terrier, as we all know how that story goes, and he busted out the screen. Probably sounds familiar to all the vet people. And he never came back, and she found only part of him, and he'd been probably eaten by a coyote. And so, there's that. And like I mean, she said she was happy that she knew what happened to him, but obviously that's a huge psychological stress on the poor woman that found her half-eaten dog, basically, or not even half-eaten, just a bit of her dog. So as we talked about, they're highly adaptable, right? They exploit urban food, they can navigate dense infrastructure, and then urban coyotes have smaller home ranges in general and can travel shorter distances. However, all of this adaptation has its costs. They're potentially we don't know in California yet, but in other areas, urban coyotes are exhibiting higher stress levels. I pretty much think everybody in LA is exhibiting higher stress levels, so I wouldn't be surprised if the coyotes do too. Increased exposure to pollutants potentially, also potentially greater risk to disease. And there's a couple of things that play into that, like, it could be density of animals, it could be mixing of, domestic and wild animals, it could be a couple of things. And then they have greater reliance on human food sources, which ultimately can lead to more conflict. Um, you know, Urban coyotes are kind of bold, right? They, in general, are quite explorative. They're more visible. I mean, we see them all the time. And because of that, they're susceptible to interactions with humans and further escalate tension. Okay. Um, it's funny because I feel like a lot of the time when I get like a conflict call, conflict is kind of in the eye of the beholder. Often people see a coyote and they think that that's a conflict, and then other people see a coyote and they don't think it's a conflict. And I think that's one of the hardest parts of my job, is that people love coyotes and people hate coyotes and they live next door to each other. And it's really hard to manage that kind of conflict. Um, and so a lot of the time when we're looking at ecological studies, we're only looking at ecology, right? We're looking at the health of the animal, we're looking at different demographics of the wildlife, we're looking at like the environment itself. And the same for when we looked at the cats. We only really looked at things like building density, and we looked at um, things like distance to green space. We weren't really thinking about wealth and how that shapes the environment and how that could potentially influence coyote behavior. So we looked at like wealth disparities and socioeconomic conditions, because they have the potential to shape the urban environment, which obviously has a knock-on effect, because how the environment is can impact the behavior of the wildlife itself. We all know that wealthier neighborhoods have more green space. I mean, even wealthier neighborhoods just have yards, never mind access to parks, etc., big golf courses, things like that. Lower income areas may have more food, and in general, it's just because of trash management. So there's like not as good trash management in general in lower socioeconomic areas. Attitudes to wildlife may differ in these neighborhoods. Wealthier neighborhoods may invest more in removing wildlife, for example. So it's totally legal to take a coyote out if it's quote unquote being a nuisance. You don't have to provide any proof or anything, but it's completely legal. And underserved audience may not have those resources. And it's interesting. I have a program called Coyote Cacher, that collects conflict information. I call it encounters. I try not to call it a conflict information, but encounters with coyotes. And if you look at that map, even you can see huge areas of LA that are empty. And it's not that they're devoid of coyotes, it's that they're devoid of people that potentially don't have access to the internet, or maybe they're ESL, or maybe they have 3 jobs and don't have time to give a shit about coyote conflict, to be honest. So there's probably a lot going on there. And it's important to understand that these societal factors can have impact. And so we know that pollution alters movement, and that they may travel longer distance or have increased energy demands potentially as well, which could lead to increased conflict. And I just wanted to draw attention to this fine looking veterinarian here, just in case you didn't see him right there. And that's us in the middle of the night. I will tell you that I'm very, very strict about keeping my crew very, very safe. And Dr. Eng's the only one that's ever gotten poison oak or ivy or whatever you call it over here. So you should know that. So he's not totally trustworthy, just mostly. So, wait a minute. There we go. So between October 2019 and June 2021, we collared 20 coyotes, and we actually collared them because we wanted to actually look into the effectiveness of hazing. But the world changed quite dramatically in this period here. And so COVID kind of messed us up a little bit, and we didn't have time, but we collared 20 coyotes, 14 males, 6 females, and their collars remained active anywhere between 1 month and 23 months. I think the one that lasted for 1 month was the one that died in Flea's house from the Red Hot Chili Peppers. That was quite an adventure. He had a really, really big house, actually 2 houses on this property. But you can see here a little bit, since you guys are veterinarians, you might be interested. These are our collars. Our collars were in always less than 5% the weight of the animal. We would pull the animal, we would muzzle the animal. I don't know what the veterinary term is, but coyotes kind of just lay down and took it in general. They were very docile. We provided very, very mild sedation for our coyotes. They were essentially awake, apart from the one time we used ketamine and we swore we were never going to use it ever again, and we didn't. But we had it in our back pocket just in case we ever needed it. But we would cover the animal's eyes. Sometimes we would cover its whole face apparently, but we'd obviously try and make sure that its airway was unrestricted. And always on multiple layers, because this was the middle of the night, to make sure that the animal didn't get too cold. And we did have one time once where Dr. Ang suggested that I bring a coyote that wouldn't leave, even though there was nothing medically wrong with it that we could see, home with me. In our crate to look after, to make sure that it was fine. And I didn't want the coyote to die, but I also didn't want my husband to divorce me. And he agreed that his wife would not be very happy either if we brought said coyote home. But someone else babysat for us in the field, luckily, so we could go home and get some sleep. But yeah, coyote trapping is wild, even though the coyotes in general were quite well behaved. So our questions were, for this study, how are coyote home ranges structured along heterogeneous social ecological gradients? So not just ecological gradients, that's already been done. We kind of know what's happening there. What factors are the best predictors of coyote movement, and how do coyote movements differ across varying levels of environmental health and vulnerability? And so we collected a lot of data. I mean, these are all data sets. They're all available, but for ecological, we looked at like density of vegetation, distance to rivers and streams, lakes, green spaces, things like parks, golf courses, cemeteries, and then linear infrastructure like road density, distance to flood control structures, and distance to railway. And then our human socioeconomic and environmental health, we looked at human population density, building density, developmental density, median income, noise pollution, and then a pollution burden percentile. And so what we know from this research is that coyote home ranges in higher pollution and densely populated areas were larger, indicating that they have increased energetic demands in these more anthropogenically burdened environments. So very, very dense, lots and lots of people. And then potentially because there's lots and lots of people, they're very, very polluted. But it could be the other way around, that in areas that there are that there's lots of pollution, that it's people are often, housing is often maybe cheaper, and it becomes more dense because of that. And then daily displacement and mean step lengths were higher in areas with lower vegetation. So that's our density vegetation index that we have, the NDVI, lower income and higher human activity. And so just to tell you what these mean, so daily displacement is the average straight line distance an animal travels between its starting location at the beginning of the day and where it ends up at the end of the day. And then the step length is the distance it travels in between the first and the second time that we encounter it, right? So in between this like A and B, but there's obviously A, B times a million during the day. And then movement was seasonally influenced with longer step lengths during drier seasons, and that was more than likely due to resource variability. Coyotes preferred areas with vegetation, roads, rivers, and railways, but avoided wealthier neighborhoods, pollution heavy zones, and highly developed areas. Societal factors such as pollution burden and population density were stronger predictors of movement actually than the purely ecological ones, which is really, really interesting. And this is really the traditional way of looking at coyote movement, is looking at ecology and not looking at the societal impact. So in burdened areas, coyotes exhibited stronger avoidance of population density, development, and pollution, and showed greater use of parks, vegetated space, and linear infrastructure, like railways. And so, what does this all mean? Well, the integration of societal factors into models that look at movement make it better. They make it easier for us to understand what's happening compared to these traditional ecological methods. And then coyote selection patterns reveal very complex trade-offs between like the things that cause risks that are created by us, and then the resources that are available, well, naturally and unnaturally to the coyotes. And then when you think about linear infrastructure, things like roads and railways play dual roles as both barriers and facilitators of movements. And it's really interesting that something like a coyote could really benefit from a road or from a railway, but something like a mountain mine could be seriously impacted by it. So it makes it complicated when you're planning, if you're considering wildlife when you plan. And so wealthier neighborhoods may deter coyotes due to increased human intolerance and trapping practices, despite the fact that they could be ecologically advantaged because of more green space. So this is a fantastic picture taken by a lady called Johanna. Can't remember what her real name is, but if you look her up on Instagram at Cougar Magic, she has the most insane pictures. They're just brilliant. But this is a picture that she caught of our coyote in the Verdugo Mountains. And what we know from looking at this movement data is that urban planning should prioritize vegetated connectivity. That's not really a surprise to anyone, right? But especially in areas that are burdened, which is often areas that are neglected from any type of planning, and this would help mitigate human wildlife conflicts. And then recognizing the disproportionate impacts of urban features on wildlife can inform equitable conservation strategies for biodiversities in cities, which is often something that the people that are underserved are not thinking about, but it's something that should be thought about for those communities. And so, yeah, moving on, because I don't have a huge amount of time. Patterns of exposure of coyotes to anticoagulant rodenticides. This is pretty much the bread and butter of my my research program, and I want to talk about data that we've collected over a long, long period of time. I want to thank my co-authors with this. Some of you may recognize Ariana. I think Ariana is still a student in Western. I don't know if she graduated or not, or but this was part of Ariana's research and stuff that Danielle helped me with in collaboration with Dr. Paul Stapp from Cal State Fullerton and Dr. Roger Baldwin from UC Davis. And so I don't know how familiar you guys are with anticoagulant rodenticides, but I assume the veterinarians come across them probably more than I would like to hear. But you know, these are chemical compounds that are used to control rodent populations, and what they do is they don't really cause internal bleeding. I mean, they actually what they do is they inhibit the ability to clot your blood, which causes internal bleeding, technically. There's two types of anticoagulant rodenticides. One that's called first generation anticoagulant rodenticides that we refer to as FGARs. And they require multiple feedings for the rodent or the target pest to get a lethal dose. And then the second generation anticoagulant rodenticide or SGARs, which are generally considered highly toxic and effective after a single dose. And there's several of those too. Now, there's a lot of environmental concerns with anticoagulant rodenticide, one being bioaccumulation, the other being secondary poisoning, and then impact on ecosystems. So these compounds, they bind very tightly in the liver, and so it's difficult for the liver to essentially clear these compounds. And so they bioaccumulate, they can cause secondary poisoning. So if something eats the animal that has eaten the anticoagulant rodenticide, they can acquire this. And obviously that could have knock-on effects to the consumer. And so there are obviously key challenges to all of this. Until fairly recently, there's been widespread use of anticoagulant rodenticides in urban and suburban areas. There are now stricter regulations in place. Something called AB 1788 has caused a moratorium on the use of all anticoagulant rodenticides in the state of California. And it's the strictest in the country. It may even be some of the strictest in the world, actually. The problem on the flip side of this is, and if you think about this, even if you think about a little bit from the last study we talked about, like the societal impacts of this, is that there's often a lack of alternatives, and either effective alternatives or affordable alternatives. So in fact, the people that are going to suffer the most from this are the people that actually can't afford to hire pest control to solve their issues. So there's quite a kind of a social impact of banning anticoagulant rodenticides as opposed to the positive of potentially helping negate any impacts of it. And so our objective was to assess anticoagulant rodenticide exposure in urban versus rural coyotes, and also to examine factors that may influence these residues that we are finding in the livers of the coyotes. One of the main arguments is that there's actually more of an impact of exposure in rural environments than there is in urban environments. We, once of all, you might recognize this map because we often are using our coyotes for different things, because once these animals dies, we want to make sure we get the most information we can from them. And we collected coyotes and necropsied them, and a big thank you to some people here. And 3 of these are actually, well, one wasn't a Western student, but Emily Caslow and Madison Cooper were Western students that helped us out. We looked at exposure in urban coyotes in LA and Orange, sorry, I'm really distracted because my husband's getting the baby to sleep, and there's really big banging noises coming from next door when the baby should definitely be already asleep. I know the moms out there are like rolling their eyeballs into another dimension right now. Anyway, so we also looked at 19 rural California counties. We had liver samples from 365 urban coyotes and 120 from rural coyotes. We tested residues of the livers, and we also looked at stable isotope analysis for dietary patterns. This is part of Ariana's master's work, where we looked at a subset of 50 coyote carcasses, and we did very, very detailed necropsies, and we looked at things like body condition score. And I believe that this is something that's fairly commonly used in veterinary medicine, or maybe even zoo medicine as well. And we looked at kidney fat index, which is obviously something that you're probably not doing on live animals, and then Helminth load also. And we looked at also things like subcutaneous hemorrhaging, and things that would be indicative of coagulopathy, basically. And it was kind of a big surprise. Well, it wasn't a big surprise to me, but it's a big surprise to everybody else that urban coyotes are ridiculously exposed to anticoagulant rodenticides. So 98.1% are exposed to at least one anticoagulant rodenticide. 97.3% of them were exposed to second gens, and 67.4% of them were exposed to first gens. And then when you look at rural coyotes, they're exposed on way less of them are exposed. So 41.7 of them are exposed, 30% of them were exposed to second gens, and almost 30% of them were exposed to first gens as well. And so this difference is not that surprising either, because in general in agricultural areas you're not able to use second generation anticoagulant rodenticides. So often they're not permitted for use in these areas. So urban coyotes were more exposed to many more anticoagulant compounds as well than their rural counterparts. Most rural coyotes were exposed to no anticoagulant rodenticides, which is interesting. Only 19% had residues of 2 or more compounds. Urban coyotes usually contained residues of 3 or 4. That's like 71% of them. And almost 10% of the urban coyotes contained 5 or 6 compounds. And then they also had lower liver residues. So like the amount of rodenticide that we detected in their livers was much, much lower. So the summed first generation anticoagulant liver residues were similar between urban and rural, but they were way less exposed to the second generation anticoagulant rodenticides. There was no evidence for difference in the numbers of compounds between males and females. No evidence of any seasonal difference either. We looked at euthanized and roadkill animals, and so there was no difference between them. Juveniles were often overrepresented among urban coyotes that had few ARs, but they were underrepresented in those most heavily exposed too. We found a little bit of weak evidence for a difference in the number of anticoagulant rodenticides between juveniles and adult coyotes, but there were too few rural coyotes to compare. And then we didn't find any difference between males and females. I don't want to get into the science too much, but we did something called principal component analysis, and 71% of our principal component analysis explained the variation. And what that was is that in areas that had, we had 2 principal components, basically. One was a gradient from low to moderate and high intensity development with high building densities. And then we had another principal component that distinguished between locations based on whether they had surrounding open space, basically. And that showed a lot of variation in our exposure. When we looked at body mass was the only predictor of the number of anticoagulant rodenticide compounds. The mean mass of coyotes with less than 2 AR compounds was 9.2 kilograms, whereas coyotes with more than 5 was considered significantly higher, in fact, with 11.1 kilograms. We also did something called stable isotope analysis, which showed us that our anticoagulant rodenticide residue concentrations were highest for coyotes that were consuming basically rodents. I mean, that's not really that much of a surprise, because coyotes eat a lot of rats and rats eat a lot of rodenticide. But it was in areas with less intensive development and more natural open space, which was interesting. Increased as coyotes ate more prey so AR exposure increased as coyotes ate more prey from relatively higher trophic positions, such as commensal rodents and mesocarnivores. And there is publications recently published that show that mesocarnivores in places like Chicago are almost 100% exposed. And then coyotes living in areas with more medium and high intensity development and higher building density had something called enriched signatures, which suggests that they consumed more cats and anthropogenic food, which is something that we basically already had. So coyotes and mange. Now, I don't know if mange is something that you come across a lot with in your domestic animals, but in coyotes it can be potentially quite an issue. There are several types of mange. I think the one that's of the biggest concern when it comes to anticoagulant rodenticide is something called Edric, I think is what it's called, mange. You guys probably know more about that than I do. And basically, there's a lot of talk out there that anticoagulant rodenticide causes mange in wildlife. I can tell you that that is definitely not true for coyotes. 3 of 92 rural coyotes examined showed obvious signs of at least sarcoptic mange, although I don't know if they actually looked at the mites. One had a lower liver diphacinone conservation, 2 had no detectable residues. And then of the 50 million coyotes that come through our lab, very, very few of them exhibit any kind of mange symptoms. And of the ones that did, the liver of these animals had 2 or 3 SCAR compounds. And these are mgs per kgs. I mean, these are very, very low residues, but obviously the range is considerable. This is low, this is fairly high, and then 1 FGAR. And in general, mange was uncommon in coyotes, which is obviously good news, but obviously AR exposure is not. So there's 100% definitively no link between anticoagulant exposure and mange. In looking at our necropsies and our body condition score was positively correlated with our kidney fat index, which is great. Interesting enough, our body condition score was not related to helminth load, but we only looked at the helminth load in the digestive tract. So there could have been parasites in other places as well. The sum of the FGAR residues was inversely related to our kidney fat indexes and positively related to helminth load. So the higher your exposure to your first generation anticoagulant compounds, the higher your helminth load. And then coyotes that had high hemorrhaging values had low body condition scores. That's not surprising. And then the number of AR compounds did not vary with hemorrhage intensity. So it's probably more likely related back to the individual response of the coyote. So coyotes are all exposed to anticoagulant rodenticide ridiculously so. Urbanization ultimately amplifies the risk that you are, as a coyote, you are going to get exposed to anticoagulant rodenticide, and there is high use of this in urban areas, or at least there was high use of this in urban areas. This was all conducted prior to the moratorium on the anticoagulant rodenticides, and obviously repeated exposure is probably leading to bioaccumulation in urban areas, but the risk in rural areas seems like it's considerably lower anyway. The one thing that we have to think about is that even if anticoagulant rodenticides are not the direct cause of mortality, and I think it's probably unlikely that there are any population level impacts of rodenticide exposure on coyotes, but it's very, very hard for us to answer that question. But there could be something called sublethal effects, and those are really, really difficult to manage or to measure, and that's something that we tried. We know that urban coyotes with high, at least for first generation anticoagulants, tended to have poor body condition, and so you could call that a sublethal impact. I mean, it's hard to 100% say it, but I think that that's definitely, we're trending in that direction. Absolutely no association between exposure and mange. And then it has been suggested that like one of the sublethal impacts of exposure could be that it alters animal movement. So if you have a big hematoma or some sort of a hemorrhage, it's going to make you slower. and that you could be more susceptible to vehicular strike. And so roadkill coyotes actually did have higher concentrations than euthanized ones. So that's pretty interesting to think about too. But once again, it's not, I mean, it's hard to tease out sublethal effects. There is widespread use of anticoagulant, or there was at least widespread use of uh, anticoagulants, and that's shown in the basically this wide scale exposure. And it kind of just highlights that there's rodents everywhere and there's rodenticides everywhere. Um, they are rodenticides. ARs are readily available in retail stores, in other places, not in California. It's easy enough to get it online, even though you're not supposed to. And obviously, there's international sources as well. They're very effective. They're very convenient, and it kind of makes them standard practice. Now in California, they're banned, and so it's not standard practice anymore. But there's also, you guys are probably, you veterinarians that practice are probably also coming across things like bromethylene and cholecalciferol, which are very, very difficult potentially to manage. Not that anticoagulants are good, but anticoagulants do have antidotes where treatments for bromethylene and cholecalciferol, which are the compounds you can use now, or well, you can talk to your veterinarians about that. I'm sure it's not that easy as far as I know. But the problem is that it's very, very difficult to manage rodents, and we have a poor understanding of how to manage rodents, and that makes it like really hard for us to manage rodents. And so people that manage rodents were using the easy way out, which was anticoagulant rodenticide. And the problem with not using stuff right is that you can lead to things like genetic resistance, which just can make the thing even harder. And I'm sure I'm out of time now, but there is obviously a huge issue with public perception here. Like, this is a massive issue when it comes to human-wildlife conflict, and it's not just coyotes that are exposed to anticoagulant rodenticide. It's potentially all wildlife in Southern California. Even things that don't actually eat that many mammals are exposed to anticoagulant rodenticides. We've already talked about this, that coyotes are good environmental sentinels, and so we will continue to monitor them. There have been advancements in monitoring. There's other things that can be affecting coyotes and other wildlife too that we need to keep an eye on. But it's difficult to interpret this biological information, particularly from a dead animal. So we've kind of moved on, and now we are monitoring live carnivores in the field. So we've collared 12 more coyotes, I think it is, and we are monitoring their exposure as they live, as opposed to scraping them off the floor and trying to figure out what's going on. So I'd say I'm definitely out of time. I'm not sure if we have time for questions, but if not, please feel free to contact me. You can call me, but I will not answer my phone. But if you'd leave a message, I'll definitely call you back. I am based out of Irvine, although I use my home office a lot. My research is described on my website, www.ucscurry.com. I am a rodent person, by the way. I'm definitely not a coyote biologist, although Dr. Eng has made a good job of trying to make me one. And so you can find more about our research on Instagram at Cosmopolitan Coyotes, or on LinkedIn at Ratwhacker. So thank you.
Thank you very much. Dr. Quinn, do we have any questions?
All right, time for me to go get the baby asleep.
All right, thank you so much. Thank you for coming, and have a good day.
Thank you.
All right, now we should have lunch in the Commons. I don't know if it's here yet, Amy. Lunch is downstairs, everyone. We will be back up here at 1:30.
Okay, I hope everyone had a good lunch break. So we're starting off the afternoon with Dr. Erik Hostnik. He's completed his radiology residency and is now a tenured associate professor at Ohio State University of Veterinary Medicine. He is what? The Ohio State, sorry. He is double boarded as a diplomat of the American College of Veterinary Radiology with certification as a general radiologist and an equine diagnostic specialist. Dr. Hostnik is the primary radiologist for an international zoological centric radiology service through the Brookfield Zoo, Chicago, and he routinely works locally at the Columbus Zoo and Aquarium. Dr. Hostnik formed ACVR's Zoo, Exotic, and Wildlife Diagnostic Imaging Society, and he is currently the organizing editor and author of a developing textbook, Diagnostic Imaging Zoo and Wild Animals. He is the lead radiologist for the Zoo and Aquarium Radiology Database, which is a free web-based imaging resource for zoos, aquaria, students, interns, residents, and radiologists. So let's welcome Dr. Hostnik.
All right, thank you. I'm gonna sort of include a clinical talk to accompany some of this well-being, welfare topics, because this is something super pertinent in the management of giraffes and some ruminants across zoo collections, and it's particularly important in the giraffe world. So we'll talk about how we manage this as a proactive herd tool. And so my position being at Ohio State, I actually spend a lot of my time in the zoos. And so I live 2 miles from Columbus Zoo. And so I'm spending a lot of my time on site building protocols, doing imaging. And so this is just another sort of day where we're doing some imaging of some abdominal stuff with giraffes. We're conducting some research projects on motility issues or motility screening in healthy populations in order to know some abnormal stuff. But what we're going to focus on today is going to be this distal extremity stuff. And so what I want to emphasize is that this sort of, it looks like with this picture, I'm head level with almost their hip at this point, but you'll notice from a different angle, I'm up on a step stool. And even then I'm still up above my head with the probe. So these things, again, massive. If you have not stood next to them, absolutely massive. So putting this into context, we've got our adult giraffe. We're focusing today on this portion of it, the tiny, tiny toe of the giraffe. Many things can go wrong. This is one of the things that is at the top of our list that we are very active in evaluating, screening, managing, doing routine checks on. So, and 2 on each foot. We're going to focus on the forelimbs because a lot of times the behavior, the training, and the pathologies are primarily forelimb. So when we talk about giraffe well-being, giraffe conditioning, giraffe behaviors, giraffe care, 4 big areas of concern are going to be the medial, lateral, P3s of the 2 forelimbs. So we've got our 18 to 19 foot adult giraffe. We've got about a 6 foot May. And we're dealing with an animal that is about 3 Ms, and we're having to manage a very tiny, tiny part of this animal. And so today we're going to emphasize the clinical aspects of this piece of anatomy. We're going to demonstrate some standard views so that if you are in the situation where you're helping out a team with some giraffe care, these are what we recommend as standard views, and we like to get on all of our giraffe. They're very common in zoologic collections. So if you go to a zoo, it's very likely that a giraffe will be on amongst the collection. I'll demonstrate a little bit of the standard imaging projections. I'm going to highlight some of the anatomy that's very important for my eyes when I'm looking through the radiographs as far as drawing attention. And then I'm going to highlight some areas of specific pathologies so that when you guys go to externships or show up for interviews or are talking to colleagues about some giraffe imaging, you guys get to look like some superstars because these are some expected areas of pathology. So with imaging, radiographs are going to be the bulk of what we do. It's very hard to get these animals when they're anti-mortem into any sort of advanced imaging. So we do a lot of our advanced imaging post-mortem so that we can learn about all these tissues that we don't see. So centrally, our radiograph, we know that there's a lot more tissues than we can see in the soft tissue surrounding. So here we can see the difference between bone and soft tissue, but we can't see all this nuanced little soft tissue. With this MRI off to the left here, we can see the deep digital flexor tendon. We can see superficial digital flexor tendon. We can see joint fluid in through here. We can see cartilage here. We can see the prototrochlear bursa. We can see sort of the suspensory of the navicular bone here. We can see our impar ligament. So that's all stuff that we know exists, but we don't see. What we can see are changes to the bones that imply changes to soft tissues, right? So keep that in mind as we're going through these radiographic changes, that there's always inferred changes to soft tissue structures adjacent. Knowing these attachments are important, knowing how the bony pathologies impact the neighboring structures, super important. So, but that's what I want to emphasize with how we're interpreting these radiographs, because it's much more than just saying, oh, there's a defect. That's it. There's a whole lot more going on. And so let's recall a little bit of ruminant distal extremity anatomy. If you guys can walk away with understanding a little bit more of ruminant anatomy and radiographs, you can translate a giraffe distal extremity to a goat. Clinical implications might be a little bit different, but you're still going to see the same bones, which is fantastic. So goats are in every petting zoo. So if you even end up at a petting zoo, you're still going to use this. We've got our P3s, P2, P1, common metacarpal. So P3, P2, P1. These little guys down here, distal sesamoids, are navicular bones. Here's our proximal sesamoid bones, right? Here's our lateral projections. Here's a oblique DP projection or dorsal palmar projection. And we just have different projections as far as getting different angles. We're just seeing different bits of anatomy. Hard to see the naviculars on this oblique DP view. I can see it much better on these lateral views. So the complementary of multiple images gives us the power to say more about different structures based on different views. So not all these images are going to be equal as far as the information they provide, but the whole is greater than the individual. And again, just recalling that the complexity of this, we're seeing a lot of the bony structures through this overlying soft tissue. So when you walk up to this animal, recall the landmarks of where this hook capsule is compared to the bony structures. Recall where the split of the digits are compared to, so our fetlock joint here compared to our overlying soft tissues. So your job as clinicians is a little bit more difficult to identify what our landmarks are for the underlying bony structures. And P3, P2, P1, navicular bone. Quick little reminder there. One thing I'm going to demonstrate a little bit is that since we're taking a three-dimensional structure and flattening it into a two-dimensional image, there's going to be some degree of distortion of anatomy. And what we see very commonly is that there's a degree of magnification. That means any piece of anatomy that is not right up against our plate or detectors will look larger than it truly is. So if we are imaging from medial to lateral of this digit, and the plate is up against the lateral aspect of that leg, the lateral digit will look smaller, and the medial aspect of that, the medial digit will look larger. So when we look at these digits and one looks larger than the other, that magnification is real, and that's because of distortion of three-dimensional structures being pressed into a two-dimensional image. And again, just recalling some of this more advanced anatomic structures associated with these radiographs. Some terminology, I'm just going to level the playing field just in case you're not familiar. Proximal being up the leg, distal being down the leg. Dorsal, since we're below the carpus, is going to be front part of the leg. Palmar, since we're on the front leg, is going to be the back side of the leg. If we were on the hind leg, plantar would replace palmar. And then medial and lateral are kind of intuitive in that medial is towards midline, lateral is away from midline. So one thing I have emphasized and have tried to bring with me from the radiology world into the zoo world is a lot of times it's move fast, move fast, move fast, because an animal's under anesthesia and you have a lot to do with acquiring blood, acquiring measurements, providing medications, doing subcutaneous fluids. There's a lot of things to get done, but one thing I have tried to generate so that things can move efficiently is build imaging protocols so that people can move quickly through their through a list of images so that we can move fast and acquire a full study. And so by generating a consistent list of images that we want to acquire, whether it's a giraffe limb or a thoracic study or a turtle radiograph series, by having a checklist of what you want to accomplish, everybody's on the same page before that animal's anesthetized or sedated. And people can go through that checklist really quickly and not have to say, okay, what's next? And so I think that's important because it generates a permanent record. When this animal potentially gets sick or lame in 2 years, you can look back on that original radiograph and compare and say, have things changed? And so I think that's something that is becoming more and more important as we are developing more permanent digital records, is that we're oftentimes looking back and saying, 2 years ago, we have a record of this radiographic series. We have a full series then. How does it compare? And so that means we are creating a nice digital visual representation of pathology over time in order to, one, answer the question, have things changed, but also answer the question, how are we doing managing this patient's discomfort, pain, pathology? Are we improving? Are we static? Are we worse off? Because then that becomes a big part of having tough conversations about an animal's well-being. Keeping the standard of care high, so making sure markers are on the images so that everyone, so that there's not a miscommunication, so that there's not doubt as far as what digits what are, which is medial, which is lateral, especially when we're talking about distal extremities. Improving the quality of these images are valuable, so cleaning off distal extremities when you can. So reading this P3 image through all this granular debris is a little bit tougher. So what we can do is just clean off that debris and look how much that improves the quality of that image. That takes 5 seconds of a steel brush just brushing off the distal hoof, right? So if we know that we're going to be taking radiographs of a giraffe distal extremity, keep a hoof pick in the back pocket. You'll be a hero at the end of the day, right? Just thinking ahead. So this is what it looks like as we are getting into what radiographs are looking like with giraffes. We do all of ours under behavioral training, unless we're doing a full procedure. But we have our giraffes trained to to voluntarily step on things and work with our trainers in order to position themselves so that we can get radiographs. And so we have this reinforced plate so that this, upwards of 2,000 kilogram animal can step on it without it breaking through. And we can place the plate within this reinforced container. Animal can step on it. Even if it's a needle, placing something on the lateral aspect of the limb so that when you're looking back on radiographs that there's a lateral marker, valuable. If you got change in your pocket, throw down a dime on the lateral aspect, does the same thing, right? So as long as you have a way of denoting laterality, you'll be saving yourself a headache in the long run. Doesn't have to be a true L or a true R if you know that you're putting things on the lateral aspect of the limbs. You'll find that sometimes you'll have a recumbent or standing animal. This is really individuality preference. So depending on how zoos work, I don't tell them one way is better than the other. I think if they are consistent in how they work, you'll find that interpretation over time is easier if they're consistent. Because what we all find is that when they're weight bearing, angles of joints change. You might find that pressure between joints change as well. With recumbent, you might find that the toe's a little bit more pointed. What's important to me or anybody that is taking record is to note that these are images that are acquired non-weight bearing versus weight bearing. That way, when you guys look back at the records, it's important. It helps who's ever comparing to a year in advance to note that they are trying to do apples to apples rather than apples to bananas. So this is my workflow, or this is what I recommend as far as a list. And it's a whole lot of jumbling things, but I'll show you visual representations of these. And I put these top 3 here because these are going to be the ones that are, if you can only get 3 done, these top 3 are going to be the ones that provide the most clinical information. And that's a straight lateral, which you guys have seen already, that DP oblique, which you guys have seen already. And you've seen this weight-bearing DMPL low. I didn't call it out yet, but I'll show you why this is an important one. These non-weight bearing ones are oblique ones are ones that we've been working on that we've found helpful for ours, but it does take training some of our giraffes to get some positioning. But now that we've got a large herd that can do this, we feel it's really improved the care and well-being for our giraffes when we're tracking certain things. So these top 3, again, are going to be the ones that I would say if you are pressed for time, this is going to give you the most information for care of distal extremities. If we're talking about flow and order and you've got a giraffe that is compliant, this would be an order that I would minimize the amount of times you had to change how the giraffe is standing or where the plate's located. But again, those are some minor details after the top priority being the straight lateral, the DP oblique, and the weight-bearing DMPLO. So, you guys have already sort of seen this one. Let me get into some of this. So this is us positioning for the DP oblique. You can see that we are walking up, we help place the limb, we throw on our laterality marker. And all these images that I'm showing you are all just sort of staged for how we place. When we acquire, we've got more sort of radiation protection standards, but you can see we've got straps near the brisket of the giraffe. They walk up with 2 keepers that are sort of signaling to the giraffe to step, whistle blow, bridging activities. One of the keepers helping guide the leg to where we need the placement, and then placing the needle, right? So this is a nice little quick activity. We have our technician at the zoo who has the X-ray tube ready to go at the angle that we want, and we can be efficient about that. Typically, myself or one of the vets is standing at the little TV console just to look at the radiograph and say, great, positioning looks good, technique looks good, move on to the next one. We're not doing full diagnostic review at that point. We just want to minimize the amount of time that we have to have the animal positioned in a awkward place. So we just do a quick quality control. And what's this look like with the DP oblique? We're about 45 degrees from the ground. We see our P3s, our P2, our P1, and our naviculars are hiding right behind there. It gives us a great view at the solar margins of the P3. And so you can kind of see the angle that we're going for here, looking down. With our straight lateral right here. And we go from medial to lateral because we don't want a plate sitting underneath the giraffe. We don't want them stepping on for their safety, for their well-being. So we have a cross imaging where we have our X-ray tube set up on the contralateral side, and we image from medial to lateral with the plate set up on the lateral aspect. And now that goes to the magnification now. The lateral aspect is near the plate and the medial side is away from the plate, so the medial digit is magnified. But this is parallel to the ground, horizontal, no angle. And what we see here, overlapping P3s, some magnification. Look at this navicular bone is much bigger than this one, so that's some magnification. But we start to see overlapping P3s. We can see solar margins of these two P3s. We can see joint margins of the distal interphalangeal and proximal interphalangeal. We can also see sort of angle of hoof wall relative to the P3s. We can also see borders of navicular bone. If you recall that DP oblique, we're seeing different margins of the navicular bone. We're also seeing different margins of our P3. So we're compiling different aspects of these bones in order to get a full picture in our heads. So what it looks like, we set up, we're horizontal to the ground. We ask them to position so that they are on a little block and we're straight across. Again, parallel to the ground, angle about the coronary, top of the hoof here, straight across. Now with this standing DMPLO, we're about a 10-degree angle and we ask to come up. So what happens there is that we are now offsetting our digits. And what that will look like, one digit gets offset from the other. And it's the more magnified digit. So the medial digit is actually portrayed to be pushed downward, and the lateral digit is portrayed to be pushed upwards. What this does is we get to isolate our two solar margins because some of our major pathologies occur right along this distal border of P3. So since we know the type of pathology we're screening for, what we want to do is separate the toes to the best of our ability to screen this distal margin. So we come up about 10 degrees and image at that angle. So what we hope to see, medial digit, which is magnified to go a little distally, lateral digit pulled dorsally. And you'll see these distal P3 solar margins, right? So that's what I'm looking for my quality control. I want to be able to pick off those borders because my biggest concern is going to be regions of this caudal P3, our palmar P3. And I'll show you examples why later. So what happens here? with that standing DMPLO, when we lift our X-ray tube upwards, that medial gets portrayed downward. So the entire digit gets portrayed downward. Our navicular bone goes down. Our distal interphalangeal goes down. Our proximal interphalangeal goes down. Whereas with our lateral digit, our proximal interphalangeal goes up. Our distal interphalangeal goes up. Our solar margin of P3 goes up. Our navicular goes up. And you can appreciate that magnification difference. So if you're questioning which digit gets moved, you can always fall back on that magnification. The digit that's further away from the plate, which is going to be bigger, is the one that's further down. So tried and true magnification. And magnification can be sort of a mind trick on people. So I like to sort of emphasize it like this. If this is my P3, and this is not the angle that we'd image, but you can sort of project a shadow, if you were to use a flashlight here, of this structure onto a wall or a plate in this instance. If you move this structure away from that plate, the projection of that shadow is bigger. It's that simple. It's that the further you're away, your boundaries are going to be projected larger. So how is this weight-bearing DMPLO working? So if we take our medial and lateral right here, all I did was strip away the skin here. My plate's on the lateral aspect of this limb. My tube is on the medial aspect, imaging across. As we image across, we have the colors coordinating to running through the different aspects of our P3. That medial gets pushed downwards. So this goes for obliques when we're talking skull. This goes for obliques when you're doing DMPLOs from the fetlock. This goes for obliques if you're doing DLPLMOs. If you just look at what the peripheral structures are, that's what's being projected out to the edges. And so I can actually make a very similar looking image occur by changing this angle. So why don't I do the same thing and get my lateral to pop up as the more distal structure by dropping my tube and doing a 10 degrees down angle, right? That makes sense. Why wouldn't I do that? The issue is the ground and our ability to get low enough. So if we built a pit and we're able to do it, we could manage it. But that's the big issue, is that because we're asking our giraffes to stand on a block that isn't as high, we can't get the angle we want in order to do that. So this is not something that we feasibly can do with our setup at this point. And so it's possible, but it's not it's not something that we feel comfortable as far as lifting up the block high enough for their safety. And so what it looks like if you are holding the tube, you'd come up 10 degrees and image downward, just like that. You can see that we're not a straight lateral, we're just imaging downward. So in order to accomplish what I just said was not possible as far as that pushing the lateral P3 more distal in order to evaluate that solar margin, we've worked in order to do non-weight bearing images where we are now positioning our digits non-weight bearing and up, where in order to mimic that DMPLO, we can come up 10 degrees up the leg and 10 degrees down the leg without being blocked in order to offset those two digits, right? Does that make sense? And that we're basically doing the same thing as the weight-bearing DMPLO, but because we have lifted the leg and flexed, we now have the ability to go up and down the leg in order to offset our P3s. And again, we've spent the time to work that behavior because how common certain pathologies are and how important it is for their well-being to monitor those pathologies. And so with this non-weight bearing image, we will do 2 quick images, proximal 10 degrees, distal 10 degrees. And so all we're doing is from here, instead of a straight lateral, we're going down 10 degrees. And what this looks like with a little diagram is that you can set up as a straight lateral, then you're just going to shift 10 degrees one direction, shift 10 degrees the other direction. And again, you're going to be offsetting your P3s. So by shifting up the leg, kind of mimicking our weight-bearing DVM-PLO, you're highlighting our medial P3 again. By shifting down the leg, you're highlighting that lateral surface. And so this is new information for us. This is the margin we have not seen yet. So if we're concerned about lateral P3 pathology, we're going to spend the time and effort and prioritize this projection. And again, by working this behavior and making sure they're comfortable with it early in their process, when it comes time or when it's a concern, it's already a natural behavior for them, or it's a behavior they're comfortable with, so that we don't have to be forcing them into something that they're not comfortable with. So we are the camera right now. This is going up the leg, so we're highlighting our medial margin. Coming up the leg, we're highlighting our medial digit. Going down the leg, we're highlighting our lateral margin. Make sense? And what that looks like, this is fire hose material, so it's kind of dense. You can make it out of a few different things, but it's pretty soft on their skin, and so we just have it as a cushion, mostly because we're concerned about this anatomy up here, navicular bones, solar margin. So if I lose this little bit of toe, I have it on other projections. I'm not concerned about that. Again, we're using a complement of images in order to make our full thought process. And so if I lose this information, that's okay. I want to know what this is doing. And this is a nice clean image of our solar margin. And here are navicular bones. So we moved up the leg, highlighting our medial digit. And then moving down the leg, we can see our lateral digit. So both of these images look very similar. You'll notice there's a subtle difference in the magnification of these digits. But because we're offsetting the 2 different digits, we're gaining all that information of solar margins on the 2 digits without having as much summation of anatomy, which is super valuable. Again, I'm emphasizing these points because this is the big stuff that we are working hard with our giraffes in order to help their long-term management. And this isn't a farrier talk, but if you've talked with any of the farriers in the giraffe world, it's constant upkeep. It's a lot of work, and it's a lot of it's a lot of care and constant observations to try and keep up with their hoof growth. So the last 2 images that we've started to implement is this oblique, which kind of takes our dorsal, our DP oblique, that 45 degree, goes a little bit steeper, and then we go off to the side. And what we're looking at here is more of that solar margin of P3. I told you at the beginning, we're going to really emphasize P3. It's all it's most of the care for musculoskeletal and giraffes. So we really want to see this very palmar lateralized margin of P3. Here's our distal interphalangeal joint here. Here's our distal interphalangeal joint here. So to show you in a different way, we're going to come straight on. We're going to go off 45 degrees to the side, and then we're going to come up 60 degrees, an image. So you can see here our X-ray tube. We're no longer straight on. We're off 45 degrees, and we're coming up 60 degrees. And we really are looking to see what the lateral aspect of this P3 is doing. So if I take this three-dimensional model, this is the portion of the bone that I want to see. And if I bring back that skin, look at it relative to that hoof wall. And so I'm looking to see this portion of P3. And then as it comes back, there's my hoof wall. So again, another angle perspective of what P3 is doing. From the camera angle, we're coming up here, lateralize, again, focus on our sort of coronary region. And that's for our lateral claw. You can see our marker here. So for our lateral claw, again, here's our distal interphalangeal joint here. Here's our solar margin of P3. So I want to see this palmar aspect. For the medial claw, same thing, 45 degrees off to the side, come up 60. We're still putting our marker on that lateral claw, and we're aiming at that coronary. And what that will look like, this could be on the other side, but have it slip. We can see distal interphalangeal. Again, I want to see this palmar aspect here. So that is going to be a compilation of our 7 views so far, right? So we've really hit home our P3, different perspectives, different views. And all of it is to culminate into trying to observe different pathologic changes in P3. These are common pathologic changes that detract from the overall well-being of giraffe. And this is the stuff that we monitor for. This is the stuff that we are hoof trimming for constantly, are observing their hoof shape, their hoof growth in order to minimize, because a lot of this pathology has to do with the growth patterns of their hoof, whether it's the toe, whether it's the heel undergrowth. The farrier care, again, is something major for giraffe long-term care. And so between radiographs and observing their solar margins and their hoof contours and shape and grading schemes, this is the stuff that we're trying to monitor long-term in order to say, how are we doing? Are we improving? Are we static? Are we going in the wrong direction? So again, this is going to be kind of the checklist that we look at for monitoring distal extremity care of these individuals. And so I emphasized this point earlier, this palmar aspect of P3. And so this is the P3 bone. Here's the articular surface, the lateral aspect, medial aspect, looking from the top, looking from the bottom. This is the common site of pathology for these individuals. So if you were to walk out of this, or I guess close your computer out of this, this is what you should know about giraffe pathologies, is that this very palmar aspect, which goes right up through the distal interphalangeal joint, is where they're vulnerable. And it's because of vascular compromise and growth pattern of their hooves that crushes the lamina and papilla that devitalizes and compromises this bone. And so now you've got 2,000 kilograms of giraffe pushing down through these limbs on compromised bone. You can see the bony resorption from all that weight. And so when we are emphasizing taking care of these distal limbs, this is why. Some of these have subtle little fissures that run through. And I bring here because this is the big divot in the solar or the distal border. So this is all lost bone. Here's irregular borders of the solar margin. So some of this is lost margins. You can see kind of how irregular these borders are. And then some of these are more irregular breaks within the P3. So these are all classified as fractures. So these are P3 fractures, and some giraffe live with them. And some of the giraffe are managed long term with them. So this is a pretty common pathology that we find in our giraffe. And again, very common location for giraffe. Again, resorption of bone here. So these are two different giraffe that have very similar pathologies presenting in different sort of progressions, but very similar locations. And that all has to do with growth pattern of the hoof wall. So P3 osteitis is kind of the start of all of this. And what we start to see with P3 osteitis, and this is our straight medial collateral. I end at 20 after, right? Is you start to see heterogeneous bone here. And so if you recall some of those earlier images, we're used to seeing very straight margins, uniform looking bone, very discrete borders with more loosened but nice sort of consistent trabecular bone underneath. The start of this heterogeneous lucency is getting into the category of P3 osteitis. Again, it happens at a very consistent location. Think about this axis of weight straight down, and that's where you're landing with the osteitis. Cool. Now, all that emphasis of our weight-bearing DMPLO 10 degrees offset oblique, I just offset my medial P3. Look at the extent of this bony loss. That's, again, the extent of our P3. So if we go back here, hard to see the extent of our P3 osteitis and bone loss. Now you can see more of the extent of it. So we do our obliques to really gauge the extent of our osteitis. And you can also see how sclerotic this bone is. Sclerotic bone is not healthy bone. Now here's our non-weight bearing. You can see the extent here. And again, we're offset. So the more magnified digit, this is going to be our medial digit here. P3 is all lost bone here, defects within that solar margin. Same digit, just magnified. Here, just more sclerosis through it. Not so much loss of bone, but it's still an osteitis. So all this sclerosis, which is going to be increased mineral of that bone, is all going to be part of that pathologic process. So, disease on a spectrum. As we look at those additional views that we have, here's our standard DP view. Kind of tough to see what's happening out to the laterality. But if you look at this medial claw right here, let's look at the extent of this lucency and heterogeneous bone with sclerotic rim. And that's because we obliqued it out to look at this lateral or this more peripheral solar margin, which is sort of hidden right under here. So again, the complementary of views, we can see the heterogeneous solar margin here. We can see some sclerosis, but with that oblique, we can see that we're now getting resorption of our P3 and we're developing a defect. We talked about our progression over time, getting consistent studies. This is the same individual from 2018 to 2024. Same, pretty consistent angles, right? Look at our medial P3 here versus our medial P3 here. So there's progression of disease over that. That's all that osteitis that is monitoring over 6 years of time. Other things that we will see, I put up a normal here just to recall, but we'll start to see lucencies within our navicular bones as well. And those are going to be some pathologic changes to accompany some of these P3 changes. And recall that running along this flexor surface is going to be that deep digital flexor tendon, which attaches right onto this palmar aspect of P3. So accompany that the attachment of the P3, which is which has that osteitis, are going to be navicular cysts. Because we've got all this soft tissue that we don't necessarily appreciate, but we know there's inflammation of this whole podotrochlear apparatus. So looking for bone cysts helps support there's pathology happening. Negative palmar angles and sole overgrowth. So we're seeing a lot more tissue between the ground and these P3s. So if we look at here, look at the distance between that P3. And at this point, because of all this tissue distal to P3, that toe is starting to point upward, right? If we kind of go back a few slides, this is pathologic here, but there's a certain degree where this toe is kind of going from the toe is more distal than the heel. So we expect the toe to be a little bit more distal than the heel as far as closer to the ground. Now, when we have the toe pointing upward relative to the heel, that negative palmar angle is a big concern for additional overgrowth. So we call that sole overgrowth when the amount of tissue distal to that toe starts to cause the toe to point upward. And we can also see this overgrowth crossing over the other toe. So all this is excess toe. It's not just long, but it also creates this additional tissue that's deep distal to the toe. That's a similar image there. I'm about to finish up here, but this is the culmination of the material, is this location. And so that osteitis can progress to a point where we start to see fractures within the P3, that palmar aspect of it. And so that it happens medial, it happens lateral, it can happen in one digit, it can happen in both digits. And so this is an individual where we have both the medial and the lateral digit have fractures. And it happens in a pretty consistent location where we have lucent defects, sclerotic bone, heterogeneous bone adjacent to it. And so the big sort of walkaway point is that as these pathologies are progressing, this is the area of pathology we should be screening for with the giraffes. And we're building protocols to monitor, watch, and try to intervene earlier so that we can take care of these distal extremities in order to avoid getting to this stage. And so this is the progression of not having appropriate distal hoof care. We can see fractures from different projections, but ultimately this lateral view and this DMPLO view give us the best view to see that this fracture within the palmar aspect of our P3s. And the oblique views allow us to be able to offset the P3s in order to say whether it's medial or lateral. With osteoarthritis, it's a part of this whole process with the degeneration when we see osteophytes on the borders, and that's going to be similar to any of the species. If you're looking at dog cat, they're typically periarticular bony proliferations, and they can progress to be pretty severe. Ultimately, if you do weight-bearing images, you might see collapse of these joint spaces. With that, that does conclude my chat. I think I'm 2 minutes over, but I'm happy to answer any questions. I kind of showed you my 7 views that I love for giraffe extremities. We use them as a goal for training so that we are ahead of any pathology. So we are monitoring over time, trying to intervene before anything happens. And that way we're catching pathologies very early on and can intervene before we get to the stages where there's those P3, hopefully osteitis, but before they get to those P3 fractures. And now that you've got a checklist of the common pathologies of giraffe here, you guys have a quick run through as far as being able to show up to an externship and wow anybody who's got giraffe protocol going or giraffe procedures going.
Thank you, Dr. Hostnik. We now have a few questions.
Sure.
Hello. I know you mentioned that these are common pathologies that you see in giraffes. Do you think that these are common to giraffes in captivity, or is there a difference that you'd see in the pathologies for like wild giraffes?
They are common in managed populations. Dr. Dodone did a study where she went to the Nubians over in Uganda and took radiographs and did not find the same pathologies in the population of Ugandan giraffes. So they have more traumatic pathologies there. So these are more of a managed series of pathologies.
And then just quick follow-up. What are the treatment options that you take if you like start seeing these pathologies, if you can catch them early? Like what like steps are you taking to help prevent them from developing further?
So I typically leave that up to the more vetty vets, but we have much closer monitoring of hoof care, and so that might be more routine, shorter intervals of hoof trims, hoof care, changing the bedding, changing the activity, because it is really hoping to change the wear patterns. And so with heel under overgrowth, um, trying to avoid any pressures that might impact that laminar papillar growth of that palmar aspect of the heel. So it's going to be shorter intervals of monitoring heel undergrowth, our overall hoof care. As it progresses, there's some attempts to do stem cells, some attempts to do bisphosphonates to try and do some calcium depositions. So there's been some more progressive attempts to try and to reclaim some of the osteopenia that we see, but a lot of it is management to hoof care.
Thank you.
Yep.
I do have a question. How often do you recommend doing the routine imaging?
Young ones, we try to do once a year with the young ones, or once every other year, depending on how well they are. There's there is a sort of a giraffe hoof care workshop that has gotten to be pretty renowned, and so um, a lot of keepers go to it, and so a lot of the Columbus keepers have taken it, and they are so in tune with hooves that the fact that the fact that they are watching so closely with the younger ones, we extend it out a little bit further. If we know that there's one that we've identified, maybe a little osteitis, we'll shorten that interval between radiographs. But um, we'll try with the young ones maybe every 2 years. And then as they get older, maybe once a year, try and get a protocol in. And if we know that there's a pathology or we're modifying hoof of care, we might try and do that interval every 6 months or so to see if we are curtailing any changes.
Cool, thank you. And then we do have one more question in the chat as well. Gabby is asking, do you see more hind limb versus forelimb or even medial lateral digit pathology like in cows due to weight distribution?
We just have more access to forelimbs, and so we see more forelimb. And I think that is supported by um, literature and postmortems and necropsies as far as monitoring their weight distribution is a little bit more forward. We see the pathologies both medial and lateral. I would say clinically, we probably catch it more medially, but it certainly does affect medial and lateral claws. So if I were to say my standard, if I was to prioritize what radiograph I need of a concern and I only had one to choose, it would be the weight-bearing DM pillow because I'm concerned about the the four-limb medial claw.
Hi, my name is Raghav. I had kind of a couple of questions. One, and I also have very limited experience with, for example, bovids in hoof trimming, and I know in at least cattle, sometimes the use of like blocks will be applied for various pathologies. Is that so much the case with giraffes, or I wouldn't imagine so because of just there's a lot more weight there, but I don't know.
Um, we haven't put on blocks, and some of it is because it's a different type of pathology that's happening. So with bovids, some of it is subsolar abscesses that you oftentimes need to pack and treat with topicals, and so you're wrapping with embedded topical antibiotics. So you oftentimes need to offset so that you can wrap and have something actually sitting there. With this, it's truly like growth of tissue that is coming up and under. Um, so it's not necessarily that you have infection along the solar margin. So it's really taking care of the overgrown tissues that help best. So we're not typically blocking or putting blocks on any of the distal extremities. I also think they probably would be concerned about putting a block on a digit for one of them.
That makes sense. And
Yeah.
then the other question that I had was, especially once you have a giraffe with an overgrown hoof, and you trim and you take a radiograph, you see that the bone itself has kind of started turning upwards a little bit. I would imagine over time, especially with frequent or regular hoof trimmings, that it would eventually return to normal. But like, roughly, do you know what kind of time frame that would be, and or whether that kind of healing would occur at all?
Depends on the progression, right? Those fractures, kind of like equine fractures, they don't heal across with bone. When we see those fractures, what we typically will see is if they stabilize, it's a fibrous union. So that those fractures radiographically can be present and the animal may be comfortable in their feet. So those are oftentimes fibrous unions. Like you have a horse that you've been managing for a fracture, kicked a wall, you see a fracture, they've been in a boot for a year, they get out, they're clinically normal, you still see a fracture. you'll probably see a fracture the rest of the life, but it really depends clinically what they're doing. So those are fibrous. If you get them early with either the osteitis or the overgrown sole negative palmar angle, you can get them back into a comfortable, almost normal looking over months of work. That's not a quick turnaround. So I would maybe anticipate, because we would check them probably 6 months down the road, that one wouldn't be normal, but maybe a year after would be closer to normal. So it's not a quick turnaround by any means. It's going to be it's a long progress.
Gotcha. That makes a ton of sense. Thank you so much.
Yep, of course.
Any other questions? No? All right. Thank you so much, Dr. Hostnik.
Yep, of course. Have a great one.
Alrighty. So now, last but certainly not least, we have Dr. Eng for our resume workshop.
You're right. That work? Guys doing okay? In vet school, they always would schedule the pathology and the radiology lectures right after lunch. So they'd shut the lights after you got glucose slumber. It's the worst thing in the world. All right, guys. So thank you all for being here. I appreciate you coming out in all this smoky weather and spending some time with us. Before I get too far, I do want to recognize the extraordinary work of our ZEW leadership. So please give them applause. They did a good job. Thank you guys for running this. Yes, you guys do not understand the pain that we're going through getting this thing lifted. So they deserve a lot for this. All right, so today I am going to talk to you a little about resumes and about doing just continuing your careers essentially. And so one of the things I did was when I was putting this together, I saw this picture and it sort of reminded me of where I can be sometimes. As I reach certain pinnacles in my career, I all of a sudden say, oh, I'm now a zoo vet. Now what do I do? And I'm looking at like this barren plain and it's like, you know, what are my opportunities at this point? I've achieved what I wanted to achieve. What do I do now? And I'm sort of stuck there sometimes mentally, but you got to get past that, right? And when I think about what you guys are doing, I mean, you guys at this point are, it's not working. There you go. You guys are at this point, you got this lush forest in front of you. You got so many opportunities in front of you. And I just want to encourage you to always think about that right now you are in the best place in the world because you just essentially have the world in front of you. For those of you who've not been to my office, I have this picture. It's a photo It's a picture by a guy named Shim Shimmel, and he does this type photo. But what I really like about it, it just reminds me, though, you guys are like those gorillas. You're looking down at the world, and you got every opportunity in the world to move forward. You guys, I think most of you know my story. I've done a lot of different things, lab, animal, zoo, private practice, so forth. There are just so many pathways for you guys to move forward. So I just don't want you guys to ever feel stuck. You guys have a lot of opportunities. And so today's presentation, I'm hopefully going to help open some of those doors to some of those opportunities for you. All right. So how many of you guys know what you're going to do when you graduate? How many of you absolutely sure this is what I'm going to do once I graduate? Is anyone like that? I got one, I got two. Kind of, sort of. Yeah, you're going to work for your mom. I know that. You don't count. Yeah. I had a vet school classmate, honest to God, Kevin Shengrun. This guy was like total type A personality. When I met him and all through vet school, I swear to God, first day, he knew that he was going to small animal practice. He knew that he was going to buy out his dad. He literally was going to buy out his dad's practice in Hershey, Pennsylvania. He knew he was going to create this hospital that was approximately 7,500 square feet. And he almost knew like his return on investment for everything. I mean, he was that anal. He was just like boom, 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 boom. And there are people like that. And and yes, he achieved his goal. He did exactly what he said he was going to do. He has one of the largest practices in Hershey, Pennsylvania. And so, great, that's perfect for him. And that's a wonderful thing to be able to do that. But as I can see here, most of us are not exactly sure what's going to happen when we graduate, and that's perfectly fine too. And so one of the things that, we as teachers want to do is we want to make your lives better than what we had, sort of like your parents. We always want you guys to improve and do more. And so I'll apologize to you, year two students. You heard me talk about this last time, but I'll give you a little more insight as to how I got forward in my career. I was a very lazy student. I was a very passive student. I sort of let life pass me by, and I just took advantages of opportunities as they came by. I did not seek out opportunities like I'm telling you guys to do, okay? So when I think it was like in March of my graduating year, I was like, my best friend, Lisa Preston, she came up to me and said, so what are you going to do when you graduate? And then it sort of dawned on me, oh, shoot, I got to get a job. I didn't think about that. I'm graduating in 2 months. I better get a job. And so she fortunately interviewed at a practice about an hour away from our college. And she said, I didn't like the job, but I think you should apply, Curtis, because it's going to be the best job for you. You do exotics. The guy loves birds. He loves reptiles, blah, blah, blah. And so sure enough, I applied, got the job, and then my career went forward. But I'm just telling you that story because I don't want you to be lazy and hope that your best friend tells you about a potential job opportunity. You guys need to get out there. You guys need to decide what you want to do and what is going to be best for you in your career. I think right now, most of you guys are mostly worried about graduating. That's your biggest concern right now. But in addition to that, as you think about what you want to do, I think you guys sort of need to start positioning yourself for your future. And so when you look at all the possibilities of what's going to happen when you graduate, you definitely are going to need to apply for things, whether it's a residency, internship, a new job, whatever it might be, you're going to need to be applying for those things. And so I want to talk to you a little about those, the ability and what you need to do to successfully get those jobs. When I look at when you graduate, I think in my experience, there are probably only real 6 things that you're going to do. First thing is, and the popular one, a position as an associate vet in a private practice. That's what I think, Dr. Niamh, I think approximately 60 or 70% of our class, every class does that. They go into private practice as an associate vet. And that could be large, small, whatever it might be. I think some of you might even consider opening up your own practice. Yes, you think that's sort of crazy talk, but I did actually have a classmate in my class that opened up her own veterinary practice as soon as she got out of vet school. And yes, I was shocked. I was dumbfounded. She was not the most, shall we say, Um, uh, she wasn't at the top of the class, let me put it that way. And but she successfully made it, and her career did very well. She actually just recently retired, so you could do that. Some of you might do internships. Some of you might go into a residency, and I'm going to talk about that just a little bit more. And I think about 30% of our class goes into that, 30 to 40%. Some of you might actually go and get another degree. You might be really happy with what's going on, but you might say, oh, I want to get an MPH because I want to expand my horizons, or I had one classmate that actually got an MD after they did the DVM program because they realized that they didn't really like animals enough and they wanted to go into a human field to expand their career. Yes, believe it or not. But you know what's interesting, and I think you guys will agree with this. Animals know if you're an animal person or not. They sort of like you or whatever. Interestingly enough, animals did not like this gentleman, my classmate. You could just tell when he would walk into the room in the clinics, you could see the dogs just sort of like bark at him, or their ears are going back. He just didn't have the right presence for veterinary medicine. All right, so yes, you might get another degree, and then there is going to be a very small percentage of you that will stay at home, sponge off your parents a little more, and just play video games all day. And so I don't think that's the best strategy, but nevertheless, it could occur. One of the things I do want to talk about, or just mention real quickly, is internships and residencies. I bring that up because I know that some students are not quite sure what they are and why we use them, what we do with them. And they get them confused with externships, okay? So I just want to clarify and make sure that everyone's on that same page. The externships are things that you do as a fourth-year student. So come fourth year, you're going to have these core rotations, and then you're going to have the opportunity to go out, and I'm going to go to Purdue University, I'm going to do a ClinPath rotation. And so while the school itself calls them selectives, most other colleges call them externships or preceptorships or something like that. But generally, externships are during your fourth year. The internships are things that occur after you graduate. And so most internships are either 1 or 2 years. And what they essentially are is just an opportunity for you to experience a more intense, a very structured program where you're learning how to do whatever that internship is about. So most of you will do what we call a small animal rotating internship. You'll spend a month in cardiology, a month in emergency, a month in internal medicine, and so forth and so on. And it rotates through all the specialties so that you feel more comfortable with each of those areas. Occasionally, some of you might actually start residencies. You can go into straight into residency if you're going into pathology, if you're going into lab animal medicine. You don't necessarily need to do an internship beforehand. So that's something that you might also do. And I'm going to talk a little more about that just at the end, but I just want to make sure you guys understood what those two opportunities are. Understand that when you graduate, you guys, assuming you all pass NAVLE, which I know you will, you guys can open up your own practice. You can practice immediately. I want you to understand that because some students don't think that and they think, oh my God, I got additional training and all that. You do not need to do that, okay? If you want to do that to gain experience, things like that, more power to you, but you don't need to do that. When I graduated, I started in private practice as an associate. I was seeing my own clients within like 3 or 4 weeks or something like that. Yes, I was scared. You know what? It was pretty scary. And I'm going to tell you, probably I learned more the first 6 months of private practice than I did my entire senior year. But nevertheless, you can do it and you can survive, okay? So I want to make sure you understand that you have that ability to do that. And believe it or not, you guys do have the knowledge and you will do well during your after you graduate. All right, so let's talk about obtaining the next goal. So whether you're going to go into getting any job, whether you're going to do the internship residency route, whatever it's going to pertain to, you're going to need to apply for these positions. And so similar to what we talked about with you guys getting into vet school, you're going to need a cover letter, you're going to need some letters of recommendation. I do encourage you to start networking. This is the time to do that, getting strong recommendations and networking with the people, the professionals that are in your expected field is going to be very important. Obviously, you're going to do some interviews, and then we'll finish off with resumes, since that's what you guys are primarily here to talk about. Obviously, you guys know a lot about this because you got into vet school, so you must be doing something right. But I'm just going to reiterate a couple of points that I've seen over the years, having hired numerous people, having looked at a lot of applications, student applications for veterinary school here. I just want to cover some of the things that are super important in my mind. So when we talk about cover letters, I think it's really important to just be persuasive. You guys can write a generic cover letter. Oh, I want to be a veterinarian because of this, or I want to go to your practice because of this. And you can do that, and that's all well and good. But just remember that a cover letter helps distinguish you from all those other applicants. So more than likely, most of the practices, and for sure the internships, you're going to have at least 10, 20 people applying for those positions in addition to you. You need to separate yourself out from them. So think about that cover letter and think about how best to tell the story. That's essentially what you're going to do, is tell a story to say, this is why I'm the best person for this position. And you need to do that without sounding cocky, okay? And it's a fine line to walk, okay? It's tough to do that, but you guys can do that. Obviously, it needs to be well written. Short and concise is good. Usually cover letters are about a page, page and a half at the most, depending on really how much information you had. But don't do the, I see this quite a bit, is people that will say, oh, I want to be a veterinarian. I want to go into vet school because I love this, this, and this is my experience. And then the second and third paragraph reiterate the first paragraph. I don't need that, okay? So try not to be redundant. I think it's important in your cover letter to really emphasize what you bring to that particular place. Sell yourself, okay? So if you're going for an internship, think about, what does the internship want? You're going there to learn from them, but what do you think they want from you? They want a hard, they want someone that's going to go out there that can see a lot of clients, that's comfortable in front of the clients, not afraid to take a heavy caseload, someone who's not going to cause problems. Is, you know, there's some people that are very particular, if you know what I mean, and they're not going to work with this client and I'll work with that one and things like that. Those are the type of people that they do not want to hire. So they want someone that's going to be easy to work with and things. So emphasize that in your cover letter. Say, look, you know, I've worked in a variety of environments. I'm very comfortable with people. I'm not afraid to have a heavy caseload. Those are the things that you really want to emphasize in the cover letter. Again, you're going to sell yourself. So sell yourself. Punctuation, grammar, spelling, okay? Yes, I still see a lot of punctuation, grammar, and spelling in the letters from the students that are applying to vet school. I don't see it as much in the job letters that I see, but nevertheless, just always double check it, you know. In this day and age where you have the spelling check and all that, there's no excuse for that sort of stuff. Yeah. I purposely misspelled all those words just for the fun of it. Yes. Yeah, if you didn't pick up on that, then we got some problems here. Yes. Which reminds me, this is a very casual conversation. So yeah, if you have any questions during this whole thing, just raise your hand. I like to just keep it as interactive as possible. You didn't catch punctuation was also a misspell? All right. Let's see. As I said, you're going to tell this story about yourself and why you're the greatest person, why they need to hire you. That I think is going to be very helpful. And I have to admit, reading the narratives that the applicants for vet school have to write about, why do you want to be a vet type thing? I have to admit, they are improving over the time that I started about almost 9 years ago to now. I think they're getting a little more creative. They're getting a little more expressive. They do tell a story. They start with these cool stories about how, oh my God, have to euthanizing this dog is my life and why I need to be a vet, blah, blah, blah. It's nice that they're getting a little better versus just the generic, oh, I want to be a vet because I love animals, Okay, letters of recommendation. I'm going to encourage you guys to start thinking about this and start working on this, because this is when you want to have a good bank of people that can write good letters of recommendation for you. Okay, so you guys, some of you are first years, many of you are second years. So you need to start making impression with people, okay? All the interactions that you have with the various faculty members, it's important. Whether it's just your PBL facilitator, create that relationship. If you feel that this is you can connect to, create that relationship so that that person can write a letter of recommendation for you. And that's going to be a lot better than you just generically asking me to come up. You know, yeah, I've lectured to you once or twice. You feel I can write you a letter, which I can, but I will be honest with you, it probably will be more Form A letter. Oh, yes, I know Michaela. She's a nice student. She showed up at my lecture. She was participatory, and that's all I'm going to say. Versus if you have your facilitator writing a letter, there I can say, I've worked with Michaela for 3 days a week, 2 hours each of those days for 8 weeks. I know her very well, and I feel comfortable writing a strong letter, something, so and so forth and so on. So you want to really think about who you want to have to write that letter, and you need to start creating those relationships now. As I said, you know, I don't want to write. I don't write Form A letters. I'll be very honest with you. I get a lot of requests to write letters of recommendation. I frequently will tell the students, if I know you well, more than happy to do it. If I don't know you that well, I'll be honest and I'm going to say, look, I'll be glad to write you a letter of recommendation. It's not going to be the best. It'll be more Form A letter. I would encourage you to find someone that knows you better that can write a stronger letter for you. If you do not have anyone else to write a strong letter for you, then yes, my Form A letter will be better than nothing. But I'm going to tell you that I would rather you find someone else that can write a stronger letter for you. So I think that's really important.
This is working.
Okay.
Okay. If you have, like, let's say you're applying to a clinic that does primarily exotics, and you're trying to find a professor to write a letter of recommendation. Let's say this professor that was your facilitator knows you very well, but is not very experienced with exotics versus a professor like yourself who doesn't know the student very well, who is much more knowledgeable in exotics and would look better as far as the name goes on a letter of recommendation. What do you?
So at the end of the day, when you look at letters of recommendation, it absolutely is nice to get letters from people who are very, well known in the profession. But I will tell you that I think it's more important for you to have a letter of recommendation from, Joe Professor, who I don't know, that is strong, versus having it from Dr. Murray Fowler, and he gives me a Form A one. I'd rather have it. You can easily read within the letter. Does this person really know you? At the end of the day, and I hate to say this, but you guys probably know I'm pretty blunt about things. At the end of the day, pretty much all the faculty will be willing to write you a letter of recommendation because we're representing the college. I'm always going to try to get you into any opportunity I can do that because I want to enhance the college's reputation. I want my students to succeed. The question is, how much can I do that in the letter and staying truthful to myself? So if I only know you because you've been in 2 or 3 of my lectures and that's it, and you didn't say a word and you didn't do anything, yeah, that's pretty much all I'm going to be able to say in my letter. Okay, so absolutely from someone who is well known in the profession, all the better. But again, I would just go to someone who knows you best is really the important thing. And I would say try to, as best as possible, get them from varied sources. And this is where getting one from your professor is very nice. Getting one from maybe your employer is also good. Preceptors, supervisors, whatever it might be. Try to make them as varied as possible. Because if you have 3 letters of recommendation from only professors, I can make the assumption that, oh, this student's really good in school, doing really well, blah, blah, blah. But I have no knowledge of this person personally. What are they like outside of school? I have one from a supervisor, a work supervisor. Maybe I have one from a family friend that's a character reference, and then I have this one from the professor. Now I'm getting a better picture of what this person is like, and I can say, oh, well, this guy seems to be really supported by everyone. He probably is a stronger candidate as opposed to just getting it from one source. Okay. And again, pick those people that you know are going to write a strong letter. So the other thing I would advise to you is this: is when you ask your friends, will you write me a letter of recommendation? Just go, would you write me a strong letter of recommendation? And that lets them know that you want more than a Form A letter. And hopefully that person will be honest and say, look, yes, I can do that, or no, I don't know you well enough. Okay. And there's nothing wrong with that. It's not an insult to anyone to do that. I'd rather be more open and honest with you as opposed to, and actually I can tell you this, and the thinking about it, I actually had that when I was applying to vet school. It's one of those things that at the time we didn't get to see our letters of recommendation. And so I had asked this clinician that I was working with to write me a letter. She said, yes, writes me a letter. I get into vet school. And I want to say it was like a year, 2 years after I got in. For whatever reason, I got my file. And so I got to read the letter. And this gal, she wrote me an okay letter. It was a Form A letter. But she was very honest. She goes, oh, here are his problems. And there was like a list of problems that I had apparently that I didn't know about. And I was like, whoa, okay, I'm just lucky I got into vet school anyhow. But it's fine. I mean, at the end of the day, the letter of recommendation should be honest. And, you know, if you have a glaring weakness, I probably am going to mention it, but I'm going to sugarcoat it and make it as positive as possible. Nevertheless, you know, it's one of the things that you just sort of want to make sure you're getting a strong letter versus just a letter. Networking. And so how do you get these letters of recommendation? It's networking. It's just getting your name out there, meeting people, making your face known to these people so that they're willing to do that. And so just remember that every opportunity that you meet someone at this point in your career is an opportunity for you to network. It is an opportunity for you to make a positive impression. On the contrary, it's also a possibility for you to make a negative impression. So be careful with that. So, and when I say that, you know, let's pretend that, you know, Dr. Edell comes in, she talks to your class, and everything, you know, seems to be well. Let's say, I'm going to pick on Candace right now. She decides to come up and say, man, that was the worst presentation I've ever heard. Why are you saying blah, 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 you know, or whatever she wants to say. And she makes a negative impression. Even though she may not seek Dr. Edell's letter of recommendation, she might ask someone who happens to know her, Dr. Edell, and Dr. Edell might let that person know, oh my God, that girl, no, she was awful, blah, blah, blah. And so you'd be surprised in certain communities, especially the zoo community, the exotic companion, wildlife communities. These are relatively small communities. Everybody knows everybody, okay? And so, and people are not afraid to seek answers from them. So if I get a, you know, question about writing a certain letter and I know for a fact that my friend worked with this person, I'll ask my friend, what was your experience with this person? Just to sort of get a rounded opinion of what's going on. And so networking is super important. And I actually even have a whole slide on networking because I really think it's important to make sure you develop these contacts. So get your name out there. I think it's really cool for you to do that. As much as I hate to say it, and we don't like to admit it, but opportunity is a lot about being at the right place at the right time. Many of you guys have heard me numerous times tell you that there are a lot of zoo veterinarians out there that are not boarded. They may or may not have done an internship, but they're zoo vets because they were at the right place at the right time. They just were already there, and the zoo said, oh, I don't feel like going through the whole hiring process. You know, I love Candace, and we're just going to hire you because you're doing a great job. And so, boom, now you're a zoo vet. You know, you were volunteering there, but now boom, you're a zoo vet. And that happens many, many times, okay? So if you guys, and I know that we don't have that many zoo vets in here, but if you're an exotic companion vet that, you're seeking a job there, maybe you only were able to get a job in a small animal practice, you didn't get into exotic companion, volunteer at an exotic companion place and just say, hey, I want to shadow and I want to learn. You start doing that for a couple months, so forth, and that potentially could lead to a job, okay? Because you're networking, you're making your face known out there. Making connections is really important. It is hard to do that, especially if you're sort of an introverted person. And I'll be honest, I've always been very introverted. When I was your ages, I was probably pathologically shy. I was just like, oh my God, I don't want to talk to people like that. It was just so weird, trying to make those connections. But, I would go to conferences and I would just sort of sit by myself, but I would absorb everything and just figure out who are the players in this group and everything like that. And those are the people that you need to just sort of get to know. So like Dr. Guy referred to Murray Fowler. Murray Fowler is the guru of zoo medicine. And so, one day I found the nerve to go up and talk to him and just introduce myself. And Murray Fowler, God bless his soul, was the nicest guy. I mean, honestly, guru of medicine, but he was the most humble guy. It didn't matter who you were, but he would treat you like you were his son or his daughter. Oh, Curtis, how are you? And blah, 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 blah. And he had a memory like an elephant because every year he would remember who I was and stuff like that. But it was people like him. And so he was someone that I could refer to and say, ask him questions about future career opportunities. Or it was always nice to be seen with him so that then this veterinarian over here, who I might be applying to, oh, Curtis knows Murray. Oh, that says a lot, And it's those little things. It sounds really stupid, guys. And I know it's probably at the end, at the end of the day, you don't want to get a job just because you were standing next to Murray Fowler. But on the flip side, all it is opening the door for you. And that's what I'm talking about. We're just opening the door. At the end of the day, you're going to prove whether you deserve the job or not. So go to conferences if you're interested. I know we have 2 that are interested in Zoo Med. Join the AAZV, the Zoo Vet Association. As students, membership is a lot cheaper. You can go to the conferences, and yeah, a lot of it's going to be way above your head, but nevertheless, you're getting your face out there. You start joining the student clubs within that organization, and that's how you start making the ropes. Same with the exotic companion. I know many of you are interested in exotic companion, so join ARAV, which is the Reptile Vet Association. Join the AAV, which is the Avian Association, or even the AEMV, which is the Exotic Mammal Association of Vets. Again, all of those have discounted membership for students. All of them have, I think, some sort of student club, student thing where you can join that group and become familiar with how the organization works. So please, I highly encourage you to do that. Networking is also is your externship too. So you guys haven't done this yet, but when you guys go out in your 3rd year and 4th year, you are going to be meeting a lot of people. Again, those are the people that you really want to make a good impression on, okay? So as an example, if you do an externship, a 2-week externship as part of my course with Dr. Edell, she loves you. You can ask her to write a letter of recommendation so that when you're looking for a 4th year Zoo 1, and it's going to speak volumes when she can say, oh yeah, this guy spent 2 weeks with me, loved him, he was very active, blah, blah, blah. And that way the next person will then take you, and that'll help you with your 4th year externships, and you'll get ones that way. And then when you get, then again, you make that same good impression, and now that person can write a good letter of recommendation for your internship or residency or whatever further on. So again, it is a lot about networking. I have to be very honest. My parents tried to get me to network when I was younger, but like I said, I was on the shy side and I didn't like the idea of, sort of pimping myself out that way. It just felt sort of weird. And looking back though, I think I really wish I had done a little more. And then don't be afraid to use us as faculty for networking. So that's what I'm here for, and that's what I've been doing for a lot of my students. I think most of you know Forrest, and Forrest is super happy. He's on cloud 9 right now because he just got an externship at Chicago at the Lincoln Park Zoo. and that was his dream place. And so it was because I know Dr. Gamble really well, the vet over there, and so I was able to bargain for an activity for him and things like that. But those are the things that we want to do for you. The faculty is here for you to help network for you. So don't be afraid to utilize our connections, okay? As you can tell at today's meeting, like I know Dr. Guy, I didn't set that up, but Dr. Edell, obviously, she was one of my star students. Dr. Quinn, again, I know her through a different connection, but it's a small community, guys. We all know each other and we're all willing to help you guys out. I put down social media on here because I think that's a big one that I don't know a whole lot about, but I do think in the future, as you guys progress, I think it's going to be really important for you guys. Just remember, social media is a good and a bad thing. So it can really hurt you if you go around putting on pictures of you at your drunken 21st birthday party, things like that, but doesn't show real well. But I think if you're the type of person that does post on regularly on any of the social medias and you're posting, and I'll pick on zoo stuff right now, but if you're posting really cool conservation stories or things like that, when these people look at your application and say, oh yeah, wow, he's really interested in conservation. It's cool seeing his posts, or it's cool seeing stuff like that. Again, I think that strengthens your case. And so I think you can use it to your benefit, but just be really careful with it and make sure that you don't get caught doing anything you don't want your parents to know about. Yeah.
On apparently. Okay, there we go. For social media, when it comes to posting things that you've done versus posting things you're interested in that you don't have like direct experience with. So let's say there's a conservation project happening in Kenya that you're really, really interested in and you want to know a lot about, but you're not directly involved in that. Still fine to.
Yeah, it's cool. It's like the previous speaker referred to a study by Dr. Dedone. She was over in Africa doing some giraffe stuff. And yeah, it'd be great if you just put, you see that link and you say, wow, there's really cool stuff. Would love to help with it. Just something like that. I mean, those are very benign posts, but it shows support of conservation efforts. You gotta keep speaking into it and eventually. Oh, really?
Maybe this is just a me problem, but how do you go about networking with somebody without feeling like maybe they're so far up here that what do you even have to like say to them? You know what I mean? Like besides, hi, this is me and I know you and you're awesome. And then then what,
Yeah, no, I know exactly what you're saying. That's how I felt when I met Dr. Fowler. It's like, oh my God, everyone knows Dr. Fowler, but it's like me, that time I was like, I think I had graduated. I was out like 2 years. I wasn't even in the zoo field. I was volunteering at Lincoln Park. It's just as simple as say hello. I'm Curtis Singh. I'm just entered the zoo field. I'm looking for getting advice on blah blah blah, or just what's your take on this, or maybe there's a lecture that occurred to you and say, hey, that was an interesting lecture. I'm just curious as to what you thought about, enucleations in gorillas. Whatever the talk was, just make up some sort of small talk. And it's just a question of, it's just a thing of making that connection, that initial connection. I don't know. It's hard to say. You are going to have people that will shut you down. Yes. But by and large, the majority of us veterinarians at conferences, things like that, we've all been there. We all know what it's about. So when the students come up and talk to us, it's fun to hear what students are doing. It's fun to hear what they're interested in. And particularly for me, it's fun to, I think it sort of like reinvigorates myself to hear your enthusiasm, your desire to get into the field and everything. It reminds me of where I was one time, because sometimes we're in this field too long and we sort of get burnt out and we sort of lose our focus. And so it's nice having students to regain that focus. So I would say 90% of the time you go up to a relative stranger or someone in the field, they're going to be fine. They're going to welcome you. Maybe they're going to have a good long conversation. Maybe it might be just a short, it was great to meet you. And that's all well and good. At least you got your face out there. If if you were to go ahead and, like with the Murray Fowler, if you meet the guy, then, and then maybe it's just a 2-minute conversation, but at least when you apply for something, then you can say, hi, Dr. Fowler, you met me at the ZEW conference and I'm interested in a externship with you or something like that. But to say you at least met the person, granted, he may or may not remember you, who knows? But that doesn't matter. At least you can say there was a connection. And again, it gives you something to enter that conversation with, okay? So I'm not saying it's easy. Like I said, I was super shy. It was hard for me to do that, but it's just what's needed to get done so that you can get your face out there and people can start recognizing who you are. Any questions about the?
Dr. Eng, this is
Yeah.
Lauren.
Hi, Lauren.
Speaking from Sunray. I just wanted to plug the AAZV Student Programs and Services Committee. I am the national student representative for it. And we send out a monthly newsletter, which has all sorts of externship opportunities and fun things like that. So I know that you had mentioned AAZV, but if anyone is interested in signing up for that and seeing some different things that we have going on, including networking workshops that we're going to have in the next year, I will make sure that that sign up link gets sent out through the Zoo Club for y'all.
Awesome. Thanks, Lauren. And thank you for speaking up. And so what Lauren has done is exactly stuff that you can do. And those are the steps that I would encourage you to do. She went to the zoo vet meeting, and granted, yes, she has a background in zoo med or in the zoo field. So maybe it was a little easier for her than some of us, but nevertheless, now has this hoity-toity position in one of the student clubs, which is really cool, because now she's going to be starting to attend committee meetings, and then when you're in a committee meeting, then all these vets will start recognizing, oh, this person's a student rep. Oh, that's Lauren. Oh, okay. And then when it comes time to an application, they're going to remember her name. And say, Lauren, what did I? Oh, yeah, she's that student rep that did blah blah blah. That's the networking that is really so important. So kudos to you, Lauren.
Thanks, Dr. Eng.
All right, let's go talk just real quickly about interviews. Again, you guys have interviewed, you got into vet school, you guys know how to do this. I'm just going to emphasize a couple things that, I see when I interview students and stuff is just be prepared, be comfortable. And granted, you don't know what the interview questions are, but at least be prepared for the typical ones. What are your strengths? What are your weaknesses? Why do you want this job? Why are you the best candidate for this job over anyone else? At least have those answers in your mind and think about those so that you're not like caught flat-footed, okay? Yes, they're going to ask you other type questions, and if you can look on the internet and they happen to be posted, like I heard all of our interview questions are, all the better, and you can be even more prepared. But nevertheless, just try to be as prepared as you can. But at the end of the day, I think it's really important to just come across as someone who is genuine. And so my last comment in here is just be you. That's essentially what the whole interview thing is. My interview is just an opportunity to get me to know you. Do I think that you're going to be a good fit into our practice or into our internship or whatever it might be? One of the things that's probably the hardest thing to admit and is the hardest thing for, and I think most people who hire will agree with me, but when I'm hiring someone, whether it's as an associate zoo vet or whether, whatever that position might be, or an internship, whatever, when I look at the application, your skills and all the clinical knowledge that you have and how smart you are, what your GPA is, all that, for me personally, that's like 50% of what I look at. The other 50% is who you are, okay? Because at the end of the day, if I hire you as my associate vet, I know for a fact that I can teach you good medicine. Let's say that you are inexperienced, you don't have that much experience, you're not, you weren't ranked at the top of your class, whatever it is. I can teach you good medicine, but what I can't teach you is to be a good person. And I'm going to hire someone who is a good person. I'm going to hire someone who I think is going to fit into my team and is going to work well with my team. So the interview is your opportunity to show who you are. Now, if you happen to be a jerk, I wouldn't show that part. but you know what I'm saying is just put your best face forward so that they understand who you are and whether or not you're going to work with that team wherever you're applying for. Okay. And part of that has to do a lot with, practice good communication skills, being comfortable with, telling a good story. They're gonna, a lot of times when they ask you a question, try not to give them one-word answers. Don't say, do you have any experience with birds? Don't just say yes. You laugh, but it happens because you get nervous. You don't want to say too much, but it happens. And so, yeah, you should say, oh, yes, I've worked with numerous birds. I've gotten experience with, raptors and also cetaceans and blah, 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 and whatever you want to do. But don't digress. Don't go into this weird story about how there was a great horned owl at your mom's house and it wouldn't leave or whatever that story might be. You'd be surprised at how people digress. Again, that's a nervous tick is all of a sudden you start telling some weird story that has almost nothing to do with the question. Try not to do that, okay? You'd be surprised. People do that because no one loves that awkward silence, right? So we always fill it up with weird things. You guys know this, eye contact is really good. Make sure you give the interviewer as much good eye contact as possible. Nonverbal communication skills, you also know accounts for like 60% of what people absorb from you. So make sure that you're comfortable with that. Make sure you don't have that nervous twitch and you're hitting the table, whatever it might be. Try to practice that. And again, if you are the type that does get nervous, then practice it with your friends. Just say, hey, can you mock interview me? So you can sort of get used to it. And doing it with your friends is a little easier. And then you can ask people who are not quite your close friends and have them do it and just get more and more comfortable with strangers asking you weird questions. Try not to rush your answers, but also I think it's important to just think about your question. You don't want to take too long, but you do want to think about it. So I have to be honest, because I know that all of our interview questions for entering the college are now online someplace. One of the students told us this. And so I have to admit, when I have students and I ask them the question and they give me the answer before I can finish the question almost, and it might be a good answer, but sometimes I feel it's so polished. It doesn't feel real, And so again, it's something that it's very subjective. But for me, I personally think it's good to take 1 or 2 seconds after the question's given, have that pensive look. Yes, I think blah blah blah, and do that. Okay, so think about your answer. How do you want to formulate it? How do you want to best answer it? Don't take 40 or 50 seconds, but just take a couple seconds to gather your thoughts. And again, as I said, just remember, interviews are just an opportunity to get to know you better. All right, resumes and curriculum vitae. So this is something that you guys have to work on, and hopefully you guys are putting this together already. Real quickly, what's the difference between a resume and a curriculum vitae? So resumes are essentially just a very quick summary of everything you've done. Generally, the resume should be about a page long. It can be a page and a half, depending on the extent of the experiences you have. So as I listed, your name, contact info, education, pertinent work experiences. So if you're applying for an associate vet at Living Desert Zoo, I do not need to know that you were a barista at Starbucks, okay? Now, I would put that down if you were a manager at Starbucks. So anything where you can show leadership or demonstrate some particular skill that is pertinent to this job, I would put it down. So as an example, maybe putting down that you're a barista at Starbucks would be good for an internship in the sense that you tie it in your cover letter to say, I'm very comfortable handling a high caseload. While I was a barista at Starbucks, we would have blah, 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 and I had to manage 5 orders at the same time, blah, blah, blah. It shows continuity. So the resume or your CV should tie in well with your cover letter. Use that cover letter to highlight specific aspects that are in your resume, okay? Research publications, if you have any, awards, honors, and then pertinent extracurricular activities, and we'll go over each of these in just a second. In your curriculum vitae, you have your name, your contact info, pretty much everything the same thing, but a little more. The only thing here is that The only thing here is that it's going to be more in depth. Okay. So you can definitely put more information in here. You don't have to be as restricted. So when it comes to your resume and you're putting your work experience, you're just going to put 1 or 2 lines as your job description versus in your curriculum vitae, you can expand it out to maybe a paragraph if it needs it. Okay. You don't want to put extraneous stuff in there, but absolutely you can put more in there. When wherever you're applying to, if they don't say otherwise, just send them a resume. Do not send them a curriculum vitae. So resumes, again, 1, maybe 2 pages at most. Curriculum vitae can be anywhere from 2 pages out to 100 pages. So as an example, and mine is I'll be honest, I haven't achieved a lot in my whole career, but my curriculum vitae is still 15 pages. I've read a couple of them that are close to 70 pages of faculty members that are here, because it includes every single publication, every single student that they looked at, every time they sneezed, it's in their curriculum vitae. So it's pretty intensive. Okay, so what do we want to put in this resume? So as I said, we're going to start with name and contact info. The only thing I want to mention there is just make sure your personal email is not offensive or obnoxious. You would be a little surprised what they have. So I was actually I thought it was very funny. Did you guys notice, Dr. Quinn's thing? Her connection, what was it, LinkedIn or something? Rat, or something like that? Yeah, so I mean, for her professionally, that's fine, but try not to make that your email. Like, don't put IHateTrump@gmail.com or something like that. You don't want to piss anyone off. You don't know where people stand on things. Just make sure it's a very neutral email, your personal email. Education, academics, make sure. A lot of people will put their GPA. I don't think it's really significant or important for you to do that unless you're really in the top 10. If you are, then put it down. I think that's good, okay? But remember that being in the top 10, having a super high GPA is not the end all be all. So when I applied for my very first position, this guy in Hebron, his question to me was, what's your class ranking? And I was scared. I was scared that he was going to ask that because I was not, like I said, not the most motivated. So I was ranked like number 32 out of 64. I was right in the middle. And so he goes, oh, 32. I like that. I don't want someone that's too book smart, but I don't want anyone that's too stupid either. So honest, that's what he said to me. And I said, oh, like that. I don't think, if you're ranked 32 out of a class of 100, I don't know if I'd put that on your resume. But again, I think if your GPA is really up there, if you're graduating magna cum laude or something like that, absolutely highlight that. I think it's important to show that. But also show that you have the clinical expertise and the common sense behind it. Because there are, and I don't know if you guys have met these people, I have a lot of students that are super book smart, but they don't have an ounce of common sense, and I would not hire them in my clinic. They can remember everything, but it doesn't mean that they can put it together in an applicable way. When it comes to your education, just include the major institutions. You do not have to put down everything that you went to, especially for the resume. For your curriculum vitae, you would, but for your resume, just put the places that you got a degree from, okay? I know many times, many of these students have gone to 3 or 4 institutions before they got their bachelor's, which is fine, but just put the final one down. Because really all we want to know in terms of this is that you do have a bachelor's, that you got it someplace. Work experience, again, just limited to pertinent experiences, as I said. That's going to be really important. I don't need to know every single summer job that you had. If you do have room, provide concise descriptions. So this, excuse me, and we'll go over some examples, but it just depends on how long, how much information you have. If you're already close to pages, I would skip the job descriptions. But if you have, if you're only at 1 page or less than a page, yeah, put in some job description or describe what you did just so that you can fill it up a little more. You don't want your resume to be too short. If it's like a half a page or 3/4 a page, I'm going to say, what did this person do all their life? There's not much on here. So you do want to make it look like you have done something during your career. Don't forget the research experience. A lot of people forget that. but that does count, so make sure you put that down. And then if you had very clinical experience, I would encourage you to do that. Again, it sort of depends on what you're applying for and everything, but it's nice to say, even volunteering, you know, let's say again, I'm going to pick on zoo vet. If you're going for a zoo vet job, even if you're volunteering with a large animal vet just to get some experience and you do it once a month or whatever, it doesn't sound like a month, but just put it on there so that I, as the reviewer, will know, oh, they're making an extra effort to get some equine experience, or they're making extra effort to do this, or to shore up their weaknesses. That says a lot, okay? So if you have very clinical experience that you can put down, all the better. Honors and awards. I put this down mainly because it is honor and award season right now. If you guys did not see that, you guys can apply for scholarships right now. I want you guys to do that, okay? I know, again, this sort of falls into the whole I don't like to sell myself type thing and all that, but get the honors and awards. And mainly the big reason is, and this is what I tell all my students is, I am focused totally on your resume. At this point, when you come to me and ask me advice for the future career, all I'm going to say is, I want to make your resume as strong as possible so that I know you're going to get the best internship, you're going to get the best residency, you're going to get the best job, whatever it might be. I want that thing to look strong. One of the ways to make it look strong is to have scholarships on your thing or have some sort of award. Yes, it's nice to have that extra money, but I'm not really doing it for that. It doesn't matter if you're getting $1,000 or $10,000 from my perspective. I just want you guys to have honors and awards on your thing to say, you have been looked at independently by a committee, and they have deemed you very worthy and a noble person, and that's why you deserve this job. Okay. So, as I said, current scholarship thing is open right now. I think it's open to the 21st or something like that. Apply for that, look at that, and consider applying. If you get research grants, if you're doing research, don't forget to list those as honors and awards. They're also important. If you have research publications, that's great. A lot of people will ask me about the research and everything like that. I think that's important to do. If you're going into any sort of research for your future career, so if you're going to lab animal medicine, absolutely, it's important. But B, if you're probably going to do an internship of any sort, you might want to consider research, mainly because right now, getting an internship is super competitive. And I've heard from a lot of people that it's really hard to have 100 applications. All of you guys have, 3.95 GPAs. You're getting all this great letters of recommendation, blah, blah, blah. So they're trying to figure out other ways to differentiate you guys. One of the ways is actually research, okay? So having research experience is good. If you're gonna do research, if at all possible, try to get a research project where you can actually get a paper out of it. It looks much better if there's a paper with you being an author. If you can do first author papers, that's even better. That's what I focus on when I have summer is I make the students that if you're going to do this, you got to guarantee me you're going to write a paper so that we can get your name on a paper and make you that much stronger of an applicant. But we have a lot of good writers here that do a lot of good work. Talk to those if you're interested in summer research, and I know that's going on right now too. As I said, authorship is super important. Poster presentation, if you can do presentations on your research afterwards, it's really important. Because a lot of times you won't get authorship, but at least do it's called the National Veterinary Scholarship Symposium, NVSS. If you can do that and make a presentation there, again, looks good on your resume. So try to do that. That's 2 years ago, we had actually one of my students actually did a presentation at a professional veterinary conference. And so that looks really good because one, it looks great on her resume. Two, again, networking. She got to go to they call it Exoticon at the time, but she got to meet a lot of great people, got her face out there. And again, that's just a way to enhance your career. Yeah. Scholarships Symposium, NVSS. Leadership. I think this is really important area for you guys to distinguish yourself from the rest of the crowd. So if you have any leadership ability that you've taken any leadership role, do that. Again, you could be the lead barista at Starbucks. That's important. That shows that you're taking care of things, that they trusted you, they hired you to do that. If you have leadership in terms of position of leadership within any of the club activities, make sure you put that down. I think that's super important. Whether it's in the school or whether it's in your community, I don't care. I think it's just really important to show. I want a good picture of this person. When I see that this person is active with Boy Scouts and Girl Scouts and maybe their religious thing and this and that, then I'm going to say, oh, this person is really community minded. This person possibly, based on the leadership trajectory, is going to be a good role model in the future. This is someone that I want to hire versus someone who has no community ties, that has no leadership, things like that. So whenever possible, if you're willing to, you know, try to volunteer and take some of these leadership roles, even if it's just I don't know, chair of some special event. You know, it may not be a long-term gig, but even if it's a short-term, hey, I was the lead person for the Street Dog Coalition for this event. Put it down. Try to do that stuff. That's the type of stuff that looks good on your resume also. Extracurriculars, sort of like what I just said. I want to see community involvement. I want to see volunteerism and then leadership capacity. All of these things are very important because again, I'm looking for someone who's going to do well in my clinic, but I also want to know that they're going to be leader, that they're community involved, and that they're well-rounded. This is the interview team, guys. I mean, it's going to be a variety of people. Each of them will have their own different focus. So there is no magic bullet as to, you know, saying A, B, and C on your resume or on your cover letter or whatever. You got a variety of people approaching this differently. So at the end of the day, just be real. Just be who you are, okay? Don't try to fake it. You start faking it, trust me, they'll figure it out. All right, resumes real quick. So resumes, they come in a variety of ways as to how you can format them, but essentially good resumes, easy to read, free of spelling and grammar error mistakes. It should be easy on the eyes. Some people try to put in some really cool fonts and this, and sometimes it doesn't work. So make sure it's easy on the eyes. Make sure it gives me the information I need. And it should focus on what your relevant skills are. As opposed to a bad resume, essentially is disorganized, difficult to read, has a lot of spelling, grammar mistakes. Sometimes they'll have some distracting graphics, and I'll show you one of those. Essentially, you'll know it's a bad resume if you don't get the job. That's really the case. Because remember, at the end of the day, all I'm doing is I'm going to look at these resumes. I'm hiring someone. I got 30 resumes to go through for this one position. I'm going to look at it and say, oh, yep, qualified. Yep. Oh, man, I don't even know what the heck this person did like this. I don't have time to really look at it, dissect it, and figure out if this is a really good candidate. So we're just going to look at, so that's why you want to make sure that, you know, it looks fine and there's no problems. And so when we look at resume formatting, this is your classic resume. I think most of you probably have a resume similar to this. And this is just a perfectly fine. There's nothing wrong with it. I will be honest with you. I'm not too sure about this paragraph at the beginning anymore for our particular field. Okay. So if you're applying for an internship, I don't think they need you to say, I'm applying for this internship so that I can become a zoo vet. I think that can come out in the interview. You don't necessarily need to say it in here. But I think if you're doing it if you're applying for a job at a private practice, it's not bad to say, hey, I'm looking for a job at a small practice with 4-doctor maximum that has state-of-the-art equipment or something, whatever it might be. And so if you can sort of describe what you're interested in, I think that's helpful, okay? Here's an example of a college student resume, which I think is a little hipper, is a little nicer, a little color. Again, it covers all the basic stuff. And I think this would be a perfectly fine resume to submit as a job thing also. Here you can see this is an experienced one. Again, just sort of looks very similar. But again, it just summarizes everything very quickly. And one of the things I like on this is you can see the skills category. It gives me just bullet point real quick. What is this guy or gal able to do? Boom, 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 boom. Are those the skills that I'm looking for? So it's an easy way to say yay or nay to this particular person. These are examples that I just pulled off a resume, the resume genius on the internet. But again, these are the typical type resumes that I see. from the applicants that I've looked at. And again, this is just fine. This one, yeah, this one's a little on the busy side. I'm not sure that I would use it particularly for our field. This, I think, if I'm going for a graphic artist position, I think maybe this might work or something like that, or maybe sales or something. But for me personally, for our profession, I don't think I would particularly do this one. All right, so I have, I think, 4 or 5 resumes that were to me by various students. And these are real resumes with names redacted, because I don't think we have a Jennifer Lopez in our class right now. So I just want to show you some of these resumes and what do I like, what do I not like about this. So this is your classic resumes, right? This is your formal resume, very well organized. I like that the categories are well demarcated. So I know when the education starts and begins, I know when the vet experience does, volunteer work, and so forth and so on. And I think also what's nice is that the categories are based on the things of importance to me. So I'm assuming that this person is going to apply for a an internship or something like that. I want to know, yes, do they have a DVM or not? I want to know where they graduated from. This particular person put their GPA, which is fine. Things, and this is sort of a very small, probably more a pet peeve, is Western University of Health Sciences. I like to put down College of Veterinary Medicine with that also, just so they know, because Western U has so many colleges, I just want them to make sure that they know that it's College of Veterinary Medicine. That's a sort of a small pet peeve. This particular resume, as you can see, is 2 pages long. And so it's right on that border of how long I want it to be. And so this is one of those ones that you might consider with the veterinary experience is maybe just being more concise, maybe just skipping one of the things, i.e. like, I don't think I needed to know that you assisted technicians with a necropsy on a barracuda. I mean, it's nice and well and good, but honestly, if I'm looking at you as a candidate for an internship, I don't really need to know that. I already know that you were there volunteering or you were there as a student, whatever. I'm sure you got to do some really cool stuff, and I'm going to follow up on that in the interview itself. One of the things that, again, that I like is consistency is under the state aquarium thing, and also down at the near the bottom where it says Dr. Veterinarian Personal Range. In those 2 categories, this person did not put what their position was, and so in the other ones, they did. So they put down like veterinary technician, veterinary assistant, study abroad student. I personally like that because I know what that person was expected to do because they gave themselves the title. Versus these, I'm not sure. When you went to Dr. Veterinarian as a personal ranch, where you gained hands-on experience, but what was your position? Were you there as a vet tech? Were you there as a ranch hand? Were you there at what? And so I just like consistency when I see these things. So that would be a very small criticism of it. I do like in the African wildlife medicine course, this person delineated the animals that she or he worked with. And I think it's one of those things that if this person is applying for a zoo job, then it's important to me to know what kind of experience they had versus, if they're applying for just an internship in small animal medicine, probably not that important. And I'm not sure that I would waste the space on it. So this is where you sort of have to tweak your own resume to see what's important, what's not important.
Hello. Okay. I was wondering when you would put references down on your resume, because I know for internships, most likely they'll be asking for letters of recommendation, but for jobs, would they want references?
I usually don't. I just put references upon request. And the reason is that because of what you need to do is you need to get your foot in the door. Once you're in the doorway, they'll decide whether or not they want to open it further and ask you for references. If they don't ask you for references, you know that they're going to close the door on you. Okay. One thing I would change somewhat is the volunteer work. And so down here, they put down volunteer work. And the only reason I do that I would change that is because to some extent, it just sort of says that everything else was not volunteer work. if this is volunteer work, and granted, the way it's categorized, it's sort of hard to know what was paid, what was not paid. But volunteer work would be good. I personally would probably put community outreach or community involvement or something to, again, just to sort of say, hey, this is, I care about my community. This is what I'm doing. Volunteer work is better than nothing, though. It's a good title because it says, hey, I'm willing to volunteer. I'm willing to put in the hours, the long hours to do, to support my community and things. I really like the way the person put in relevant coursework. I think that was important because it is important to this person's job. I mean, this person is probably going for a zoo or wildlife course or position, so I think that's really good to do that. And in this particular case, I might change the activities to leadership or something like that, mainly because in this particular case, this person was showing a lot of leadership. Every one of these clubs, this person had some sort of position of leadership in there. And so I think it's more important to show that it was a leadership. You weren't just a member. You were actually doing something, involved, all that, and I think that should be emphasized. So, I mean, I'm sort of being nitpicky, so these are minor changes that I would make to this, but this is a very well-done resume. This one, again, another student submitted this one. Now, in this particular one, you can sort of get a feel for this one where it's not quite as easy to read, okay? In this one, I don't know quite where the work starts and ends. I don't know where the education starts. And yeah, you can see there is some, a delineation of it. I mean, they do say education on the top, then work experience, but it's not very clear. So bolding it, underlining it, just something to make it so it's more clear. And then to do that consistently. So education was underlined, work experience wasn't. Again, I know I'm a stickler and everything, but it just looks weird when it's not consistently done across the board. So you just want to make sure that you consistent with that. Now, full disclosure, this particular document, when it was sent to me, was actually 3 pages. So it was actually way too long. It has to be in 2 pages at the max. I mean, unless you are Murray Fowler, you really should be able to fit it within 2 pages, okay? So my resume, I think, is about 1.5 pages, page and 3/4, something like that. But you just need to really cut out a lot of the stuff that's not important. Work summary, I think it's okay. I mean, there's a lot of job description in here, but because this is so long, this is where I would really chop out probably half of it. I keep some of it in just to emphasize what I did, but probably not as much as this. And I'm going to show you another resume that I think actually does a very good job of summarizing their job responsibilities. This one is a little wordy for me. And then the education in this particular case, this is a student that actually went to multiple schools. I'll be honest with you, I don't really care about where they got the high school stuff. I don't care that they went to Woodbury University. All I care about is they did get a bachelor's from there and they're going to get a DVM and all that. So that I would just tighten up and get rid of that sort of stuff. You guys have any questions? Feel free to ask as we go. These are just going to be rambling about stuff like this. All right, so in this particular case, the student, some people ask me, is it better to put your work experience first or relevant experience first? I don't know if it matters too much. It sort of depends more on the job that you're looking for. Since most of the stuff that we do is going to be very veterinary related, usually the relevant experience or veterinary experience goes better first than work experience. But if you were applying for something that wasn't veterinary related, then I think it's one or the other. It doesn't really matter too much. Let's see. Under the tails and snails, I do like how this person put assisted with property maintenance, cleaning enclosures. That says that this person has skills. So if you have opportunity to put something in there where you were doing something other than putting in catheters and getting blood from the animal, put that down there. Maybe you're in charge of fixing the kennels all day, on some days. Put that on there that you have, basic hammering and carpentry techniques or whatever it might be. So we just want to know that you guys are, again, well-rounded. So I did like that part. In the college town, under work experience, college town. It says gained experience with gathering patient. You don't need to say gained experience. We know you gained experience. That's why you're putting it down. So again, just be concise in your verbiage so that you can keep it as clean as possible. And then just my last little pet peeve is under the genetics lab, you can see there's a formatting error with in terms of how the bullet points are and where the thing starts. Those are the little things that show detail, attention to detail, and that's what the people are going to be looking for. I want someone who is going to pay attention to detail. Yeah, so this is the one that when you look at the experience, I really just liked how they wrote that all down in terms of it was just really concise, very helpful. I think the only, and again, this is a very minor pet peeve in the experiences for that VCA Bay Area, I probably would put that in the past tense. It's not assist, it should be assisted the doctor with, blah, blah, practiced exam skills, whatever. But it's just very concise, which is nice. I think they did a good job there. The second page, just so you guys know, it's not a different font. I just enlarged that because it was on the short side, but that looks fine over there. I would say though that the VBMA activity that person put there, that one will probably go first because anything that is in the present, remember it should be in reverse chronological order. Anything that is the present should be at the top of it. And then the next one would be the vice president of the vet school club. And then after that would be the, oh, excuse me, I didn't notice that the Vallejo thing is actually present too. So those two should be at the top and then the vice president of the vet club should be actually the next thing down. Yeah.
I think that's
Yes, I would put that first because it's chronologically. So unless you're not going to put it at all, if you're not going to put it at all, I'm trying to think of something that you could say that's not, totally not. What are you thinking? What example would you give me? If you're applying for a veterinary job and you volunteer for Habitat Humanity, I would put that down because now I know that you can sling a hammer and that you actually are spending time doing volunteer work. That would mean a lot to me. Yeah. If it was present, yeah, but this one, they put down, it was June to July, it was over. That's why I would change it to past tense. Yeah. Other questions? Oh, let's see. This one was submitted by Charlie Brown. Again, I would just add the CVM, College of Vet Med at the top. I do like the succinctness of the job description. I think it was very well done. Again, everything was done nicely. Now, in this particular case, and I'm not exactly sure why, but again, the employment experience is not chronologic for whatever reason. And so I want that, the vet tech position should be at the top because that was the most recent. Then should be the animal hospital kennel attendant, and then the physics teaching should be the last one. So it should be in reverse chronology because I want to know what you've been doing most recently first. And this particular person, I'm not exactly sure why all the organization things are fall 2023. Maybe it was just for anonymity, but again, just correct that if that's not. Oh, okay. That's all the resumes I have. So I haven't talked too much about CVs as honestly, I don't think you guys are at that stage yet. I mean, I think most of the time you're going to be doing resumes, but obviously the principles that we talked about will apply. It's just in the CVs, you're going to be able to do that a lot. You'll be able to do a longer thing and be more, share more information on there. The one thing I do want to emphasize, whether you're doing a resume or CV, remember that those are not going to be static documents. They're going to be living documents that are going to change based on what you're going to apply for. So I'll be very honest with you. I actually have a CV for general jobs. I have an academic CV. And the reason is because in academia, and I learned this the hard way, is they want to know every course I taught. They want to know every student evaluation. They want to know every administrative thing I did, blah, blah, blah. And so that CV is like 5 pages longer than my other CV is. And so you're gonna change your resume based on what you're applying for. So my resume for a zoo job is different than my resume for a exotic companion job. And I'm gonna do that by focusing on the various aspects that I think are more important that'll get me the job. So don't be afraid to tweak your resume or your CV accordingly as you need to do that, okay? Couple of things that I'm just going to say, these are sort of pontificate over things that a lot of students will ask me over the years, and I want you guys to know this, is when you graduate, like I said, you're going to feel as if you're prepared, but you guys are going to be better off than you guys ever will know. I want you to approach, when you get out and go into practice, whether you're an intern or whether you're going into the job, I want you to approach it knowing that at some point you're going to make a mistake. If you go in there saying, I'm never going to make a mistake, it's going to kill you when you do make that mistake. And yes, you are going to make that mistake. Okay. I'm not ashamed to say I have made mistakes over my career. I've made mistakes that I think actually has cost the life of an animal. The key thing in those particular cases is to learn from them. Do not make that same mistake. Okay. So I want you to be prepared. You guys will do well, and you'll see that you actually know a heck of a lot more than you suspect you do. Real quickly, internship versus mentorship. This is probably a big question. A lot of students ask me about this. So you can do this internship, which I told you is just a very consolidated thing where, you know, you have people doing journal clubs, teaching you about cases, giving you heavy caseload so you have someone to help you. One of the things that you're going to see, a lot of private practices have said, oh man, we're losing a lot of people to internships. We can't hire anyone because there's no one there. So they started creating these very strong mentorship programs. So every practice that I know of will always say, oh yeah, we mentor you, we're going to do a mentorship program. And they've created these mentorship programs. Understand, I'm not here to say one is better than the other, but I want you to just realize there are good internships, there are bad internships. There's good mentorship, there's bad mentorship. The only thing I can say is do your due diligence in terms of researching that. Talk to someone that's been there so that they can tell you what was life there as an intern or what was life there as a new graduate. Make sure you understand that, okay? Because I can guarantee you, you're going to have all these people, oh, I got the best internship. You're going to do A, B, and C. We're going to meet with you on a weekly basis. And you're going to find out that all you're there just for cheap labor for them. Okay, they're not teaching you. So I don't want you to experience that. Again, the only way you're going to find out is if you do your homework and ask questions. If you go into there are various Facebook pages for each of the class years. I know that. And then I don't know if they're doing anything on Instagram or any of the other social medias for the different classes. But, you know, I would start usually with your big SIB is the way to go. And just say, hey, you know, do you know anyone that did an internship at this location or something like that? That'd probably be the best way. If you are interested in internship, consider using your year 4 to explore those locations. And the reason I say that is because you have those, like I said, those externships that you can do. So if you're interested in going to VCA West LA, do an externship there, and that gives you a whole month of being there, seeing what the life of the intern is, and that will give you the best idea of, oh, do I want to be in this environment or not, okay? Don't be afraid to apply for positions that you don't think you are qualified. I'm going to tell you this because a lot of you will doubt yourself. You can say, oh, I don't have the years of experience. I can't do that. Just apply for the position. The worst case scenario is you don't hear anything, you don't get the position. I've applied for many positions that I didn't get, but I have gotten many positions that I was not qualified for, and I actually thrived in those positions and I did well. Especially with the Western U teaching, you guys have incredible ability to learn, look stuff up, and just garner the strength and the ability to do what they need you to do, okay? And so just because you haven't, I don't know, castrated 5 elephants, it doesn't mean you don't deserve to get the job, okay? Again, at the end of the day, these people are looking at you personally to see if you fit their team, okay? So don't be afraid to apply for a position that seems to be out of your range. And then when it comes to picking the place, when you get down to that, because you're going to get a lot of year, okay? Going to send you to various practices. These people are going to say, oh man, I really like Candace. I'm going to offer her a position right now, lock her in before she has a chance. And they'll do that. Banfield did that to one of my other students, which I really was pissed about. But honestly, he did very well, and he's very happy with Banfield. But I would them in on a third year thing. And so he didn't have an opportunity to talk to the other practices. I guarantee you, you get one offer at this place, you're going to get multiple offers. Don't take the first one. And when it comes down to it, when you have 3 or 4 places that you really want to think about, at the end of the day, just go visit each one and think about, do I like the environment? Do I like the feel of this place? Does it work for me? Because at the end of the day, I can pay you twice the amount to be in a place that is really crappy environment, and all you're going to do every morning is, oh God, I got to go to work. You don't want to have that, okay? I've been very fortunate. Every job that I have had, I've always enjoyed going to work. So it's like they say, you know, if you enjoy your work, you're not really working, right? It's a big holiday. So do that. So think about that. Is just make sure that you get the right place based on just the environment that it works for you. Last slide. Just remember applications, including that resume and cover letter, they're just the way to get you in the door, get your foot in the door. Interviews are the way to open that door wider, okay? So it's important to make sure that you make a good impression. Don't be afraid to sell yourself. This is the hardest thing to do, but don't be afraid to do that. And I don't know if you guys know this term. There's a saying, but it's not buttocks. But don't let the door hit you on the way out, okay? You want to make sure you take advantage of every opportunity that you have, all right? So, awesome. I think you guys are going to be doing great stuff in the future. I have faith in you. Thank you for your time. 4 o'clock, done right on time. Guys have any questions, I'll be glad to stick around, answer questions, and you all have my email address, so at any time, feel free to reach out to me. I'll be glad to advise you. I think most of you know I'm also Director of Clinical Relations. Questions about your sites for 3rd year and 4th year, I'll be glad to answer that. No, I do not know what's happening 3rd year, so do not ask me that question. I do know that we're sending you guys out. You guys are going out. I think it's going to be very similar to the current year, is my understanding. So, but I can't guarantee anything.
Great question.
I thought Dr. Levy just sent something to you guys, didn't he? No? Okay. I'm going to predict that you're going to find out probably within the next month and a half. Because I know that we just did the availability. We asked all of our preceptors when they can take students. And so once that is magically put into some spreadsheet, it gets sent out to the students for you guys to decide. Okay? That is my guess. Do not hold me to that because he will kill me.
Thank you, Dr. Ang.
Well,
And thank you, everybody who showed up here in person. We appreciate it a lot. Thank you. Thank you. And then also just as a heads up to you, first years, we are sending out board applications on Monday. So just a heads up for that. And then, oh, yes, we did in the email, but it's coming out Monday.
a lot of work.
A lot of work.
I am a slave driver.
No, I'm just kidding. It's great. It is great. Okay. But yes, and then as you may know, unfortunately, the Ferret Lab is canceled. But next day 2 symposium will be great. So see you then. Thank you all. Yes. Day 2, you can come in your scrubs and stay in your scrubs. Yeah. I'll send out another email, but scrubs.